coming along and joining us. And so a big hello to everyone who is joining us for the session, Entrepreneurship Frameworks and Systems Thinking with Tools for Problem Solving. My name is Catherine, and I am beyond delighted to have our speakers, Billy, Serene, and Ngobu along with us today. So thank you to all three of you joining. And so as we have heard from the first, yesterday's proceedings of the first day of the conference, there is this inherent connection between health and environmental sustainability. And this connection really calls for greater adoption of systems thinking to navigate all of its interlinking complexities. And so in 2015, Arnold and Wade actually gathered a lot of the definitions of this discipline from the systems community. And they have postulated this definition that encompasses the discipline quite well. And so they posted that systems thinking is a set of synergistic analytical skills used to improve the capability of identifying and understanding systems, predicting their behaviors, and also devising modifications to them in order to produce some desired effects. And these skills work together as a system. And so in diagnosing the complexities of planetary health, entrepreneurial frameworks can help us devise thoughtful solutions that address stakeholder pain points in ways that are economically viable and also scalable for far-reaching impact. And so it has been noted that entrepreneurial frameworks and particularly education and systems thinking for health and care workers are not yet readily engaged with. And so part of the core training of the curriculum is kind of missing this aspect that could be widely beneficial in terms of developing this innovative behavior that is such a key determinant for healthcare transformation. And so hence, to share their experiences and also raise awareness of these tools, I would now like to invite some of our speakers for this panel. And so first we have Ngobu Minbe Elfe Sezlik, who is a medical lab technician working at Medpedia Center. He is passionate about reproductive health and also social digital mobilizer with the Ministry of Public Health in Cameroon. And he has proven experience garnered across public, private, and nonprofit institutions in Africa, where he worked across programs, training, projects, policy, and research. He runs Yes Health, the leading organization facilitating access to sexual and reproductive healthcare, promoting gender equality, and also healthcare through digital means. Aside from this medical practice, he's interested in global and public health, and in his work, he advocates for meaningful youth engagement and health across Africa. Ngobu, it's a pleasure to have you here. Would you like to share a few words to some of those who are joining us today?
Thank you so much. It is a great pleasure, and working and exchanging with young people like me, it is really interesting. And because I think that together we can find out a lot of solutions to tackle on daily problem in order to make humanity a better place to live. Thank you so much.
Thank you, Ngobu. Thank you for joining us. And also we do have Serene Habal. She is the talent lead for Unleash. She is passionate about social innovation and youth development. And her current role at Unleash allows her to work with innovative young social entrepreneurs from all over the world, working in different sectors to address global challenges. And previously, she worked at UNICEF as a communications for the development officer. Her work focused on health and nutrition, hygiene, promotion, and also social and behavior change campaigns within humanitarian settings. Aside from her work, Serene is interested in the intersection between communication and sustainable development. And so Serene, it's also a pleasure to have you here. Would you like to also say a few words to some of our participants here today?
Yes, thank you so much for having me. It's really super exciting to know that there are young people that are really interested in changing up the health sector and finding new ways to address some of the biggest challenges and that the health sector is facing. So I'm really excited to interact with this group, and I know that there's a lot of things to discuss when it comes to systems thinking within the health sector, since it sits in a very intricate place and it crosses over with so many different sectors as well. So it's nice to know that these things are taken into consideration and people are trying to address them and come up with more innovative solutions today. And yeah, I'm really excited for the conversation.
You're on mute, Catherine.
Oh, sorry. Thank you for that. But also thank you, Serene, for those few words that you just said. And I'm sure a lot of participants here also resonate with that idea of your innovation being at the core of this. And so I would also like to invite Billy to join us today. Billy is a management consulting professional employed by Accenture Australia. She's coming up to 10 years with the firm now. Billy works across the health ecosystem, including federal, state, and community government organizations, as well as the private sector and startups. And she has also worked with clients of other industries, such as telecommunications and human services. And her work tends to be focused on consumer-centric operating models, which are like a redevelopment that also considers internal employee experience. And she has also worked extensively in the areas of change and adoption, workforce transformation, digital enablement analytics, and cross-sector engagement models across both Australia and New Zealand. And Billy is adept at using design thinking techniques, which will definitely come in handy with this panel, to facilitate and reimagine consumer-centric change. So Billy, if you would also like to say a few words as well.
Thank you, Catherine, and thanks so much for inviting me here. I didn't realize my bio sounded so long when you just read it. I'm pretty sure I'm sort of on the cusp of moving out of the definition of youth, but that's okay. Yeah, really pleased to be here. I think this is an awesome topic, and you can see just the difference of our backgrounds. Hopefully this will be a really good discussion for this evening, for me anyway, in Sydney. Yeah, great.
Thanks for that, Billy. And just two participants who are joining us today. This will be a 45-minute panel followed by a 45-minute interactive session. And so first we will just start with the panel. And so to kick us off, I do have a general question to everyone here in the panel today. That being, with systems thinking fundamentally looking at low-key components, at how key components in one system interact with another and the unique role it kind of plays in the bigger picture. So from your perspective, how can adopting the habits of the systems thinker sort of improve health workers' everyday work with patients? So perhaps if I could maybe start with Serene, and then I could go to Billy and then Global.
I'll go ahead. I think system thinking is super important and really crucial right now with addressing some of the challenges that the world is facing in the health sector, and then also looking at how this overlaps with so many different sectors as well. I mean, with COVID-19 and how the world is changing in terms of climate change, we really need to rethink the traditional ways of doing things, because we've realized, especially with COVID, how much inequality there is with the systems that are in place, and there are communities that are just more vulnerable than other communities, and we need to ask ourselves why this is happening, and systems thinking can really help answer that as a tool to kind of understand what are the roots of the problem. And I think even with Unleash and what we do at Unleash is basically a mini version of that. We have global innovation labs where we bring people from completely different backgrounds from all over the world to come together and try to address some of these challenges. And the methodology we use is really iterative. So it keeps on coming back to the soul, like the center point, which is why is this happening? And then people will, like the talents that are at the lab, will keep on digging until they find root causes to the problem and how it can intersect with different sectors as well. So it becomes like this huge puzzle piece. And I feel like that's really what we need to shake things up within the health sector and make it more efficient and more effective. I mean, this year at the lab that we're organizing at the end of the year, we've decided to have 2 health tracks because we feel like there's generally a huge gap within the health sector. We're addressing mental health issues and non-communicable diseases, and we're not just looking at them from a high level of like, okay, what are the problems we're facing within like diagnostics, but also like, what are the tech solutions that we could come up that will help health workers make their jobs easier, make accessibility to these services easier in remote areas, really understanding these specific sub-themes that exist within these big umbrellas, and trying to understand and get to the roots causes, and then developing these solutions that would probably address address the challenge much better. And I feel like this is what we need to really help push planetary health forward and make sure that we're coming up with things that are viable and actionable and not just things that can be put on paper. We had one group from, I think 2 years ago, that came up with an app that streamlined the process of distributing tools to local communities in remote areas in Nigeria, and they've really managed to touch a crucial part within the health sector in Nigeria, that they've received, like they just told us that they've received their 2nd round of seed funding. And it's really because when they sat down and started thinking about the problem, they found what are the major sensitive points or weak points, and started asking, how can we fix this, and why is this happening to these communities, not to other communities? And I feel like this is the best way to come up with really strong solutions that can push the health sector forward and make it more inclusive to people that may have been left behind otherwise.
Thank you for that, Serene. And I think when you were just talking just then about trying to the need to create solutions that have efficacy in the way that they actually tackle some of these problems. Yeah, I think that's such an important detail that we always need to remind ourselves of, especially with these conferences, to really focus on like action more than talking as well. So thank you for that. And I might go to Billy as well on this question. Yeah, just pretty much, what are your thoughts on how the adoption of systems thinking can improve health workers in terms of their day-to-day sort of work as well?
Yeah, look, it's a great starting question, Catherine, and great setup, Serene. Agree with a lot of the points that you made. And I think systems thinking can actually mean different things to different people, right? Depending on the roles that we play at work and in life in general. And I think ultimately systems thinking is a mindset rather than, we've got a lot of tools that we can apply, right, to do with systems thinking. But it's the mindset that really matters, and I think is going to move the needle on broader health outcomes. So moving beyond that sort of single narrow view of the isolated interaction that you might have one-to-one with a patient, and thinking and appreciating really the complexities of the broader health system, the ecosystem of organizations, of people, broader community, needs, motivations, the challenges and the interdependencies that have an impact to patients. And I know that can be kind of overwhelming, right? Feeling like, oh gosh, to really appreciate that, I've got to understand everything and all of the touch points that patients have with the system. And I don't think that's necessarily true. That's not really possible, right? You can never fully understand the jigsaw puzzle that is healthcare. It's pretty complex. But I think if you can have that mindset of just thinking beyond the one-to-one and an appreciation of the broader sort of landscape. But actually, as I was preparing for today, I came across a pretty funny metaphor, which was used to describe systems thinking. And I thought I might sort of bring that up here today, just to, I guess, set the scene for what we're kind of talking about. So if you think of your favorite comfort food, and mine, to be honest, would have to be a hamburger for something that I would make at comfort at home. If you know any Australians, you know we love a good barbecue. So the burger itself is pretty simple to make, right? You get your meat, you put it on the barbecue, you toast your bun, you put your cheese on, you've got your lettuce. Maybe you might add some mustard. I love pickles, so I tend to add a lot of pickles to my burger, tomato sauce, whatever it is. Seems pretty simple, the process of doing that. You do all those things in sequence, and then you've got your burger and you eat it, and fantastic. But if you kind of stand back and think about all the kilometers, the miles, whatever language you use, the steps, the different networks that are involved in putting together that burger. Where did the meat come from? How was the cheese produced? You know, the mustard seeds often come from India. Turmeric, paprika might come from Hungary or the Netherlands. Salt water, vinegar, lots of different countries. And if you like a fancier style of mustard, it might be prepared in France, for example. So all of those things that sort of happen in the background for you to come together and have that simple interaction of putting together a burger on a Saturday afternoon is kind of what we're talking about here. It's the food chain and all of the things that kind of go into it. So an example there is, like, let's just say we had really warm weather or a hurricane or some kind of natural disaster, and mustard seeds weren't available, right? So you might have a steep, sharp increase in the cost it takes to buy mustard off the shelf at a supermarket. It might even ultimately give a reduction in demand for burgers in the place that you live in if you don't enjoy eating a burger without that kind of condiment on top. So I think systems thinking sort of helps us to understand the unintended consequences of these things, because it's never that simple, particularly in healthcare, right? There are lots of different things going on. So yeah, and I'd just say, number one, I think it's about the mindset rather than getting caught up in trying to have the answers to all of those questions, but just the appreciation of that broader complexity. Yeah.
Thanks for that, Billy. And a very interesting metaphor in terms of framing systems thinking. I'd never thought about that ever when I was coming across with systems thinking frameworks. So now when I look at systems thinking, even part of coursework, I'm just going to have comfort food in my head from now on. But thank you for that. And I think especially when we talk to a lot of young participants about needing to expand beyond what you're seeing immediately day to day, it can get very overwhelming. And when we always talk about healthcare is complex, it's almost too overwhelming to start. So I think that's a really encouraging point that you've sort of put forward to say, it's just about having that eye on like a bigger picture, but it's not to the point where you need to understand all the intricacies to the point where you would be put off starting. So
yeah, exactly. It's the human element of healthcare, I think. Yeah,
exactly. Great point. And if I could also go to Ngobu for you to share some of your thoughts on this in terms of how adopting a systems thinking mindset can help youth, especially with health and care workers.
Okay, thank you for this question. I want to say that what makes intersectoral problem solving in global health unique is that it follow 4 level model. The first is information. The second cooperation, coordination, and integration, leading to the integration of health into all, public policy through intersectoral action for health. This means that, at each level position of the health sector remain decisive but varies. And we have been seeing with the COVID pandemic, there was, a certain cohesion and joint work between different health sector and, climate worker to control these diseases. And for in 2019, precisely from 28 to 29 October, I was invited by the Ministry of Public Health on a workshop, on the simulation exercises on the management of public health emergency in Cameroon. And there was, as partner, there were World Health Organization, CDC Africa, Center for Disease Control and Prevention as partner, but also a lot of, ministry was represented. And I wanted to emphasize that, by, working together at the end of this 3 days, we have been, coming out with a lot of, solution, a lot of innovation, in order to tackle any upcoming public health pandemic. And what I can say about, framework of that I can recommend to improve both human and health, human health and environmental, health is that, each people need to identify, even if you work on, health sector or, climate sector, you need to identify a problem around you. If you identify a problem, then, you need to connect with the stakeholder. And before connecting with a stakeholder, you need to have a solution, generating a solution concept that can guide you, and also identify partner, resources, method uh, that can, help you to to uh, to have a solution. And also after that, you need to evaluate your impact. You need to have an impact and evaluate your project. And you can also use a SWOT analysis: strength, weaknesses, opportunity, traits. And that can also help you, to come out with a solution for any problem around your workplace, or, or into your community, is really important. And I also want to say that, it is not it's not the fact that, you are going to start with a big. You can start with a small project around you. You can maybe by working, in a clinic or in a hospital, you can, identify any problem, a small problem, and, apply the steps in order to come out with any solution. Thank you.
Thank you for that, Ngobo. And I think it's really interesting how you've kind of outlined this framework, almost sort of like a set of steps that you kind of just follow to kind of create these, a lot of the community impact work that you've done as well. And so I remember even just chatting with you previously before this session about the things that you've done with Yes Health, and trying to follow this kind of framework that really places this emphasis on just, helping the community and doing whatever you can to try and strive and push that forward as well. So thank you for sharing your thoughts on that. And if I could go to perhaps Serene next, really just like we have seen the Lancet Planetary Health article, which has been sort of published around the need for a planetary health perspective that really embraces systems thinking for addressing the gendered implications of the COVID-19 pandemic. And especially with that pandemic, which has shed light on existing inequalities within health systems and also in numerous areas that have further decreased access to care in already disadvantaged population groups. In this kind of context, how can we sort of conclude that a solution or approach isn't really working? And what are some of the strategies that perhaps you have used or perhaps could also recommend to really pivot effectively and most importantly, without losing morale?
Yeah, that's a really important question, because even when we talk to like the talents that join our innovation labs, we often ask them if they're continuing with their projects and why, if they're not. And the most common reason is usually that they took their idea, they did a prototype and they thought it was a viable solution. And then when they started implementing it in their target communities, they'd find that it doesn't address the needs as they expected it would. And then they find that maybe the way that they're approaching the implementation isn't the most practical method. And so this is one of the most common things between the teams after we've done our surveys and everything. And that really makes you question, why is this happening? And then it goes back to probably when they were putting their solution together, they may have made certain assumptions or took certain decisions when they were trying to understand the needs or the root causes of the problem itself. And so the best way to really address this is by accepting that it is okay to make a mistake when you are coming up with a solution, and that it is a genuinely very iterative process. It is in no way a straight line where you start and you're like, I think this is the most brilliant idea and solution for this problem, and it's going to go from A to Z directly. And it's when you accept that you're probably going to go from A to B to C and then C back to A maybe, and then you might jump again to D and then go back to C. It's really just back and forth, and it's that time when you're asking the right questions that you really get to the source of the problem, and that's where you can really put a solution that can push your goals forward or push health services forward. It's really just accepting that and having that kind of mentality when you're working in this space, because it's really easy to start getting attached to some solution and thinking that this is just what I want to push forward and this is the best idea there is, when really it might not be. And it's okay, because also these systems, like we keep on saying, they're super complex. I mean, Billy's example really put it in perspective. They're super complex and there's a lot of moving pieces, and things sometimes with time change. And so you have to continuously keep asking yourself the right questions to make sure that you're developing solutions that are in fact useful and beneficial to the target communities that you're working with. And like I said, we see many versions of this with the teams that we work with, because they're doing this in 7 days. And you can see them, they start with the problem framing when they're asking themselves, why is this the main problem that we face? And then they think they've found it, and then they go and they're like, okay, so this is the solution. And then the facilitator comes up to them, they're like, did you not think about this, this, and this? And then suddenly they're like, this throws us completely off our track, and that's normal. And once you're there and you're in that state where it's okay to backtrack and start over, it really helps you and it keeps your morale and momentum going, knowing that at least you're still moving and you're making progress. You're not stuck in a place where you're really focusing on and investing in like something that might not necessarily be the most needed solution out there. And really, I think systems thinking is amazing in that sense, because it really is a diagnostic tool where you really get to understand what are the different things that are going on out there and how do they all fall in place. Like you said, there's no way that anyone can completely grasp everything that is going on, but just by asking and following the steps and asking ourselves the right question, then you're already getting to a much better place in terms of whatever idea you're trying to develop or solution that you're coming up with. So I think that's the best advice you can give someone that's working within an innovative space, trying to come up with new solutions, is really, you need to accept that it's okay to go back, to take back a few steps and ask yourself the questions of why is this happening? Why do I think this is the best way? And eventually you'll come to the conclusion and make the pivots that you need to get back on track.
Exactly. I really resonate with what you've said there, Serene, as well. Just on the point of, even if you're quote unquote failing, or like what Billy has sort of said in the chat, failure really is key in pushing forward and developing new ways of going about things. And I think that's often something quite comforting for youth, especially, when we pressure ourselves to say, oh, we're not sure if we're going exactly the right way. And we're always, just really eager for wanting to have progress. And when we're unsure of, whether that progress is actually moving us forward, I think this idea of, that it's okay to fail, it's okay to go around several times. I think that's something that youth can definitely sort of internalize as well, to say that it is okay and that it is in fact normal, and that if you're not failing, there's probably something wrong actually. So yeah, really thank you for those words on that. And Billy, if I could go to you next then, to talk a bit more about some of your work on consumer-centric operating model redevelopments. I know you've done a lot of work with that previously throughout your career. I just wanted to ask, mainly because, Albert Einstein famously once said that obviously we cannot solve a problem with the mindset that created it. And so from your experience, perhaps if you could share, how can youth move beyond this kind of business as usual to devise creative solutions that are both sustainable and also scalable in the long run for improving working conditions for the youth health workforce?
Yeah, awesome. And I think that discussion about failure is a good segue, probably in answering this question. So I guess I'll try and answer this both at a systems level, in keeping with the theme for today, but also then sort of start a bit of a discussion around what we can do individually to kind of address that. I would actually argue that at a systems level, there's no such thing as BAU, really. And I feel like at Accenture, where I work, and I've been there, as you say, for coming up to 10 years now in our health industry group, year on year, actually, since I've been at the company, we've been talking about the fact that we're in a time where the pace of change is greater than ever before. And sort of every year it feels like that same old tune, right? So much change, what are we going to do about it? But actually, when you sit back and think about the fact that we have been talking about that for almost a decade or longer, the pace of change is not only increasing, but it's really increasing exponentially. And I think whilst that's really exciting, it's also a bit of a scary phenomenon, right? When it's just things are sort of moving between our fingertips before we can even grasp them, I think, in healthcare, particularly in digital health, and that's the space that I work. But if you look at an organizational level, and I've done a lot of work in change and transformation, typically we find that 70%, sometimes more, 70% of transformations fail. And I think it's worth reflecting on, why is that? Why do large change programs fail? There's something to be learned in that, and we probably can't cover it all off in a panel session here, but I think one of the biggest reasons comes down to organizational culture, right? So culture being the phenomenon that really dictates how we interact in the workplace, how we see ourselves and define ourselves in the construct of that organization that you work in. in healthcare or in other industries as well, which I think is encouraging to youth, because typically it's the younger generation, the people who are starting out in their careers with that fresh thinking, that naivety in the best possible way. I mean that. It's fantastic to have that creativity come through an organization. And when I first joined Accenture, and as I said, I think I'm just meeting the definition of youth according to the World Health Organization. But I had very few preconceptions about what Accenture was, what we did, how I was to behave in the organization, what my role was, what the expectations were of me. And that was fantastic. And I reflect on that part of my career and just think it was amazing. And I wish I sort of appreciated it and grasped that a bit more, because as you move up in an organization, the culture really has an impact, right? And leadership has a lot to do with that, the messaging that we get from leadership in organizations. But I just think, yeah, when you come in and you've got that fresh focus, it definitely has such a big impact to ways of working, really. Fantastic. The one thing I would say, though, that I think might prevent the youth from making an impact is confidence. And maybe that's just for me, but in my 20s, I sort of felt that people were judging me if I had a different opinion, that maybe it was that the most mature or the most experienced person in the room had to speak first before I could speak. So I would just empower everyone on this call to just speak up, get comfortable being uncomfortable. That was a piece of advice I had very early on in my career. And now I find that once I'm in a role and I feel comfortable, it's actually an indication for me to move on and try something new, right? Approach something with fresh eyes, because if you feel like you understand all the problems, that's an issue, and you've got to kind of move into a fresh area where you're in the deep end and can kind of start again with that systems view of getting on top of it and feeling like you're growing as well in your career and as a human in healthcare. So, yeah.
Thank you so much for that, Billy. I think it is really interesting how, both yourself and Serene have kind of raised the idea that I think a lot of what kind of holds youth back is that lack of confidence in saying, do I actually have a right to speak? But I think also, echoing what Maria Neira said during the opening session, that we do really have to have this ambition to kind of move forward and to, be a little more aggressive in making sure that our voices are heard, especially to policymakers and, like what Billy, you said, even within company culture, to kind of take hold of this advantage as youth, of having really fresh mindsets and bringing something a bit different to the table.
Yeah.
So I think
it's a good way of putting it. Be a bit more aggressive. I often encourage my team at work to be more bullish in a lot of situations. So if you want something, see that sort of red, go after it. Don't second guess yourself. Just step out and get there.
Yeah, exactly. And if I could also ask Ngobu to maybe expand on this, because Ngobu, I know you work a lot with youth, especially in Cameroon. What are your thoughts on, especially like how can youth and exactly what advantages do youth have in this kind of area in terms of going about to make change that they really want to see within their community? If you could possibly add to that with some of the experience you've had with youth in Cameroon.
Okay, thank you so much. First of all, I wanted to say that young people have the energy, have the responsibility, to make things going on. And also, according to the African Youth, Charter, every young people has the right to enjoy the highest attainable standard of physical, mental, social, and spiritual health. I have an organization, and I'm also part of a lot of organization, and also I really think that young people uh, have to work together, have to be patient, and have to get interest, in subject that can, matter like, technology, health, also energy, and by getting engaging, gaining experiences, bit by bit, they could able to, to bring something new, they could be able to stay health, healthy. They could be able to, attract, partner, or working with government in a lot of subjects that, destroy our world. So it is really important for young people, to be confident, to start to do something. And also concerning health, there is a lot of facility, even at each country, because health domain is really it is a priority, meaning that young people, because they have this energy, they have this they can think, and also they can get engaged because they have this power, this talent. They can get together, to find something, build something, and propose. By proposing, they could have, accompaniment, and also achieve, a lot of goals. So that's my small experience. That's a small experience I wanted to share. Yes, thank you.
Thank you for that, Ngobo. And most importantly, thank you again for all of the work that you do, especially with youth in Cameroon. And it's especially inspiring to see, all of the great things that you've done with the community as well. And also, because I know, again, from conversations that you've kind of had with me like beforehand, it is all about just trying to ensure and empower youth as well, especially in these circumstances, to make sure that they do have their say, and that policymakers do hear what they have to say as well. So thank you again for that. And perhaps if we could go around to all of our panelists for the final closing question. Something that we have touched on very much throughout the course of this panel, but potentially if we could kind of wrap this up in a few key takeaways, is really just from your experience, and especially with interacting with youth, what are some of the unique advantages do you see that they have, and especially in addressing planetary health issues, like what we've had across many of the sessions yesterday, is that youth really are the drivers of change now, especially with climate action and in the area of One Health. So if you could also just speak a little bit more potentially in the context of planetary health and One Health specifically, what are some of the advantages that youth can really kind of bring to the table in ensuing these changes? And if we could potentially start with Billy first, and then I'll go to Serene, and then perhaps we'll close off with Ngobu.
Yeah, I think it's that piece around being able to challenge unconscious bias as well in the organizations that you're from. So, having that fresh perspective, if whether you've just come from university or you're fresh into your career for the first time in your place of work, it's being able to challenge with a different perspective for sure. And I would say, just as a final word of encouragement to everyone, that you don't need to necessarily have all the answers. And in the breakout sessions, I think we'll get into more of the kind of tactical things around design thinking methodologies and all that good stuff, which is awesome. But that kind of helps you to realize that you don't need to have all of the answers, that you can actually think outside and view yourself as the sum of parts of solving a problem, solving a bigger problem. So you can kind of provide one angle or one piece of the puzzle to a problem, but certainly other people can kind of come to the table and complete that view of the puzzle and get the full picture, I would say.
Thanks for that, Billy. And I think that also really lends well to this idea of interdisciplinary collaboration as well, like what you said, to really kind of not need to have all of the bits and pieces of the puzzle together, but to at least kind of express, from my perspective, what does this look like? And what are some of the benefits and disadvantages of, going about in a certain route, like what Serena's kind of mentioned earlier. So thanks for that. If I could go to Serena next on this, just any final closing words on what you think youth have as an advantage, especially in planetary health.
I think young people now have so much more awareness than previous generations, and what are the problems within the health sector. I mean, in other sectors as well, but the health sector being one of them. And this awareness has led to a lot of people challenging the existing systems, which is amazing and very much needed. Also going back to the concept of having the confidence to do so, and making sure that it's okay to ask and challenge these things that have maybe been accepted for the longest time, and really try to involve yourself in changing that. And I feel like there's a need for more collaboration, and not just for people that are in the health sector, because there's so many different things that you can be involved in the health sector, but also people from outside the health sector, because there's so many overlaps now. I read the other day an article about climate change anxiety, and I thought this is the perfect example of how our mental health is being impacted by climate change. And so when you're trying to come up with innovative solutions, I don't think it would be, I think you're missing an important piece when you don't talk to climate activists or people that are working in that space. And then the same for other sectors as well. And so really finding ways to collaborate. Don't be afraid to ask people and talk to people that are working in a completely different sector. Talk about what you're doing and what you're thinking about, and see what are their perspectives as well. So it's a lot of communication, collaboration. And I feel like with young people, there's a lot of potential for that, and people are more comfortable to really put themselves out there and have these conversations. And I think there's just so much opportunity, and there's a need for creativity, and that's something young people can really take advantage of. And I really hope this panel, we gave them a bit of a push to go forward and kind of do that. So yeah, I would like to end my piece on that. Definitely is have the courage to talk to people, collaborate, and really be as creative as possible.
Thanks again for that, Serene. And really just that aspect of creativity and how youth can kind of wield that to their advantage, I think is a really powerful message to end on as well. If I could finally go to Ngovu to share some of your thoughts on, what do you see as the advantage of youth, especially when we're acting in the planetary health space?
Okay, thank you for this question. I think that, young people have this capacity to think, because to solve any problem, we need to think, to go on the field, to make some survey, or to travel in another country to exchange with other young people in order to find out any solution. So first of all, they have this creativity. And also nowadays all decision making is concerning it concerns, young people, because, all people, I wanted to say that all people cannot think, like young people. And, uh, even when we see all these conferences all over the world, their young people are really engaged because they can bring out any solution on the table. And also, as Serene said, they are so much aware, on a lot of things. So I think I just want to say to every young people to don't be afraid, to start on something, or to get interest on, maybe climate change, or, planetary health, because, it is our voice need to be heard. And by getting together, by searching, innovate, collaborate, we could be able to sit on the table and to take solution, maybe in a future, or maybe in a present. So it's really important to collaborate. And also, we have this power, this energy. We can capable of, change the world, change the community, change lives community. So it's really important. Thank you.
Thank you so much for that, Ngobo. And I see we've got two thumbs up from Billy as well on that note as well. So thank you to all of our panelists for just really sharing your thoughts and your experiences, especially when it comes to youth and tackling so many of these issues. And I think you've passed on some really encouraging messages to all of us here today. So thank you again for that, really. And so now perhaps we can start the interactive element of this session. Seeing as we do have a bit of a small group with us today, perhaps we could maybe not do breakout rooms, but we could just have a bit of a chat with everyone here. So potentially, if I could maybe get some of our participants to potentially introduce themselves, and then maybe have like a one or two sentences about like what you've been working on in terms of planetary health and what kind of issues you've really seen as part of your community. So perhaps I could go to Suhyun first, and then Abhinav, and then also Shribu. So if we could have Suhyun, if you would like to unmute and perhaps introduce yourself. Oh, maybe mic's not working. Okay, well, let's go first to Abhinav. Potentially we can go back to Suhyun a bit later when she's available.
And I think Abhinav has a question in the chat as well, in case mics aren't great, or people don't want to turn their mics on, no pressure. Maybe we could start there and then see where the conversation takes us. So I think the question was how design thinking relates to systems thinking and how to implement that, and just a few words from the group on the topic of design thinking. Would be good. I could go first, or Serene, I know you're also very well versed in design thinking.
Perhaps Billy, you can go first, and then we can go to Serene next, and if Ngobo wants to share as well.
Yeah. So I think, like, obviously, as I said at the beginning, I think the systems thinking piece is really the mindset, the broader perspective and way of looking at things. But design thinkings for me are really the more tactical methods or recipes, in the case of the hamburger, recipes to, I guess, understand a problem and get to the right solution. So bringing the right group of diverse opinions with people with different backgrounds, on board to really understand who they are as humans. And, you know, as I say, a lot of the work I do is in digital health, right? So I use design thinking in terms of getting clinicians, mental health practitioners, nurses, whoever kind of makes sense depending on the digital health product. But we would get those people into a room, understand the interactions that they have around a particular topic. So literally like get onto a physical wall and map out the journey or the interactions. And it sounds silly, and usually a lot of post-it notes are involved, sometimes Play-Doh. It's about sort of making work fun and making hard, really challenging problems fun in a work setting, which is why I love it. And I also love it because you never assume that you know the answer coming into a design thinking session. It's all about accepting that you actually don't know much until you speak to a lot of people, understand their point of view, and kind of map that out. And there are lots of different ways to do it, 1,000 different recipes, so to speak. A fantastic resource that I like to use is, now I've got a mental blank. I'll have to come back to that. There's a, I'll type it into the chat bar when it comes to my mind, but there's a resource online where you can kind of look at the type of problem that you'd like to solve, and then they suggest different kind of ways that you can employ design thinking around solving that problem. But yeah, the most simple way for design thinking, I would say, is get a whole bunch of post-it notes, make sure everyone in the room, or even online, you can kind of do it in an online setting as well, has some post-it notes. And if you're brainstorming a problem, you can just simply ask everyone, give me 10 aspects of the problem that you'd like to call out. And then everyone's sort of time boxed, writing down on the post-it note the problems that they see around a particular topic. And then what I would do is get everyone to physically walk their post-it note, or again, you can do it in a digital whiteboard mode, to walk their post-it note up to the wall, put it onto the wall and talk about that problem. And there's so much magic that comes from just allowing people room to speak, right? Because in a classic boardroom setting, it's often a few people talking, and by nature of senior people talking, other people agree, right? That's what tends to happen. Whereas design thinking, you hear from everyone is allowed the room to speak. And then I would use something called affinity mapping, where I take the post-it notes and group them all together into kind of logical groupings of similar aspects of the core problem. And then you kind of get this master map that really kind of gives the full view at the systems level in articulating that problem. So anyway, I'm rabbiting on, but I could talk about design thinking all day, so I'll stop.
Yeah, no, thanks for that, Billy. And it brings back many, many fun memories of entrepreneurship classes, of just an array of sticky notes and just being absolutely colorful. So thank you again for that. And I think it is very interesting how closely knit that systems thinking and design thinking is also kind of very intertwined in terms of their approaches. And I think it is very much all about widening your perspective. And again, like what Serene, you might have said earlier, is really challenging our assumptions about certain problems, and just making sure we actually have a clear idea of the problem at hand, where the interactions are between all the different elements as well. So thank you again, Billy. If I could get Serene to possibly maybe add to what Billy has said in terms of what is that relation between systems thinking and also design thinking?
Yeah, for me, the way I imagine it, so I don't confuse myself, because often these different ways of looking at like approaching problems or coming up with innovative solutions, there's so many different methods to approach it in so many different ways. And I feel like even with design thinking, I feel like everyone has their way of tackling it or using that methodology. But to me, system thinking is like that whole big overview that you get of how the different systems interact and where there are gaps and what are the different groups that are involved or impacted by these systems that are in place. And then when you use design thinking, it helps you have a more narrow view so that you can kind of focus on a specific set of things. So you kind of become more focused or concentrated on one aspect of it, because sometimes system thinking can really be overwhelming because there's just so much happening and it's just so intricate. So you can kind of zoom in with design thinking and figure out what are the specific aspects of the problem that you want to address, and then it helps you kind of organize the next steps to take when you're kind of coming up with solutions. And of course, I'm saying it's organized, but whenever you see teams working with design methodologies, like Lily mentioned, there's post-it notes everywhere. There's people writing on walls. There's like posters and there's so much that goes in, because there's no stupid question at that point. Nothing you can ask is going to be a wrong question or a wrong answer. And it's really just about kind of figuring out what are the key questions that you want to address and what are the possible solutions that you could come up with, and what are the needs of the target community that you're addressing. So it kind of helps you formulate that kind of thought process in a way that you can end with something that's viable. Yeah, so for me, really, design thinking is it just helps me think of the problem in a less complicated way and more of a structured way. And really it's great because you really can find so many ways to collaborate with people, and it's such an inclusive process. I mean, it also depends on how you're facilitating the conversation, but it generally is a very inclusive process. Like I said, there's nothing that you can think of at that stage that could be wrong or just like that would lead you off track. Everything should count, and there's probably a reason why you thought of that question or you thought of this issue. And I think it's so important, especially when we want to tackle like traditional challenges, because this is something that really can add a new perspective on the way we look at things. So yeah, that's my take on design thinking, and generally it's such a great tool, but also there's so many different ways of doing it. I don't feel like design thinking has like one specific approach, which can be slightly overwhelming when you're starting to look into these things, but it's more about kind of understanding how it works and deciding which model fits your way of working best. So there's also that space for you to kind of pick out what works for you.
Yeah, great point. And I think it's always going back to that idea that, you know, a lot of the frameworks and approaches that are out there is exactly just that, an approach. And so when you're applying it to a certain context or a certain situation, there's always that element of contextual appropriateness that we always have to think about. So I think it's actually quite interesting that you've sort of mentioned that there are so many elements to design thinking and also systems thinking as well, that really enables it as such a powerful tool to be able to be applied in so many different areas, especially when we're thinking a bit more about, you know, how do we apply it to this specific context and what is unique about the challenges that we're trying to solve as well. Perhaps if I could go to Ngolvo to get your thoughts on this as well. Just the interlink between systems thinking and also design thinking, and perhaps how have you kind of applied it a lot in the spaces that you've worked with, you know, especially with Yes Health and other organizations that you've led.
Are you getting me?
Yes, we can hear you.
Okay. You know, learning design thinking, what I can say is, you know, our organization called Yes Health, because we work on sexual and reproductive health and right, family planning, menstrual hygiene management, and gender equality. So we are already specifics, But what we do is, we can, try to go to a community and then, make a survey or ask them what are the major problems they are facing in, in sexual and reproductive health. And then by having the by having a conversation with them together, we can sit and try to, to evaluate their needs. First of all, we can think about a general objective, and then we can move to specific objective. And after that, we make some activity on the field, and then we can evaluate the result. So that's a little bit what we do. So first of all, we identify the problem. We speak with the community, exchange, making some survey, and after it, we can analyze, their survey and found out any solution, build up some solution. By doing that, we make sure that, maybe by, working with some other partners or some other organization, we tackle the problem of this specific community. So that's how we do. But, concerning design thinking, there is a lot of, element put inside. And, any kind of problem are different from any country, so that's what I can add to what, Billy and Seren said, have already said.
Thanks for that, Ngovo. Yeah, no, I think the way that you've kind of applied a lot of these ideas, especially to Yes Health, is incredibly fascinating. Especially in the way that you're really trying to look at so many of these issues from that mindset of trying to gather as much inputs from other people as possible. And to try and use those perspectives of what the problem actually is, and trying to come up with some sort of arrangement or some sort of solution that really is able to cater for a lot of the youth that you work for, and also a lot of the families that you work for as well. So I think that's quite an interesting perspective that you're really bringing. Actually, even while you guys were discussing this, it did spring to my mind that I remember, Billy, you have done some work with, especially transformation. I think you mentioned that there was a case that you've worked on with New Zealand and Australia in terms of transforming that sort of health workforce. Perhaps if you could maybe speak on this as almost like a case study, in terms of this interlink between how did you maybe use design thinking elements, and then perhaps how did you expand on it with systems thinking elements as well?
Yeah, for sure. And I forgot to mention that earlier, actually. So thanks for the keen reminder. Yeah, look, that particular project was really memorable for me. So it was, I think, in my third year of working at Accenture, so I was still pretty fresh in terms of my experience at that point, but I was asked to fly to New Zealand every week. So it was Sunday evening, getting on a flight. It's about 3.5 hours from Sydney, and then kind of have a time zone difference as well. So up very early and straight into the office there. And that particular project was looking at a national telehealth service across New Zealand. So the way that it was structured before that was they had around 6 or so separate organizations. So for example, the Lifeline suicide call that you hotline that you call, for smoking cessation, nursing and GP after hours. Lots of different services were offered from completely separate different organizations, different cultures, you know, with their own HR departments, separate finance, et cetera, and so we came in and helped this particular organization that was bringing them all into one roof and merging them together to do the service design of that. So we looked at, you know, what parts of their HR organization made sense to come together. What was their staffing strategy? If they had nurses from, you know, XYZ, how many of them were needed to kind of come together, and what does that look like? What processes would they follow with the new technology that was available to them in answering calls, because it was a telehealth service. And the biggest sort of point of difference for that project in being successful, particularly because it was a short timeline, we had to move all those organizations under one hood and have nurses be able to answer calls, all in the space of 7 months, which is crazy looking back at it. And the biggest point of success was that we had the project team all sitting in one room together, which I know is kind of hard to do in today's context around COVID, but we were all sitting in this strange tennis court in Auckland, literally this tennis court offices, where Serena Williams, when she would come to New Zealand, would train at these tennis courts. And we were there because none of their other buildings could seat the project team. There was just too many of us. And it was this fantastic opportunity because we were sitting in this strange building overlooking people play tennis every day. But, you know, next to me was the CEO, the CIO was somewhere else. We had all the program directors sitting around. We had the folks that were setting up the technology systems in the same room. We had the people that were responsible for change and training, which was the area that I was in at that time, sitting in the same room. So every day when we did what we call a stand-up, where you've got around 15 minutes standing up against a board, kind of talking about what problems you want to solve just for that day. For, you know, everyone's got a view of the more strategic outcome, but for those stand-ups, we just focus on the things, the activities that we're working on for that particular day. And it was just amazing to have that many different people with different focuses come together to solve one core outcome over 7 months. I've still to this day never seen anything like it. And I think it took, you know, just such an amazing culture from that organization, set by the CEO, who was comfortable to sit with this whole messy project team at this tennis court with a lot of different activities happening. But yeah, it was fantastic. And I think from that, I've learned so much in taking bits and pieces, not all of it, because it's not always feasible to relive things, you know, exactly the same from project and experience to experience, but you take different bits and pieces from those experiences and apply them for future work. So yeah.
Thanks for that, Billy. And I think it's an incredible story. I mean, I can't imagine flying in and out of Australia and then New Zealand every single day. Well, not every single day, but every single weekend to sort of be involved in this project. And I think it's quite interesting how you've mentioned, you know, such a diverse group of people coming to work together in the one team to kind of deliver this project. And even though it was quite a complex, quite a intensive sort of project that you were working on, it's really interesting how you've kind of, you know, adopted just having so many different perspectives on around the one table to try and really get the project out. So thank you for that. And perhaps maybe Serene, I know you've worked especially like doing a lot with communications. Any kind of major projects that you sort of came across similar to what Billy has sort of outlined in the case with telehealth. Any kind of major projects that you've worked on that have really sort of used these kinds of systems thinking and entrepreneurial frameworks as means to really build to the success of the implementation?
I think some of the campaigns that we used to do at UNICEF would always use systems thinking at the beginning when they were kind of developing the campaign ideas or the things that they wanted to utilize when trying to push out a specific message to communities. And this could be, like, we used to use this a lot when we were thinking about vaccination campaigns. I was working in the humanitarian response in Syria, and there was an outbreak of measles and polio, which hasn't happened in a very long time in that region. And so we had to sit down and think of what are the systems in place that are preventing everyone from being vaccinated at the moment. And there's a lot of different things. Because if you break it down, it's not just an issue of not having the vaccines available, but it's also the policies that are in place that maybe are leaving some communities behind and not putting safety nets for them to get the health services that they need. So it becomes like this expanding session where we keep coming up with different aspects of the problem, and you realize how really they're just always connected somehow. And so when we were developing the campaign, we realized that to reach the people that might not have been vaccinated or are at risk, we'd have to use a lot of different approaches that wouldn't have been the standard campaign approach that UNICEF does in other places. So that would be in maybe going to the communities and seeing who are the most influential key holders in the community, whether it's let's say the mayor of a small town, or is it the religious leader, and kind of see if you can convince them to also work with you and push the campaign forward. And so really at the beginning I really didn't expect that to be the approach that they would use, because I thought everything was quite standardized. They've been doing this for so many years. And so really it was nice to see all these different people within different departments, the health people, the youth and adolescence department, working together and really thinking of the gaps that were in place that were keeping some people from being vaccinated. And at the end of the day, it was such a creative campaign, and they did so many different activities and community mobilization that really made sure that people weren't left behind. And I thought that was a great example of how you can really, just by mapping things out, you can get a grasp of who might potentially have been missed out previously. And I think, yeah, it was a really great learning experience for me on how this kind of methodology was implemented in a very practical sense within comms, because a big aspect of it was just making sure the messages were coming out clearly and utilizing the right people to send out that message for you, because people don't know you, so they might not listen to you, but you need to figure out who are the key stakeholders in these communities to make sure they're also part of the campaign and pushing your message out there for you. Yeah.
Yeah, I think that's really it's a really fascinating thing with communications, because you're disseminating such key, important, and vital information to so many people, and it's one of those things where you really have to think about, okay, well, how do we disseminate all of these messages out, just to ensure that the people that need to hear this message are receiving this message, and most importantly, are acting on the message as well. So I think, again, communications is such a fascinating facet of, especially in these kinds of social impact projects as well. I do see we are now to time, and so thank you again for all of our panelists, and thank you for all the participants who have joined us. We really hope that it has been a helpful session for you all, especially when it comes to trying to implement change, especially in all of your communities, in your workplaces, anywhere really that you see that needs change. And so thank you again for coming. We can also head back to the main webinar link of the conference. We will have a 30-minute break for all participants, and so we will be back in half an hour. But thank you again to Billy, Serene, and Ngobu. I've personally learned so much from this as well. So again, thank you so much for coming in and sharing.
It was great. Thanks, Catherine.
All right, thank you, everyone.
Salam, my name is Shahad Sharif. I am a medical doctor from Sudan and a member of the conference organizing committee. It is my honor to moderate this session, a planetary health approach to food system, food security, and sustainable diet. Good morning, good afternoon, and good evening to all our participants. We welcome our amazing speakers and thank them for joining us. This is a recorded session and 15 minutes will be allocated to answer questions by the end of this session from the Q&A. So don't hesitate to write down your questions, guys, and to share your thoughts through the chat. To give a brief introduction, sustainable food systems are an important component of a planetary health strategy to reduce the threat of infectious disease, to minimize environmental footprint, and to promote nutrition. Human population dietary transitions have led to a growing demand for food and increasing production and consumption of meat amid declining availability of arable land and water. It's observed in recent years that young people are more likely to adopt environmentally friendly diets and eating habits as they are more conscious about the future of their planet and less resistant to change. To reduce all these risks associated with the modern world eating habits and food production, an understanding of what can be done in different sectors that shape our food system is needed. So let's hear from the experts. I'm happy to kick off our session with a presentation from Dr. Divine Neji, who is a national of Cameroon. He holds a PhD degree in engineering from the University of California, Davis, USA, specializing in food and agro-processing engineering. He joined FAO in 2004 and is currently Deputy Director of FAO Food Systems and Food Safety Division. Prior to joining FAO, Mr. Neji worked in the private sector in food manufacturing in the United States and taught agro-processing technologies at the university level in both Cameroon and the United States. He will be covering the agricultural perspective of the food system and help us to know how our current practices exacerbate climate change and drain natural resources, increasing the frequency of natural disasters and impacting our health. The floor is yours, Mr. Divine, and we are happy to have you.
Okay, thank you. Thank you very much. Good day, participants. It's a pleasure for me to join you. I would like to focus my talk on food systems and their linkages with human and planetary health. So on the one hand, human health and planetary health, and food systems, as it were, are kind of a connector between these, also are impacted going both ways. So when I say food systems, what I mean is the entire range of actors and their activities in production, aggregation, processing, distribution, consumption, and even the disposal of food products that originate from agriculture. And I use agriculture here broadly to include livestock production, forestry activities, and also fisheries, in addition to the traditional crop production. And in addition to these actors involved in these activities, food systems also include the broader economic, societal, and natural environments in which the activities that are in the value chain are embedded. So I think that is very, very important in terms of contextualizing the problem that we are facing, because it goes beyond that production to consumption chain to also include the broader economic, societal, and natural environments. Now, food systems, I think it's kind of obvious they are for food, and they have the potential to nurture human health by providing food for human, and also to support environmental sustainability. However, food systems currently threaten both human health and also environmental sustainability. And that is not only limited to present generations. Actually, projections show that if we continue business as usual, the situation will worsen and we will not be able to provide healthy diets for the global population, which is estimated to reach 10 billion by 2050. So we're going to be hard pressed to provide healthy diets to these people, expanding population, while remaining within the safe operating space for planetary health. Now, when I say our food systems are not working optimally, let us drill down deeper and see what that actually means. Firstly, the food systems, our current food systems are not feeding people well. And globally, the levels of food insecurity and malnutrition are unacceptably high. Some 828 million people, 828 million people globally are undernourished, which means they suffer from hunger. And almost 3.1 billion people worldwide do not have access to a healthy diet. And because they lack access, they then resort to consuming unhealthy diets that lead to micronutrient deficiencies and also contribute to a substantial rise in the incidence of diet-related obesity and diet-related non-communicable diseases, including coronary heart disease, stroke, and diabetes. Now, the second aspect, that just to corroborate my assertion that food systems are not working optimally, is that even when you look at those that are involved in the food systems that I mentioned earlier, most of these people are not only food insecure, but they face immense other livelihood challenges. Now, a good proportion of the world population is engaged in the production, processing, distribution, and marketing activities and the related food services. But paradoxically, most of these people who depend on these activities for their livelihoods, that's the farmers and so on. Now, they are poor and live in rural areas, and they are especially vulnerable to being left behind by the rapid changes in food systems. Digitalization, for example, is one of the rapid changes that are happening in food systems. And so these changes impact them, and this is exacerbated by natural and human-induced shocks and stresses. Climate change is a good example, but more recently, the Ukraine war is also a very clear example of how these shocks can be complicated by other circumstances, shocks and stressors. Now, just again to reinforce the unsustainability of our food systems, let's also look at now the environmental dimension. Food systems contribute about probably more than a quarter of greenhouse gas emissions, which obviously drive climate change. And in addition to that, food systems, food production is responsible for unsustainable exploitation of natural resources. For example, freshwater food production uses up to 70% of freshwater sources. Conversion of natural ecosystems into croplands and pastures causes degradations of the ecosystems and also very significant biodiversity loss. So, and also increases the risk of extinction of various species. Now, the environmental burden from food production also goes, it's not only something for land and air species, but it also includes the marine ecosystems. So and we know about 60% of the world fish stocks are fully fished and more than 30% are overfished. So I just want to mention one other issue that sort of kind of ties these other factors that I have mentioned together, and that is with regard to the high levels of food loss and waste. Now, a significant amount of the food that we produce to consume is actually not consumed and undergoes food loss or food waste. Now, by losses, we are referring to inefficiencies in the system up to the retail stage, and by wastage, we're referring to what happens, for example, at the consumer level. Up to 14% of the food produced globally is lost between the post-harvest and the retail stage, and 17% of food is wasted at the retail and food service and consumer stages. Now, apart from the fact that if this food is lost or wasted, then it's not available to be consumed, and so has an impact on food security and the livelihoods of those participants in the value chain. Food loss and waste has a significant environmental footprint. So it is a waste of resources. I think it's very obvious if you use resources like water and land and energy and fertilizers to produce food, and then that food is not consumed, but is rather lost or wasted, then it is essentially a waste of those resources that went into producing the food. In addition, apart from this unsustainable exploitation of natural resources, I must say very scarce natural resources, food loss and waste is also contributing, is also a big factor why food systems contribute to greenhouse gas emissions. Food loss and waste by itself is responsible from 8 to 10% of global greenhouse gas emissions annually. So that, I think, is very, very clear that food loss and waste is one of the areas where we can actually focus on when we're making plans to make inroads into making our food systems more sustainable. Now, I have kind of laid out the background of the problems, and let me just delve now a little bit in terms of interventions and what we may be able to do and what we should do in terms of addressing this. Now, and the big question, I think, is how do we feed people, the whole population of the world, projected to reach up to 10 billion by 2050, to do this sustainably while remaining within the safe operating space that of the planetary boundaries. So to do this, we need to transform our food systems. And to transform our food systems, we need holistic actions. We need a holistic approach because we need to recognize the interlinkages between people, the planet, and the livelihood and the prosperity of the people who live on the planet. Now, we also need to use these holistic approaches because of the obvious interconnected nature of the drivers of the problems of food systems. Climate change is linked to conflict. It generates conflict, it generates economic shocks. So these are all related factors, and therefore we need to address them using holistic approaches. So we need to support adaptation and mitigation of climate action to help enhance production of a variety of sustainably produced nutritious food that constitute healthy diets, while also supporting the livelihoods of farmers and employees operating along the value chain. As another example, we need to promote a One Health approach that seeks to sustainably balance and optimize the health of people, animals, and ecosystems. The global impact and response to the COVID-19 pandemic highlights the need for coordinated action across sectors to protect health and prevent the disruption of food systems. In ending, I just want to list three key interventions and initiatives that you, the participants, can be involved in. You probably are aware that the UN Secretary General convened the UN Food Systems Summit in 2021 to help stakeholders launch bold new actions to transform our food systems. Now, follow-up action is being taken and supported at various levels with national pathways at national level, and also the 20+ coalitions that formed to take the food systems transformation agenda forward. So the coalitions are on various thematic issues: nature-based solutions, food loss and waste reduction, healthy diets as examples. So you have the opportunity to join these coalitions and act from your point of view, be it whether you are a business operator or involved in the academic realm or involved in some civil society organization, or even if you work in the private sector of a country, you can be involved in these coalitions as well as support the national pathways that countries are formulating to transform their national, food systems. The second follow-up action that I wanted to mention is that in relation to food loss and waste reduction, September 29th, so just in about a week from now, September 29th is the UN General Assembly declared International Day of Awareness of Food Loss and Waste. And so there are many activities and events being planned, and you can join and participate in these activities. Further details can be found on the FAO website. The last sort of initiative I would like to mention is the World Food Forum, which is an independent youth-led global network of partners facilitated by FAO. And this year, the World Food Forum's flagship event will comprise a global youth forum, the Science and Innovation Forum, and a hand-in-hand investment forum organized from the 17th to the 22nd of October and convened by FAO in collaboration with different partners. So I want to stop here, and I want to thank you very much for your attention. Have a good meeting.
Thank you so much, Mr. Devine, Dr. Devine, for your amazing insights of what the FAO is doing, and especially on your focus on the waste of food. Please, everybody, don't hesitate to leave Mr. Devine questions. He will be answering them at the end of the session. Thank you also for mentioning the World Food Forum. We will have one of their scientists, young group with us shortly. Thank you so much, Dr. Devine. Next, I would like to present Dr. Laura Etkan. She is a physician, author, and educator for more than 20 years. She is the author of 2 books. The first one is Who is in Charge? Leadership During Epidemics, Bioterror Attacks, and Other Public Health Crises. It was published in 2020. And the other one is One Health and the Politics of Antimicrobial Resistance, published in 2016 by Johns Hopkins University Press. In 2020. In 2020, she launched her Coursera course, Bats, Ducks, and Pandemics, an introduction to One Health policy, which has thousands of students enrolled from around the world, including myself. It's simply brilliant, and you have to check it, guys. She is a co-founder of One Health Initiatives and received many awards for her work in the field. Her presentation is on a One Health perspective of sustainable food systems in the 21st century. You can take the lead, Dr. Laura, and you will be supported by our tech. The floor is yours, Dr.
It's a pleasure for me to be here with you. Good morning, good afternoon, and good evening. I'm going to speak with you a One Health perspective of sustainable food systems in the 21st century. Next slide, please. I think it's important that we recognize that agriculture is the foundation of civilization, and climate change threatens agriculture and food security. Next slide, please. One Health is the concept that human, animal, plant, environmental, and ecosystem health are linked. And this concept provides an important and useful framework for examining complex issues such as food safety and security, climate change, and as well as antimicrobial resistance and other issues. We need to examine the root causes of these health threats if we're to develop effective policies to address them. And I think it's important that we recognize that we interact with our environment every day by inhaling air, drinking water, ingesting the plants and animals that we call food. I'd like to just point out the One Health Initiative website. Please visit it and tell your friends and colleagues to visit it as well. Next slide, please. Now, there's many ways to visualize One Health. For the purposes of this talk and based on the paper link that I shared, I envision it as a Rubik's Cube with intersecting dimensions. The first dimension is the One Health factors: humans, animals, plants, environments, and ecosystems. The second dimension is the complexity factors, looking at providing a sense of scale, microbial, cellular, individual, and population levels. The third dimension is the political, social, and economic factors that can be represented by political borders at the local, regional, national, international, and global. There can be a fourth dimension, which is not visualized here, which includes time, days, months, years, or eras. Next slide, please. So we can squash that three-dimensional cube into 2 dimensions, and you can see the intersection connections between the different dimensions. I'd just like to point out that I define environments as the abiotic, or the soil, water, air aspects of defined geographic areas, and ecosystems as the biotic interactions, the microbial flora and fauna within geographic areas. Next slide, please. So in this talk, I'm going to use different mini analyses, if you will, between the One Health factors intersecting with the complexity factors and finishing up with the political, social, and economic factors, and the time frame is in years. Next slide, please. So in other words, we're going to have a satellite perspective of the planet, a One Health satellite perspective. Next slide, please. So let's do our first analysis. Next slide, please. So if we look globally, we have right now almost 8 billion humans on the planet, projected, as the previous speaker said, up to around 10 billion humans. According to the FAO, there are around 30 billion terrestrial food animals, and that number is increasing. Next slide, please. And we have to recognize that humans combined with these domesticated animals produce around 4 trillion kilograms of fecal waste each year. This is an important paper published by David Barondis and colleagues in Nature Sustainability in 2018, where they estimated global recoverable fecal mass. Next slide, please. Now, to put all of this fecal waste into perspective, it would 4 trillion kilograms would fill over 1.6 million Olympic-sized swimming pools, and by 2030, over 1.8 million Olympic-sized swimming pools with feces. Or to think of it another way, we could bury the entire surface areas of Los Angeles and New York City in 6 feet of fecal matter. And we are producing increasing amounts each year. Next slide, please. So when we just look at human fecal matter, many people, over 670 million people, still defecate outdoors. They're openly defecating. They don't have access to basic sanitation. Next slide, please. In terms of animal fecal matter, 80% of that 4 trillion kilograms is produced by the domesticated terrestrial animals that we raise. But it's important to recognize that sanitation systems are designed to process human and not animal fecal waste. And we really don't have a good handle on what's going on with all of that animal fecal waste. There was one study done in the Netherlands looking at animal manure policies. And in most cases, whatever policies they have, they're not enforced and there's no great oversight. So it's not clear what's happening with all of the animal manure that's being produced each year. Next slide, please. Now, there are many pathogens in human fecal matter, and I'm not going to read them off to you, but they do exist and they do contaminate soils and waters and crops. Next slide, please. Similarly, there are many pathogens in animal fecal matter, but there are far fewer studies of the pathogens in animal fecal matter than there are in human fecal matter, even though 80% of the fecal matter of the 4 trillion kilograms of fecal matter that we produce is produced by the animals. Next slide, please. And according to the World Health Organization, in a 2015 report, foodborne illness, food safety is a serious issue. These diarrheal disease agents can cause around 550 million illnesses, 230,000 deaths each year. And if you look at the diarrheal disease agents that I've highlighted in red, many of them come from animal fecal matter as well as human fecal matter. So this is a serious issue that's just not getting the attention it deserves. If we want to have safe, nutritious food, we have to get a handle on all of this fecal matter. Next slide, please. That brings me now to the second One Health analysis, looking at environments and ecosystems at the international global level. Next slide, please. So climate change threatens agriculture, and agriculture worsens climate change, as the previous speaker mentioned. Next slide, please. Now, to truly understand climate change, you need to think like a geologist. And to think like a geologist, we need to look at the timeline of the temperature of the planet. At the beginning, on the left-hand side of this slide, we see the Paleozoic era, where the land was barren and you had life in the seas. And the planet was very hot. It was a very different planet than what we're living on now. And with time, the planet began to cool until you get to the Pleistocene era, where we had the Ice Age. And the Ice Age, there's a reason agriculture didn't develop it with the Ice Age, because the planet was simply too cold and it was covered with thick layers of ice. Now, inexplicably, about 10,000 years ago, at the beginning of the Holocene era, the planet began to warm. And if you look at the Holocene era, it's not a coincidence that agriculture began around the beginning of the Holocene, around 10,000 years ago. And for the entire past 10,000 years, the entire duration of agriculture and civilization, the climate of the planet has been remarkably stable and consistent, relatively mild. The farmers would need to know when to plant the crops and when to harvest the crops, and they would need to have reliable rain in order to water the crops. The planet's climate allowed that, with the exception of the Little Ice Age, which led to widespread famine and wars because the planet had inexplicably cooled and led to crop failures. Now, with climate change, we've warmed about 1 degree above the Holocene baseline, to which we have depended on for agriculture and civilization, and we're now starting to see the effects. And the further we deviate from this Holocene baseline, the worse it's going to be for agriculture and for our food security. So our goal is to try and stay as close to this Holocene baseline as possible to continue agriculture and food security. Next slide, please. So already we have, according to the World Bank, they did climate modeling, and they estimate that by 2050, due to climate change effects, assuming current agricultural practices and crop varieties remain the same, much of the world is going to become too hot and too dry to grow food, adversely impacting civilization. Next slide, please. Now, in terms of greenhouse gases, agriculture emits some of the most potent greenhouse gases. Now, carbon dioxide is the most common greenhouse gas, but methane is about 28 times more potent than carbon dioxide at trapping heat in the atmosphere, and nitrous oxide is a whopping 265 times more potent at trapping heat than carbon dioxide. Next slide, please. So according to the US Environmental Protection Agency, at least in the United States, and this is similar globally, agriculture contributes around 10% of the total greenhouse gases. Of these greenhouse gases, if you look on the right, methane and nitrous oxide are largely from agriculture. Next slide, please. And if we look specifically at nitrous oxide and methane, agricultural soil management contributes almost 80% of the nitrous oxide, which again, I remind you, is 265 times more potent than carbon dioxide at trapping heat, as well as manure management, which contributes about 4%. In terms of methane, manure management, almost 10%, and enteric fermentation coming from cows, almost 27% of enteric fermentation or cow burps produces methane. Next slide, please. So if we want to try and stay as close to that Holocene baseline as possible, right now, our current climate policies are putting us around 2.7 to 3 degrees above the Holocene baseline, which is just not acceptable. We really need to get down to 2 or less than 2 degrees if we want to have a sustainable future. Next slide, please. Which brings me to the third analysis. Next slide, please. I'm not going to reiterate on food security. Next slide, please. I'm starting to run out of time, so I'm going to go a little faster. Food security is the #2 UN Sustainable Development Goal. It's that important. Next slide, please. There are many pros and cons to eating meat. It provides iron and vitamin B12. It's integral to many cultures, but meat also increases zoonotic spillover risks, and all those animals are producing all that manure. Next slide, please. Global meat production is increasing, not decreasing, because of global demand. Next slide, please. Eating meat is the norm almost everywhere, except India, which has the largest fraction of vegetarians, largely because of Hinduism. So they have a religious edict, if you will, to reduce their meat intake. But most religions are centered around eating meat. Next slide, please. Changing food preferences is possible, but it requires strong convictions. It's not easy to do, but it can be done. Next slide, please. So a brief recap then on our One Health analysis findings. Next slide, please. Humans and domesticated animal populations are increasing and producing increasing amounts of fecal matter each year. Animals produce 80% of it, but it's generally ignored. Human and animal fecal matter contain many pathogens, but the sanitation systems are designed to process only human waste, not animal waste. And as a result, there's very little oversight in all countries in terms of animal manure, including in the United States. And this animal manure and agricultural soil management emit methane and nitrous oxide, the most potent greenhouse gases, into the atmosphere. And these findings therefore impact food safety and security, climate change, and the continuation of agriculture and civilization. Next slide, please. I'm going to skip this one. Next slide, please. So far, the Paris Climate Agreement and the UN has not really included agricultural's greenhouse gas emissions as much as they should. Next slide, please. Neither Glasgow did not discuss it. Next slide, please. So in summary then, we must restore our beautiful planet, and One Health recognizes that life is interconnected. What can all of you do? Please learn about One Health, help spread the word, develop colleagues in different disciplines, organize and be the change agents that we all need to ensure our future. Next slide, please. Next slide, please. Next slide, please. Just wanted to briefly mention my course, Bats, Ducks, and Pandemics. Please, please enroll. Next slide, please. I'd like to acknowledge my colleagues in the One Health Initiative. Next slide, please. And I'd like to thank you all for your time and attention.
Thank you so much for this amazing presentation that was very much supported by data and shows the true impact of the interconnection between human, animal, and environmental health. Please feel free, guys, to post your questions. Dr. Laura will be available to answer them at the end and give us her closing remarks. Thank you so much, Dr. Laura, for your presentation.
My pleasure.
Thank you. So our third presentation is from Suabital Anissa. Sorry for the name pronunciation, maybe. Anissa is a passionate veterinary student from Universitas Erlangga, Indonesia, translating her passion in veterinary medicine, biosciences, global health, and One Health through her work in different student organizations. She was the former chair of IVSA, the International Veterinary Student Association, Standing Committee of One Health, and she is defining herself as One Health enthusiast. She will be covering the veterinary perspective of the food system, including livestock health and management, including the antimicrobial resistance as adverse effect, the risk of interaction with wildlife, and consumption of bushmeat as alternatives, among others. Welcome, Anissa. The floor is yours.
Thank you very much, Shannon. So I will just start to share my screen. You can see my screen and hear me well. Good morning, good day, and good evening, everyone. My name is Anissa, and thank you very much, Shahid, and all the Aussie to give me the opportunity to share some insight and experience here. All right, I'm so sorry for the hints. I will continue my presentation. So we will talk about the planetary health approach to food system and food security and sustainable diets and in the veterinarian perspective. So when we are asking ourselves like about animal health, we might question it's like what's the importance of animals, especially in daily life. For example, if you don't have any pet, or maybe if you don't interact a lot with some livestock animals. However, we might forget that we have close relations with animals in daily life. For examples, like the food that we eat based on the animals, or maybe just when we try to go outside and then we interact with animals. So we need to realize that animals is close with us and live with us. And then, so the question is like, what is the importance of animal health toward us as a human? And what's the importance of animal health to environment health or planetary health? Sorry, I'll continue. So one of the closest relation with us to the animal is like the zoonotic disease.
So zoonosis are any disease or infections that transmitted from vertebrate animals to humans. It can consist of virus, bacteria, fungi, and other organisms or abnormal protein agents, or we call it prions. And there are so many known zoonoses. These are more than 200, and the study of zoonosis is one of the most interesting field in medicine and veterinary medicine. Then so here, like zoonotic disease spread between animals and people, the disease that spread each other between humans and animals. And then we also know about the emerging disease that appear for the first time. For example, actually COVID is not the first time, but the variant or the strains. And then the emerging zoonoses are one of concern to humanity because most are emerging at unprecedented rate and have significant impacts on human health as well as social and economic system. So we talk about the rise of spillover. So what is spillover? So the spillover is the phenomena in which disease outbreak in humans occur due to viruses that previously circulated only in animal kingdom, then jump to human. So basically, it's a disease that infect animals and then have the ability to infect to human. And then the next issue will be like the animal losing its habitat. So in fact, more than half of the rainforests on our planet have been destroyed because of the human need and for wood and fertile land and for cultivations, for farm, or maybe for other human use or anthropocene or the human's activities. So in fact, rainforests on Earth once grew from 15%, but now only remain 6%. If current rates of deforestation continue, it will be a very big problem to us because the habitat of the animals will be wiped off from the earth within the next 100 years. And then the consequence of the losing of the animal's habitat will be like the increase of the interactions between humans and animals. So more interactions will lead to more zoonotic disease. So the other hazard or issues that we might face is like the illegal killing of wild animal for harvest is considered by international scientific community as a major cause of population decline. The fact that we cannot, monitor the a lot of wildlife activities, the daily life of the wildlife, we might not know like how fast the pathogens inside the wildlife, and it could be effect of the emerging of zoonosis. And then the other issues that might also come up with the relation between animal health and also food safety and security will be the antimicrobial resistance that it might happen when we try to do the medication or treatments into animals, and then there's like some residue and then we try to consume them, or maybe if we try to treat animals and then there is like the AMR happen in these fecals of animals and then contaminates the environment. The second one will be the climate change. It's also become the consequence of like the deforestation and other human activities or anthropocene. And the climate change and also the deforestation then and the imbalance of the animals' habitat will lead to threat to the food security and the food safety. And then here is like some facts about the animals source foods that I would say is unpopular opinions, but it's this opinion kind of triggering me to find out more. So I want to share it with you all, guys. So animal source foods are necessary and missing in the diets of nearly 800 million individuals. So it's based on the source from the Global Food Justice. And then, so we might already know about the food solutions, including like ultra processed meat substitutes, or maybe plant-based food and other alternative to fulfill our needs in food. So many of those proposed ecological food solutions may appear to be better for the planet, but when we try to examine closely, they are actually the result of extractive chemical agriculture, which further degrades the health of our soils and waterways. So this also have this another unpopular opinion, like removing all livestock from the so the organization is based in US. So the US food system will only reduce greenhouse gas emissions by 2.6%. So it would be nice if we can share like some opinions, or maybe we can learn deeper about these. Thank you very much for your attentions, and I would love to hear your questions and opinion. Thank you.
Thank you so much, Anissa, for sharing this amazing perspective of the importance of veterinary health when we address the holistic approach and the comprehensive approach of One Health and Planetary Health. It was amazing to hear from someone who worked in the field as a young person. We are focusing on this conference, and it was amazing to hear how animal health and management of livestock will fall into the overall goal of planetary health. Everybody, if you have questions to Anissa, please don't hesitate to share them on the Q&A. And it was a pleasure to have you with us. And we will see you in the final remarks, Anissa. So our final presentation for today's session is from a perspective of YAP. Next is Kim, Next, we have Kim Anastasia. She is from the World Food Forum Young Scientist Group. I'm sorry if I'm butchering the name. She will walk us through the youth involvement in shaping sustainable food system and One Health. She is a PhD candidate at Deakin University and a research dietitian at Cicero, Australia. Her research is focused on understanding and improving the health and environmental impacts of the food systems. She was a youth liaison for the 2021 United Nations Food System Summit. We are excited to have you with us, Kim, and the floor is yours. You can go ahead. Thank you.
Thank you so much. I hope you can hear me okay. I'm just going to try sharing my screen. Just give me one moment. And I'll just adjust that so that you can see the right part. One moment. All right, can you see just my beginning slide? It should say environmental impact of ultra-processed foods. Fantastic.
Amazing.
Well, thank you so much for having me today, and thanks for hanging on to the end of the session for those of you who are listening in online. I'm going to talk about a little bit about my research, and then also about the role of young people in healthy and sustainable food systems. But before I start, as is customary in Australia, I would like to begin by acknowledging that I am presenting to you today from the land of the Kaurna people, who are the traditional owners of the Adelaide Plains, and I'd like to pay my respects to their elders past, present and emerging. So my presentation is split into two parts. The first part talking about my research, which is understanding the environmental impacts of ultra-processed foods. And the second part is talking about the role of young people or youth in sustainable food systems. So I'd like to start off by just giving you a little bit of background about the work that I'm involved in. So at the moment, I've been developing a framework and a conceptual framework to understand the environmental impacts of ultra-processed foods. And my wonderful supervisors, who are of course my co-authors in this paper, are listed on the screen as well. And we've heard from the other speakers that there are a wide variety of challenges that the food system is facing. We need to make sure that we're producing enough nutritious foods that are environmentally sustainable, socially sustainable, and economically viable for the global population, which is a massive challenge. And it's really important so that we can ensure that every single person in the world can have access to healthy and sustainable foods that are culturally appropriate. But unfortunately, the production of ultra-processed foods are a major barrier to achieving these goals. They're unhealthy foods that use scarce environmental resources for their production. And because they're so cheap, they may rely on supply chains which might have poor working conditions, etc. So before I dive in any further to my work itself, I think it's really important that we all understand what we're talking about in terms of ultra-processed foods. So ultra-processed foods are one part of the NOVA classification, which is a way of classifying foods according to their level of processing. And essentially, ultra-processed foods are things that you can't make in your own kitchen at home. So they're often used really complex processing methods or artificial additives. And an example on the screen is something like corn, which if we add, processed culinary ingredients like oil and salt, as well as artificial additives, and then undergo an ultra-processing method such as extrusion, we end up with an ultra-processed food such as tortilla chips. And this is a really, really big problem because these types of foods, ultra-processed foods, which include everything from chips to chocolate, soft drinks, pre-prepared meals, fast food products, they actually comprise a very large proportion of diets, and they're increasingly providing larger and larger proportions of diets in low and middle income countries, and in high income countries, including Australia, they comprise quite a large proportion as well. 42% of Australian energy intake come from ultra-processed foods. This is really problematic for our diets and our health because they're associated with poor health outcomes. But it's actually also problematic for the environment because they use scarce environmental resources for their production, and we really need to prioritize these environmental resources for the production of essential and healthy foods. So before I go into this in a little bit more detail, and I won't spend too much of this presentation on this because I do want to talk about use as well, but just to kind of get a snapshot of what I'm talking about, in order to understand how to prioritize these environmental resources for healthy foods, we have to be able to measure them. And how do we do that? So how do we measure the environmental impacts of foods? Well, many early sustainability assessments were looking at greenhouse gas emissions, and greenhouse gas emissions is obviously a hugely important component of sustainability, and it covers all sorts of things from emissions from land clearing, pesticide production and use, methane production of animals as well. And early studies, so from a 2016 review, we know that early studies of the sustainability of diets focused on greenhouse gas emissions, with 70% of them using greenhouse gas emissions as their measurement of sustainability. But there's this increasing awareness now that sustainability of measurements of diets actually need to be much broader than just greenhouse gas emissions, because they're not the full picture. And a really good example of that is something like palm oil, where we have land clearing, which of course contributes to greenhouse gas emissions. But we've also got the loss of local habitat for local species. We also see added fertilizers and pesticides, and these things can run off into local ecosystems and impact water supplies. So we're talking about a One Health perspective today, and it's really important that we're actually considering all of the different environmental impacts of agricultural production. But even when we're talking about this, we're still not looking at the whole picture, because I guess how many people actually buy palm oil from the supermarket and just have it alone? It's actually a product that's usually found within other products. And so there's many stages between ingredient production and the final product that we purchase from the supermarket. And all of those stages have environmental impacts as well. So we've talked about the one that's circled, the impact on from agricultural production, but there's all sorts of stages after that. and particularly for ultra-processed foods, because they undergo so many levels of processing, we end up with many impacts from the second stage, which is processing, as well as subsequent stages like storage and warehouses, transport and distribution, things that happen in retail and what happens at the home. So when we compare these products and different diets and consider their environmental impacts, we actually need to think about all of the different environmental impacts at all of the stages of their production. So the aim of my research has been to create a model which displays the environmental impacts of the food system, focusing on ultra-processed foods as the case study. And the reason why I'm focusing on ultra-processed foods is because they're unnecessary foods, but they comprise a significant component of our diet. And so we are able to remove and reduce these foods without having nutritional, very many nutritional impacts. So there's this mutual benefit for health and the environment. We also know that the impacts from the non-agricultural supply chain stages are likely to be significant because they undergo so many levels of processing. And also their impacts are very, they're unknown because they haven't really been quantified. So this is my second to last, I think my second to last slide on this. But I just wanted to highlight, this is the main finding from a recent paper, which is listed at the bottom there. You can search for in the Journal of Cleaner Production, where we've provided a framework to better understand and analyze the environmental impacts of these foods. So that we can look at each stage of production and actually consider the resources that might be used and the environmental impacts that might have. And this is based exclusively on research that has already been done. So since this project, I've been creating a much more complex systems model that looks at all of the relationships between these environmental impacts, as well as additional impacts that haven't yet been measured. And I've tested this model with global food systems experts, and it hopefully will be published in the next, I guess, 6 months or so. And it's really important, I suppose, to consider these complexities and how these things relate, because their impacts are actually all related, and food systems are not stagnant. But just to finish up on this topic of the environmental impacts of ultra-processed foods, I wanted to leave you with 3 key learnings that I've had, and hopefully that you've also taken away from this very short introduction to this topic. The first is that the environmental impacts of all foods need to be appropriately measured. We can't just look at greenhouse gas emissions and assume that that's the entire sustainability footprint. We need to consider all sorts of different environmental impacts at every stage of production. The second thing is that the environmental impacts of ultra-processed foods are significant, mostly because they comprise such a large proportion of diets in high-income countries. And as I mentioned before, that proportion is increasing in low and middle-income countries. And some of these impacts are very significant because of the types of ecological impacts that they're having, such as like deforestation due to palm oil production, and palm oil is a key ingredient in ultra-processed foods. And finally, these impacts are avoidable because they're not a necessary component of a healthy diet. So I hope that was an interesting kind of whirlwind overview of the type of research that I'm doing as part of my PhD at Deakin University. And next, I wanted to kind of swap into my other area of interest, which is the role of young people in healthy and sustainable food systems. So as a young person myself, I think it's incredibly important that we are able to contribute to the future of our food system. And I love this quote from a recent article that I actually co-authored with Corinna Hawkes and a number of other incredible female researchers. And we, in this article, there's a quote that says, young people must play a part in decision making. They are the ones whose lives and futures are affected by intergenerational inequalities. So I'll just spend a few minutes going through this, going through a couple of examples of how young people are involved in creating a more sustainable and healthy food system. And I'm really just skimming the surface of the things that I've been involved in, which is a very small proportion of the activities that are actually out there. There are many youth groups, and I'm still trying to understand the whole space because there's lots of people involved. So the first thing that I wanted to raise was the COPs so the conference of the parties. So you may, you heard kind of from some of the other presenters, Laura mentioned the COPs as well. So these are climate change conferences where governments sign on to national agreements and targets to reduce emissions. Incredibly important events. And you also heard from Laura that COPs really haven't done a good job of discussing agriculture and food, which is really important because we know that they are a huge contributor to the greenhouse gas and greenhouse gas emissions of countries in the world. So a group of young people, including myself, there was, I think, 12 of us last year, got together to write an open letter to COP26, which was the COP that happened last year, to ask for the inclusion of diets and food system changes in the COP agenda. And we had quite a wide range of organisations sign on to this, such as World Wildlife Fund. GAIN hosted the letter on their website, and a number of university institutions, a number of different foundations, nonprofits, etc., signed on to this, and we presented this to COP26 last year. And we've done the same thing again. So if you search GAIN, the GAIN website, you'll see a COP27 letter, which has been updated, where we've made similar requests. And actually, it's really great. I mean, we're a very small piece of this pie. There's also a group it's run by the World Wildlife Fund, who's been trying to ensure that healthy and sustainable diets and food systems and agriculture in general is captured at COPs. And we're having some traction this year. In COP27 is going to have two food production and consumption pavilions, as well as the first ever adaptation and agricultural day, which I believe was announced recently. And as per the previous COPs as well, there'll be another Youth and Future Generations Day in this COP as well, which is great. We do obviously need to see this translated from discussions into real action and agreements and targets that encompass agriculture, but I do see this as the first step towards that. So that's COPs. Let's talk about the 2021 United Nations Food System Summit. And I've also got the Act for Food, Act for Change logo up there as well. So we saw young people heavily involved in the Food System Summit last year. There were over 100,000 youth who got involved in one way or another. And one of the key ways that people got involved is through the Act for Food, Act for Change movement, which was an adjacent movement to the UN Food System Summit. The top left image there is from the Global Youth Dialogue, where 100 young people came from across the world, met over Zoom to discuss what good food meant for us. And in the small breakout group that I led, we discussed things like the importance of policymakers to prioritise health and environmental sustainability and equity over profits, the importance of introducing grants and loans for young farmers and independent manufacturers, because the food system space is absolutely dominated by these large transnational corporations, and we need to enable young people to find a way in so that they can have meaningful careers in this space. Not surprisingly, based on my earlier presentation, we also discussed the importance of regulating unhealthy and environmentally degrading ultra-processed foods. And finally, we discussed the importance of meaningful engagement with young people as well. And it was really amazing. This was a great opportunity because on the bottom right of the screen is a screenshot of a few of us presenting some of these key findings from the Youth Dialogue to the UN Deputy Secretary General, which was just an incredible opportunity to be able to speak directly with her. And Act for Food and Act for Change was a pledge and voting system for top priorities of youth. And essentially out of this, we had 100,000 people vote, young people, who ended up voting for everyone should be able to afford healthy and nutritious food as the top priority. Sorry. Apologies, I'm talking so quickly, I started to lose my voice. Yes, moving on from the UN Food System Summit onto the last slide, which is the World Food Forum Young Scientist Group, and I guess a general discussion of the World Food Forum. Apologies. So thank you, Divine, for mentioning this. The World Food Forum is an independent youth-led global network of partners facilitated by the FAO, and it aims to speak to a global movement that empowers young people everywhere to be involved in agri-food systems. And the Young Scientist Group includes 18 researchers who are under the age of 35 who are working on sustainable, healthy and equitable food systems from across the globe. And I was really honoured to be selected as one of those for this year. And essentially our goal is to provide scientific evidence and technical knowledge to various initiatives within the World Food Forum. And I think I just wanted to highlight as well, there's a World Food Forum link on that screen. If you type that into Google or just type in the World Food Forum into Google, you'll find the website. And there's a whole range of resources on there for young people to get engaged. There's various different information programs, as well as often events are happening. And just wanted to highlight as well that the World Food Forum flagship event is on the 17th to the 21st of September. So if you're interested in this space, that's a free event. It'll be streamed online as well as in person in Rome. And you are very encouraged and welcome to join us for that event if this is the space that you're interested in, as well as sign up to the various different activities on the website. And I'll leave it at there because I know that we've run a little close to running overtime, I suppose. And just wanted to highlight some further readings. The top one there is the paper that I was talking about, and always happy to chat more about any of these things, either via Twitter or email. And thank you.
Oh, thank you so much. It was great to have you, Kim. You had a lot of enthusiasm when you talked about your research and the work you've done as a young person in the field of food systems and sustainability. Thank you so much for sharing the amazing opportunities and the youth platforms, and for introducing us to the World Food Forum, which is sponsored by FAO, and for also offering us this amazing event. I'm sure we will share all these informations with our participants. Thank you so much. This concludes our presentation for today. Thank you for Dr. Devine, Dr. Laura, Kim, and Anissa. So we have a couple of questions from our participants, and we would like you to answer them if that's okay with the panelists. The first question is for both Dr. Devine and Dr. Laura. Let's hear from Dr. Devine first. The question said, regarding the commitment of the global government on these agricultural emission issues that you both mentioned, do you think, is there enough commitment, and how we can improve this condition that you are gonna offer us? Dr. Devine has this exposure as a United Nations organization affiliated personnel, so you can maybe walk us through this global commitment. Dr. Devine, do we have you with us? Okay, I think maybe we face some technical problem. For Dr. Laura, she was unfortunately she had to leave, but she left some comment. She said that she would have been excited to talk in details regarding these international treaties. She said that agricultural contribution has been recognized and there is movement to address them, but much is more needed to be done. And she shared some interesting links that will also be shared with you later, guys. Do we have Dr. Devine now, or should we move to the next question? Okay, so it seems we don't. So the next question is addressed.
No, I think we have Dr. Devine with us. Can you hear me, Dr. Devine?
Dr. Devine? Okay, maybe we'll try to get to him, back to him at the end of the round of questions. Maybe he's away from his device or something. So the next question is addressed to Anissa. It says that what can you do based on your experience as a veterinary student to advocate for better zoonotic disease management and particularly focusing on food systems aspect? Maybe you can share the answer that you shared in the Q&A box.
Okay, thank you very much, Sid. So first of all, as a vet student, I also have, not that many experience, but based on my experience, to have better advocacy, the first step that I will recommend by joining organizations or like forum that consists of like-minded people that interesting to do better, especially in food system. And I think by joining or finding like-minded friends, you can accommodate your idea and boost your learning process. And also as organizations, you can find a way to deliver your advocacy better. I think that my answer for the questions. Thank you, Said.
Thank you so much for that. I have a personal question to Kim next, if that's okay. You talked about various opportunities in which you can be affiliated with organization in order to promote for this cause of youth involvement in sustainable food systems. What other advocacy tools that we can use other than these youth organizations? And do you think that we can be involved on our local and national levels? And how so, if you can answer that?
Yeah, thank you so much. That's such a great question. Look, I'm still trying to understand this space as well. So I've only been involved in this for about 18 months, and it's a really big space and there's so much happening. So I think the easiest way to start to get involved is to join an existing group. But there's also many local communities doing things as well. So there's local food co-ops that you can join to do things that are kind of tangible in your own neighborhood. Different gardening groups as well are really popular in some places, and some places they need to be introduced so that you can have local gardens that produce sustainable and healthy foods nearby. In terms of national contributions, it really depends on your government and how open they are to having young people involved. I know there's some work being done, I believe it's in the Netherlands, I hope I've gotten that right, that young people are actually heavily involved in some of the food and agricultural policy changes that are happening there. That is not necessarily the status quo, and it's certainly not the case here in Australia. So it can be challenging to engage in national governments if they're not interested in hearing from you. But hopefully that will change as more and more youth roles actually come into Parliament. And we even saw this week there's a new youth body that's being created within the United Nations, which is a huge step forward for youth engagement in all sorts of governmental processes or intergovernmental processes. And hopefully our own national governments will follow that as well. I think the easiest way is to try and connect with whatever you're passionate about. If you're passionate about local food systems, reach out, find someone else who's doing that and work together on creating a community garden, joining a co-op. If you're passionate about policy change, try and join one of these kind of international groups. That's what I'm passionate about. So World Food Forum is an example of one. The United Nations Food System Summit was a great one. There's a group that meets as part of the World Wildlife Fund. And from those, you can meet people who are like-minded and create your own initiatives, which is what happened with the COP26 and 27 open letter. That was an independent group of young people who met through those various different programs. So they will kind of spiral and build, but they do require a fair bit of time to kind of initially get engaged.
Oh, thank you so much for this elaborative answer. I'm thankful. There is a lot to consider. Thank you so much. We had a question that was directed to Dr. Laura. I think we should share it because I really like the answer she provided. This question was, is there any differences between the management of animal manure between developed and developing countries, and how we can lessen the gap? Because you keep talking about the impact of this maybe relatively neglected aspect of environmental and One Health. She said that in developed countries, there is concentrated animal feeding operations called CAFUs that house hundreds of thousands of animals together, producing massive amounts of waste. For some, the manure is stored in large lagoons. During hurricanes, the lagoons get flooded and spread manures to the surrounding environment and contaminated ecosystems. We need to figure out what to do with all this manure that's being produced. Some should be composted and used to replenish the depleted soil because many soils are becoming degraded. But in most cases, high nitrogen synthetic fertilizers are being used in crop agriculture rather than manure. This high nitrogen synthetic fertilizer is a major source of nitrous oxide, which is 265 times more potent than carbon dioxide at trapping heat in the atmosphere. So it's exacerbating climate change and adverse effects of agricultural practices. So I really like this. Lastly, I don't know if we can get an answer from Dr. Devine. So I can repeat the question. From your exposure and work in UN agencies and also on private sector, do you think that there is enough global commitment toward reducing green emissions and addressing waste, agricultural waste and animal waste as a way of compacting climate action and working toward One Health?
Well, no, I would say, I mean, it is an evolving issue. I wouldn't say there is enough commitment already. I mean, for one thing, awareness is just getting, increased right now. And a lot more needs to be done. A lot more needs to be done at different levels, government as well as private sector. More commitment needs, is required, and obviously more action is required. We're dealing with very, very complex issues, and so far the measures we are taking are only addressing marginal, it's only marginal issues, and we're not really, I don't think we can make a dent on the issues using only the measures that have been put in place at this point. That's what I can say. There was also a question about commitment from countries and so on. I am not a climate expert, so I wouldn't. But if there is interest, I can take further questions and then come back to the whoever is interested in these issues after consulting the experts on this. Thank you.
Okay, thank you so much. Thank you so much for that. So I think that concludes all the questions that we have today. For the participant, please don't hesitate to email us any question that you have to speak to the speakers. We will try to communicate them. Maybe to have final remarks from our esteemed speakers and guests. In 2 minutes, what is your final message, Dr. Devine, to our participants and the young who are involved in One Health?
Yeah, no, so for me, I would just like to underscore again the importance of holistic approaches. And then the second point is that in order to change the situation, innovation is required. And young people are the key to innovation in terms of bringing new ideas and doing things differently. So I would say the change has to come from the young people, and so this is one area that we should put more emphasis on. Thank you.
Thank you so much. It was a pleasure to have you. Maybe to hear from Anissa next.
Yes. said? Sorry. Can you please repeat the question? Sorry.
Yeah, we just want to have a final message from you to the young people who are involved in One Health in all its aspects.
Okay. Thank you very much for the opportunity. So it was my pleasure to share my insight and experience. So talking about the food safety and security, I think it will be our challenge to provide the food safety and food security for everyone from now and to the futures. And I would say that to all young people, please try to be brave and share your opinions. Try to be brave to take any opportunity to engage more and then to boost our knowledge and experience, because I believe that as a young people, we have the roles and responsibility to the future. Thank you.
Thank you so much. It was a pleasure to have you. And lastly, let's hear from Kim.
Thanks so much. Thank you as well for having me today. And thank you so much to the attendees for listening and being interested in this. I think the fact that we're increasingly having these conversations about food systems that involve youth, from youth to youth, is incredibly important. And also it does kind of raise our voices, which is really essential to move forward to a food system that is equitable and sustainable. So continue to be engaged in conversations like these, try and reach out to others to discuss these issues. There are so many different views on these topics, so as many people as you can talk to about it, the better. Reading scientific literature, of course, is key as well. And don't be afraid to speak up and voice your concerns, solutions, opinions, because that's the only way that we're going to move forward on this. So thank you.
Thank you so much for your message. So to conclude this session, context-specific interventions should be evaluated toward optimizing nutritional resilience, minimizing environmental footprint, and reducing animal and human disease risk. The food system challenge is much more complex than we think, as we have seen by our speakers. We need to address sustainable intensification, food loss and waste, and dietary shifts all at the same time to reach a food system that is healthy and environmentally sensitive. Youth may engage in a variety of ways with the multifarious activities and functions involved in food production, processing, marketing, distribution, consumption, and waste management to work toward planetary health. Thank you all for going through this session with us. We hope that you got the maximum benefit. It was my honor to moderate it. Our greatest gratitude and appreciation to our speakers who allocated time and effort to share their expertise and work experience in the field. See you all soon, and salam. So this concludes our session. I know we have 20 minutes, so rest, take a break, and see you next, guys.
It's taken a pandemic to help us realize just how sick our world has become. We've been slaves to materialism, building our personal empires and countries' economies. We convinced ourselves that life was great. We were connected to everyone, and yet no one. We ignored the cost to ourselves, other people, and our planet. When COVID-19 arrived, it forced us to stop. We had time to question our way of life. If we had done things differently, could we have been better prepared? As people lost their jobs, their health, their loved ones. As children learned differently or stopped learning altogether. As those who were already suffering suffered more. We've realized we can't go on as before. How can we say our economies are thriving when the cost to our societies is so high? There is a way out of this, and we all have a part to play. Countries should be measuring their success by the well-being of their people and the environment they live in, not just by deals and trade or profits made on products that are threatening our world and our own survival. We need to stop pursuing the same old self-destructive priorities and create conditions for people to live better lives. Health should be factored into everything, both globally and locally, because we all need healthy environments in which to live, learn, work, and play. Some countries are already getting this right. Bhutan has a gross national happiness index, where indicators such as living standards, community vitality, and psychological well-being drive a more meaningful and sustainable way of life. New Zealand has a well-being budget, which uses human health, safety, and flourishing to assess the success of its policies. The UAE's happiness agenda ensures the government prioritizes happiness across all its policies, while Finland and other Nordic countries have adopted a health in all policies approach, growing the well-being of their people. Other countries are also finding new ways to move forward. But more of us need to come together and hold each other accountable for taking the incredible amount of information we have to promote better living and turning it into real action to transform our lives. COVID-19 has cost the world dearly, but it's also given us a chance to change the path that we're on and create the future we want.
A tragedy is unfolding. It won't make the headlines tonight. Aid and relief won't be sent. Lives will be lost. Millions more hang in the balance. It's been recognized as the biggest global health threat of the 21st century, and it's not happening somewhere else. It's all around us, yet it's almost invisible. Our air, drinking water, food supply and shelter are all at risk. Climate change is not a distant concern. It's a catastrophe already underway. Our health is extremely vulnerable to the environmental factors driving climate change. Air pollution alone is related to 7 million premature deaths per year. The knock-on effects and costs of this health crisis are massive, and healthcare still remains largely focused on treating only the symptoms. The time has come to shift policy, regulation, and investment to address the causes of climate change, not just the effects. The true cost of emissions and pollutants includes human health and the financial and social impacts on communities and society. By assessing and regulating sectors like energy, transport, and agriculture, air quality can improve greatly, saving millions of lives and exponential costs. National and local governments need to recognize climate change as a major threat and take steps towards mitigating its effects. We are facing the greatest challenge in human history. Our survival depends on urgent change. Let's change our story together. World Health Organization.
Our home has always been a safe haven for our health and well-being, to be nourished and protected. But it also conceals our issues from others, silently growing and building up until the walls give in. The pandemic had a dramatic impact on medical responses to non-communicable diseases, such as cancer, diabetes, lung and heart disease, and mental health conditions, leaving an already fragile structure even weaker. Prevention, diagnosis, treatment, rehabilitation, and palliative care took a toll and left people living with NCDs and mental health conditions all over the world isolated, without the life-saving health services. Or even worse. We are all made of the same materials, but with different building blocks, each one of us with our own lived experiences. Let us open our doors and share our knowledge with other individuals with lived experience. creating agents of change and inspiring others to join the movement. People with lived experience can provide expertise and insights to help build and shape policies, programs, and services based on shared power between people and institutions. Let us build a future together, established on the foundations of respect, value, and dignity for all.
Our planet, our health. Our planet and our health are interrelated. For our health and well-being, we need access to clean water, clean air, nutritious food, an environment that facilitates our mental and physical well-being wherever we live, and quality health services for everyone, everywhere, and at all times. And we expect this on our planet, to which we have not paid enough attention. Our actions are depleting and polluting our natural resources, creating a crisis that threatens our health and very existence. The impact of climate change, floods, forest fires, droughts, intense rainfall, rise in temperature are causing huge sufferings, displacing and killing people, impacting their health and livelihood. Outbreaks of infectious diseases, trauma, injuries, heat strokes, malnutrition, and undernutrition resulting from food shortages due to crop failures are also related to climate change. Today, climate change has emerged as the single biggest threat. Our ever-expanding unplanned cities and habitation areas, changing food habits, unhealthy lifestyles are contributing to the growing numbers of people affected by life-threatening and debilitating diseases such as diabetes, heart ailments, respiratory illness, obesity, and road traffic injuries, to name a few. Every year, 13 million lives are lost globally due to avoidable environmental causes. Air pollution alone causes 2.4 million deaths in our region every year. 9.2 million people die from non-communicable diseases in the region every year. 1.6 million people die from tobacco use in the region every year. Additionally, tobacco farming and tobacco packaging add to environment and health hazards. These unfortunate deaths and sufferings also speak of the pressure and the state of our health systems. The ongoing pandemic has exposed these inequitable and unsustainable systems in which we exist. The pandemic has also provided an opportunity to build back better and greener. We must act now for our planet, our health. Protect and preserve nature. Promote afforestation. Improve air quality. Stop polluting agricultural practices. Promote sustainable farming. Protect drinking water supplies. Build climate-resilient and environmentally sustainable healthcare facilities. Ensure water and sanitation are integral to primary healthcare services which are accessible to all. Promote climate-resilient water, sanitation, and hygiene. Promote environmentally sustainable practices. Ensure quick and healthy energy transition. Rigorously enforce air quality standards. Increase investment in public transport infrastructure. Promote healthy and sustainable food systems. Build healthy, livable cities with green and healthy spaces that promote physical activity. Promote cleaner fuel for cooking. On World Health Day, WHO is calling on one and all to act together to protect our health and our planet for a healthier tomorrow.
Recent decades have witnessed great progress in human and technological development across the globe. We live in an interconnected world with easier access to commodities and services. Life expectancy and living standards are better than ever before. However, this progress has come at a cost and brought new challenges. In a highly competitive world, we are encouraged to produce more and consume more. The natural resources are becoming scarce, and climate change has led to extreme weather conditions. We have reached a time period during which human activities have had an environmental impact on the Earth's ecosystem. We have transitioned into a world with different vulnerabilities, including poverty, loneliness, and a rising pandemic of mental disorders and associated chronic diseases and disabilities, putting more pressure on health systems. The causes of these public health challenges are complex and lie beyond individual control. There is a need for a major shift in the current socio-ecological and economic models.
What we have today, we may not have tomorrow, so act now for our health and well-being.
Promoting health and well-being is at the core of the Sustainable Development Goals and the World Health Organization's 13th General Programme of Work. The WHO has called on decision makers to take bold political actions that would shift the world into a sustainable and resilient path. This cannot be achieved by the health sectors alone. The benefits are multi-sectorial, and investments need to be made by all sectors.
Ce qu'on a aujourd'hui, on ne l'aura peut-être pas demain. Alors agissez maintenant pour notre santé et notre bien-être.
Greater political commitments are needed by the highest levels of governance and by all partners across borders to implement the required sustainable change to promote health and well-being.
Lo que tenemos hoy, tal vez no lo tengamos mañana. Actúa hoy por nuestra salud y bienestar.
Here are some ways to get started. Identify an entry point to integrate health and well-being into current policies. For example, solidarity, social cohesion, gender equality, equity, or leaving no one behind. This will integrate approaches and together form a platform for change.
Возможности, которые у нас есть сегодня, завтра могут исчезнуть. Поэтому в интересах нашего здоровья и благополучия необходимо действовать сейчас.
Then identify a champion to support the policy orientation. This can be at the highest level of the governance or at the local level, such as a city mayor. The process for developing policies and ideas to support it needs to engage all sectors, stakeholders, and people at every level.
مورد اليوم لساحة ورفاهية غدوة.
To implement the policies effectively, a supportive governance structure should be in place to enable strengthened legislation and reduce health risks and promote health and well-being, share knowledge, and build networks to address relevant public health issues.
我们今天所拥有的，也许明天就失去了，所以现在就行动起来，来促进我们的健康和福祉。
Transformative and collective efforts will be needed to ensure that we can reach the goals set in the SDGs agenda.
What we have today, we may not have tomorrow, so act now for our health and well-being.
Meet Musa. Musa is a veterinarian. With other animal health professionals, he helps fight animal diseases and improve animal welfare. You know that. But did you know that, in doing so, Musa also helps keep you and your family healthy? The far-reaching impacts of Musa's work should not come as a surprise. In our globalized world, we are all interdependent. Animal diseases can affect the health of people, and human diseases can affect the health of animals. For example, when humans cut down trees, they affect the balance of the ecosystem and of all the creatures living in it. Usual ecosystem services such as food provision or carbon capture can become a challenge. Wild animals are sometimes forced to flee their natural habitats to find sources of food, getting closer to villages. Animals and humans that should never have interacted so closely suddenly do, and dangerous pathogens can jump from one species to the next. Sound familiar? Around 5 new human diseases appear every year. 3 of them are of animal origin, as for example Ebola and most probably COVID-19. 60% of existing human infectious diseases come from animals. Deforestation is just one example. Unregulated wildlife trade, climate change, all affect environmental health and with it, animals and humans. Musa and his colleagues are at the forefront of the fight against diseases that can affect the health of all. To create a healthier world, they need to work in collaboration with other sectors. The World Organization for Animal Health helps them come together with other experts to share essential knowledge, to build a global network, and to design a common response to global threats. Because we all share one world, we all share one health.
You might have heard people talking about universal health coverage, but what does it really mean? Think about it this way. What do you need to get, be, and stay healthy? Can you get help from a well-trained health worker? Can you get treatment that helps you get better and is safe? Can you get the medicines and other health products you need? Who will pay for it? Are there policies in place to ensure the services you need are available to you, your family, and your community next time and every time? And does your government have accurate information about the whole system so they can make the right decisions to keep everything working the way it should? Good health needs people, services, products, finances, policies, and information. And it needs all of them to work together, even in times of crisis. And good health systems don't just treat sick people. They help to promote healthy living and prevent people from falling ill in the first place. The World Health Organization is working around the world so that all people and communities receive the quality services they need and are protected from health threats without suffering from financial hardship. That's what we call universal health coverage. So, here's to health, for you and for everyone.
Hello, hi everyone. Welcome back to this session. I hope you enjoyed the break. My name is Hezron Nyakin. I'm part of the organizing team of this conference, and I'll be moderating this session on youth success stories. So Youth Success Story is a session that was curated to share amazing work that is being done by youth by young health and care professionals and students in stewarding planetary health. So the emphasis of this session is to explore the different initiatives youth have in their workplaces, teams, universities, clinics, or government implemented related to planetary health. COVID-19 and the ever-increasing urgency of climate change shows there has been a more paramount time to foster multisectoral and interprofessional collaboration for global health and food security. We hope that by the end of this session, you'll be inspired to take action in your spaces and solve existing challenges. So this session is going to consist a 1 hour speaker presentation. We'll be having 2 speakers and 30 minutes interactive Q&A session. So I'd like to encourage each one of you to be active, ask questions on the chat so that they'll be responded at the end. So ladies and gentlemen, I'd like to introduce our first speaker, who's Nabukera Winnie. She's a young nurse, sonographer, and leader. She is a mentor, speaker, and coach. She serves as a CEO at Little Winnie Foundation and the principal nurse and midwives mentorship and coaching program. Aside from that, she's also a student at the Aga Khan University. So Winnie is also passionate about people living with a healthy lifestyle and youths getting out of their comfort zone to do something for their future. In addition to that, she is passionate about personal growth and development of nurse and midwives for better living and people at large. So I'd like to welcome Winnie. Winnie, if you can hear me.
Yes, please, I can get you.
All right, thank you. Just a moment, we'll share your slides. All right, please confirm if you can see the slides.
I can see them, Hezron.
All right, please go ahead. You're welcome.
Amazing, amazing. Thank you so much, Hezron, for that wonderful introduction of me. I'm really so much honored and glad to share to this amazing space, sharing my youth success story to you, dear participant. It is really amazing. Thank you so much for the opportunity. As Hezron introduced me, my name is Winnie Nabukera, a young nurse leader, a mentor, a coach, and the CEO Little Win Foundation, and as well as the principal, the Nurses and Midwives Mentorship and Coaching Program. I'm also a team leader and career guidance clinics in the nursing schools, also a certified personal growth and a health coach. I'm passionate about people living a healthy lifestyle and youths getting out of their comforts and doing something for their future. I'm also a nurse sonographer by profession and as well as a student at Aga Khan University. I'm a Ugandan, a proud Ugandan, and I must say this is really amazing. It is a very great opportunity for me to be able to share this amazing space with you. So as Hezron has introduced, I'll be sharing my youthful story with you just to encourage you to maybe, pick a word or two from my presentation that you will think about and probably be able to integrate in your own life as well as an individual. So I created a few objectives that I'll be sharing with you. Number one, being able to know who is Winnie, my life story, get to know what is my purpose in life, what impact have I been able to make in my community, what projects do I have here in Uganda, and my key learning lessons from whatever that I've been able to do in here in Uganda. So I guess now you know me, who is speaking to you, what is she passionate about, who is she, and what she does. So I'll right away go to my purpose. I'll right now go to my story. I'm now going to be sharing my story to you just to know where has Winnie come from, who is she, what has she gone through, and where is she at the moment. So I was born by a family way back, right back in the villages of Masaka, born in a family of 4 children where I was the firstborn, the elderly among the 2 girls and the 2 boys. But my father was a doctor and my mother was a nurse as well. Growing up was very challenging for me because at one moment my father separated with my mother and she had to actually raise us single-handedly. I know it is not something very easy, especially in this arena where everything is very expensive, where life is very dynamic and so many of those things. But I'm so glad she did what she could to be able to raise me and my other siblings into, very powerful women and boys who are really impacting the community positively. I've been able to go through formal education, right from my primary, secondary, and then when I finished my senior 4, I joined a nursing school here in Uganda where I trained to be as an enrolled nurse. And I'm glad the journey has been amazing. The journey has been amazing because number one, I was passionate about what I was doing and I had to make sure that I put in all my energy to be able to, get all ends make my mother proud because as well, she's a nurse. this, and I actually got passionate about health because I saw her do the job excellently well. So I qualified as an enrolled nurse in 2019 in one of the training schools here in Uganda. And I really enjoyed my stay in the hospital, my stay in the nursing school, where I got so many opportunities, where I got exposed to so many things and all those things. So in 2019, when I qualified, I'm now going to be sharing more about my purpose. That has been my story from the time when I was born to the time when I qualified. So looking into my purpose, when I qualified in 2019, I asked myself as Winnie, as a young nurse who has qualified, what can I be able to do into this world? What impact can I be able to make into my community? What value addition can I be able to make? So I remembered my struggling mother, who was a nurse way back in the village, who had actually been separated with a father who seemed to be, useless and all those things. I remembered what I went through. I remember around her clinic, there was a street that was called Magombe Street. Magombe, just to translate, means a dead street, on where old men would go into intercourse with younger girls and with young girls and actually expose them to HIV/AIDS. Yes, they knew it was HIV, and they knew if they had intercourse with these young girls and boys, they could definitely, get exposed to HIV. So integrating into all that and then getting into the nursing school, seeing these young girls and boys, very young, coming to the hospital way back in the nights, and then seeking HIV treatment, maybe PEP treatment, and seeing them, very unhealthy, very young, around 15 years, 16 years, someone is already toiling within the disease. So that is where I connected all the dots and felt probably I could start up an organization that can be able to create awareness about HIV/AIDS among the youth. I was just so passionate about HIV, because when you look even on the statistics, HIV has been an epidemic that actually has been a global concern for so many of the years. So I thought, and actually when you look at the different infections, over 5,000 infections that occur every day, and among which HIV being so much prevalent among the young girls, ranged between the age of 15 years to the age of 24 years versus men, I thought my heart, my body and soul got stuck to HIV and how it was, so rising among our young girls and boys, especially here in Uganda. So I started up an organization, I still in 2019, that I termed as Little Win Foundation. Of course, I had to organize my friends, put them on the team, and we started the work. I'm so grateful. We have done amazing work, and our vision was to create an HIV/AIDS-free youth generation. Which objectives we have been able to do: health education among the young girls and boys in schools, promote life skills among the young girls and boys in school and those out of school, and also being able to care and support for those that are infected and affected by HIV/AIDS. So recently, we have been able to think and re-strategize about Little Win Foundation, just to make it a little more sustainable, because we have been having a lot of projects, but then we didn't have finances to be able to work on our programs and the projects. So we are now ensuring that we integrate SRH and HIV as well in our social enterprise, which will be Little Win Foundation. And in there, we are looking forward to integrating health rights related to SRH and HIV among young girls and boys in schools. So we look forward to be able to, work with different schools, engage with the different young girls and boys, so that we disseminate knowledge, information into these young girls and boys. And our end goal, our big audacious goal is for every student, for every young girl and boy in school will be able to make informed decisions about their health as they brighten up their future, to keep in school, but also have a better future. When you look into the previous slide, we have done a number of school model programs on where we have visited a number of schools. I don't know whether Hezron you can, oh, awesome, thank you so much. So when you look at this part of my teams of Little Win Foundation, our managerial teams that we work with, and our student leaders in there. There's so many pictures, but I just had to pick out a few of them. So it has been a journey of learning, a journey of relearning, and a journey of unlearning a lot of things. So basically that is how I got to know my purpose, because I felt probably I could impact more the young generation by helping them to keep healthy in school, but to as well have a brighter future. Let's go to the impact. What has a Little Win Foundation impacted to their community? As I shared, we have a school model program that is now integrated into SRH and HIV/AIDS. So we work forcefully to help these young girls and boys be able to make informed decisions. Hezron, let's go to the slide that has the impact. We are now working forcefully with the schools to help the students to be able to make informed decisions about their health, but as well have a brighter future. And as well, we do create up clubs in these different schools. We do elect student leaders so that they can take an initiative of passing on the same information of SRH and HIV to their same fellows. We have been able to visit a lot of schools, and as well as creating different AIDS clubs. As well, we have been able to go to the different places, including churches, schools, communities, engaging them about health. As you know, our communities are very sick with very many chronic illnesses, including HIV, including diabetes, hypertension, cancer, and probably they don't have a fully equipped knowledge on how they can manage their illnesses. We do that. We also carry out online health campaigns and around routine health discussions so that we can impact more people with knowledge, information, free consultations from our team consultations, including the doctors, the nurses, the midwives that we work with. So besides that, we also do free vital body checkups. That is in the different engagement areas that we go through that I talked about, including the schools, churches, and so many of those. So as Ariaron shared, that now we want a Little Win Foundation to be a social enterprise. We are looking at the different ways on how we can integrate the different projects to be able to bring in money to be able to sustain our programs. So I went for some mentorship program where I got skills, and I started up an initiative that is called the Nurses and Midwives Mentorship and Coaching Program. It is a program that I really designed to help health professionals, to help nurses and midwives be able to find their purpose in life, their passion, and also knowing on how they can turn all that into profit. But as well, looking at that, as you know, the health sector has a lot of problems. It is only the resilience that we need. But you can never be resilient minus getting to know, minus getting to be able to redefine your professional purpose, know your call of the profession, and being able to be resilient in one way or the other. So the big vision of the mentorship was to create a new generation of resilient nurses and midwives who are confident with purpose. I know so many nurses and midwives are not confident and they cannot be able to speak up. So my goal, my vision is to see nurses who are confident, nurses who are resilient, and nurses who have purpose. I know so many people, when you are not able to find your purpose at a very early age, you actually don't enjoy life because you don't have what to offer. But when you get to find your purpose at a very early age, you realize there is much more you can explore into this world, and actually you can as well make a very, very great impact. So among the objectives that I put under the mentorship was to empower nurses and midwives find a work-life balance, how they can be able to balance their work, their family, their social life, and so many of those things. Then to also transform the attitude of our health professionals. I know so much is said about the health professionals on how the attitude is very, very, poor. But I know actually from the mentorship, attitude is actually a choice. You either decide to be negative or to be positive. But remember, you cannot be resilient and then you don't have a positive attitude. So it is also another thing that I'm looking forward to fostering, and also having a change of our health professionals have a positive attitude. Then to also prioritize their own personal health needs, because Hezron, you can go to the next slide. Thank you. To also help them to be able to prioritize their own health needs, because realize, yes, we do so much work to our patients, but then we don't prioritize our own, and we therefore get sick because of the works we do, and probably actually our works becoming hazardous. But then it is high time we prioritize our own health needs to be able to give what we have, because you can never be, poor at health and then you give health. No, it has to be actually be health to health. So another thing I look at among the objectives is being able to promote entrepreneurship skills. I love people that are innovative. I love people that actually create innovations related to health, because what other people are doing is they actually incorporate whatever they're doing into what health does, but they can never understand it fully. We, the health professionals, understand our system better. But what happens is we can never want to think outside the box, and that is why other people are taking advantage of us and then creating up initiatives. And then for us, we are like second persons. So I'd love to train nurse entrepreneurs, health entrepreneurs, midwife entrepreneurs, so that they can be able to formulate initiatives among their own health knowledge and whatever skills they got into their trainings. I'm glad I already implemented this. Our first cohort, that was the Go-Gators, started way back last month in August, and I'm so humbled. They're finishing their training, their 8 weeks training in October. And there are 15 of them. They're so passionate about what they're doing. And actually, they're so informed, and they can't wait to explore and impact other nurses as well. So the second cohort will be starting as well in October, as we graduate already the first 15 health coaches that will be finishing up. Together in that mentorship, I incorporated in career guidance clinics within the nursing schools, because I realized, yes, we are targeting the in-service nurses and midwives, but we have also these young girls and boys that are passionate about health, that are passionate about nursing, and probably we cannot leave them behind. So we also want to encourage them to be able to get to know the reality of what happens, life after school, get to know their purpose into the health calling, but above all, get to know their potential. And actually our goal as we work with this, as we implement career guidance into the nursing schools, is being able to help these young nurses and midwives to be able to maximize their potential to gain full employment. As you know, employment is so poor here in Uganda. Yes, you can get a job, but the paycheck does not actually correspond to your input. So we want now to train more nurse entrepreneurs, more health entrepreneurs, to be able to maximize their potential to gain full employment. That yes, you may not be able to wait for a job somewhere, but you can as well, start up something in the health knowledge that you have gotten. You start up something and then you can be able to succeed as well. Let's turn the next slide. Oh, awesome. So yes, that journey, as I said, is amazing. I've been able to learn a lot of key learning lessons. One of the biggest lessons that I got to learn earlier is being able to have a goal in life, being able to have a vision in life, being able to know who you are and why you want to be. I know so many of us always think maybe someone else will come and tell me who I want to be. Maybe they will help me implement my goal, but no way. You must be able to sit and think and know, what is my goal in life? Where do I envision myself 30 years, maybe 20 years, 10 years, 5 years from now? It is a very, very key learning lesson that I've been able to learn at my tender age. And I wish every one of us is able to really get to know who they are, where they want to go, and then being able to align yourself with the goals that you want to get. Another key learning lessons that I learned on this journey is being able to have a mentor. To have a mentor that is actually a role model to you, a mentor that has moved this journey for whatever field that you want to be, to get in. Maybe it is about someone who is a role model to you, maybe the doctor, maybe maybe a CEO somewhere, and probably you want to do the same thing like them. It is always important for you to have a mentor in your life, because they have moved this journey and they have made it all. So it makes it easier for you to actually, have someone along your way of success that will be able to tell you there is a pit there, there is a hole, please don't go into it. So for me, it has been a great lesson for me, because I was able to choose my mentors right in my earlier years, and the journey has been amazing. So, and also being able to be positive and also surround yourself with a tribe of like-minded people. The world is full of noise, a lot of chaos. So sometimes we don't make, decisions because we don't know what to choose. Someone is talking this, the other is talking the other, and you get confused along the way. So having a family of like-minded people will be able to challenge you, will be able to push you, will be able to encourage you so that you can turn into a better version of yourself. Another thing, key lesson that I've learned to this journey is being able to believe in yourself, that you can make it. I know there is no someone who will tell you that, hey, Winnie, you can make it, if you can't actually believe in yourself. But if you have a belief that, yeah, I'm destined for success, I can make it, I can be who I want to be, definitely you attract that person. And trust me, you can be it, you can be it. Another thing is being able to work on your plans each day. Yes, so many times we have so many of those good intentions, but we can never put them into good actions. Like you have a lot of plans, you have a lot of things that you want to do, but actually you can never do them. So the deal is work on your plans daily, build up the blocks daily, day by day, and trust me, you make it. So those have been the key learning lessons for me. Let's run the next slide. And yes, they have been key learning lessons for me, but of course, on a journey of success, a journey of self-improvement, you can always have challenges along the way. I just put two of those, as I shared, like my mother and my father got separated at a very young age. I didn't actually get that love. And to me, I feel sometimes probably it has affected me in one way or the other, but I'm working upon it each day so that I can become a better person who may not actually be able to miss my parents' love, but to feel probably God's love is amazing and it is always fulfilling. So another thing, as I shared in our social enterprise, that is Little Win Foundation, we have so many projects that actually want to do. And as I shared, like our big audacious goal in our social enterprise, which is Little Win Foundation, is to actually become a one-stop center of SRHR and HIV information unit in Africa for young girls and boys. It is really so big, but you can never do it minus actually having the resources that you need to be able to tackle other schools, including in urban places, in rural areas, and so many equipment, so many resources that you need to be able to implement all the projects. I feel that has been a challenge to me and my team as we continuously implement and impact our communities as well. Hezron, the next slide. So I really love to thank you so much for listening. As I conclude, we can all be who we want to be. You and me can be able to know and be that kind of a person that you want to be. So the only thing you can do is to be you, to act you, and live you. You can never be like someone else, but the greatest thing you can be is being able to be you. So the better person to push yourself to be able to get your goals and destined to your success is actually you. No one can ever push you. But if you know what you want, if you work towards your goal, if you push yourself, each day, every day, definitely, you can make it, and success will flourish over you, will be with you, and you can make it. So together we can make the change. And remember, success is never valid, is never significant before you impact the people around you. So I love you so much. Thank you so much for listening. If you want to get connected to me, those are my names and those are my handles. Thank you so much, Youth Hub, for the opportunity that you have been you've been able to give me to share my humble story. Thank you so much. Back to you, Hezron.
Right. Thank you so much, Winnie. I think that was a really great presentation there. The work that you're doing, it's really amazing. And we'll be having questions at the end of the presentation once we have our next speaker. So just hold on there as we get to the next speaker. So I now would like to introduce our next speaker, and that is Daniel Waruingi. So he's the co-founder and heads of program at Students Against Superbugs Africa. He is a Bachelor of Pharmacy student at Jomo Kenyatta University of Agriculture and Technology in Kenya. Daniel is passionate about strengthening health systems, policy making, and prioritization of antimicrobial resistance in African countries. He is actively engaged in empowering students and early career professionals throughout Africa to be active advocates in the fight against AMR. He has vast experience in leadership, having served in leadership positions across different health platforms and student organizations. Daniel has also received several grants and awards in his work. So at this juncture, I'd like to welcome Daniel Waruingi. If you can hear me, Daniel.
Yeah. Hi, Head. Can you hear me?
Yes, I can hear you.
Okay. Yeah.
The floor is yours.
Hi,
Welcome.
everyone. Thank you. Hi, everyone. It's a pleasure, and I'm really humbled to be here. I'm sorry that I'm not able to share my video, but that's me in that picture because where I am, the network is quite shaky. But let's hope that we'll make it to the end of the presentation successfully. So I'm sharing my screen. So Hezron, can just tell me when it's visible?
Yes, you can see. You can just make it full screen.
Okay. Yeah. So is it visible?
Great.
Okay.
Yes,
So thank you so much. Yeah. So I'll start us off. Thanks so much for the invite. So today I'll present about the work that we do. I don't do it alone. We have a young, very focused team. Made up of students. Some of them have already finished school, early career professionals, and most of our work is channeled towards antimicrobial resistance. I'm sure I attended the other sessions And I'm sure you heard somewhere where antimicrobial resistance was mentioned. So I'll just try and introduce, I usually introduce antimicrobial resistance with stories because most people find it as a technical concept. But basically, it's a phenomenon where, sometimes some of the drugs that we take aren't effective, especially the antibiotics, because some of these bacteria have kind of adjusted themselves a bit and the medicines are no longer working. So it's something that has been on the rise. I'm sure maybe most of you have heard about it. And that's what we basically try to do. So I'll start off with just trying to share a bit about, just try to correlate antimicrobial resistance to planetary health. And I'll start with trying to correlate it with climate change. I attended the session that was previous before this. And one of the things that we was shared during that session was about, a lot of on climate change and, food systems. So I'll just try to give us a small link between antimicrobial resistance and climate change. So one of the things that you find is that at the moment we have changing ecosystems. And this is really driving things like floods, droughts, and other disasters. And what happens is that microbes and some of the vectors adapt, and this also gives rise to new vector-borne diseases, which leads to some increase in the selective pressure, and which can also lead to a higher resistance among the bacteria, or some of the bacteria mutate, that's promoting AMR. You also have the rising temperatures and also the increasing population in the world, especially in our urban informal settlements. So this is really driving a lot of resistance. So there are so many linkers. I've placed some links there where I tried to show some of this information, but they have more in detailed information linking antimicrobial resistance to climate change. The next is just a bit about antimicrobial resistance at food systems, so the food chain. So one of the things that we do at organization, I'll talk about it more as we go on, we have different programs. And one of the tendencies that has been ongoing is we have had a lot of intensification of animal and food crop production. And this, I think, can just be informed by the rising demand for food. And this really strains our food systems. And you find that many farmers or some farmers promote, using antimicrobials or antibiotics, especially antibiotics, as growth promoters, and also using them as cheaper alternatives instead of maybe having good biosecurity measures. They have antibiotics. They just give their animals antibiotics just to prevent them from being sick. And this has really exacerbated the rise of AMR. And one of the things that we did this year, we organized a competition, and it was called Food Without Harm, Reducing the Need for Antimicrobials. It was a joint initiative with our partner React Africa and also FAO and World Animal Protection. And we were trying to challenge students to come up with interventions and how we can, leverage on market signals, either on the demand side or on the supply side, to try and adjust the behavioral practices. And we had very interesting submissions from the students. We'll be having a webinar that will be on the 17th of September. I think I'll share the link with Hezron and team. So whoever is interested can join in. And here we'll really talk more on how the food chain is correlated to the increase in resistance, and some of the solutions that were proffered by the students, and which we can also try and embrace in our particular settings. So that was just setting a base and trying to show how antimicrobial resistance is related really with planetary health, and how all this is interlinked also in the One Health aspect. So I won't focus most of my presentation on this. I'll share more about our work in the work that we have been doing and who we are. So thank you so much. So as Student Against Superbugs Africa is a catalytic organization, and our work is mostly oriented towards building a movement of empowered students and young people who can really advocate and engage actively in the fight against AMR in their respective niches. So we empower young people, especially tertiary level students, secondary students, and as you can see, we also engage with some primary school students. And we do this by focusing on the strength areas and the particular niches where people want really to engage, or their career prospects or their own interest. So we are located in Kenya, but our team is multidisciplinary. We have some of our core team members hailing from other countries in Africa. So our programs, they target different countries within the African continent, and most of our work is anchored in a One Health approach. So that's basically about us. So I'll just look a bit about our approach in creating change, or our theory of change. So as just said, we focus mainly on empowering young people, and I'll show us how we do that. And most of our work in our organization is programmatic. We have different programs which are all catalytic. And we are really focused on trying to, trigger the interest in AMR, equip them with appropriate skills, and also encourage them to try and pursue further studies, either in their own interest areas, or if they become interested maybe in pursuing something on AMR. But the end goal is just to try and advocate for AMR in their respective careers, niches, and interests. So as I've said, we really focus on building on young people's strength areas, and we encourage a lot transdisciplinary engagement. Even our core team, we have people from different cadres. We are not all within the same professional line. And our end goal is building a movement of young people within the African continent who are keen on advocating for antimicrobial resistance. We've started already seeing some success, as I'll share as we continue. So we have different programs, and I'll start with one of our programs. It is called the AMR Leadership Program for tertiary level students in Africa. This is a collaborative program with REACT Africa, and REACT is a global organization that mainly focuses on advocating for antimicrobial resistance at the high level. So the African region, we have the REACT Africa, and this program, we piloted it last year in 2021. So it has a wide representation, and we were trying to bring students together from different countries. And before this, we had been having spot-on webinars, and before that, before the COVID-19 pandemic, we had been having campaigns in the different universities, especially in Kenya. But then we realized that one session doesn't really impact someone. You need to, pull a group of students, engage with them for a prolonged period. They understand the concept, they appreciate it, and they own it, so that they can go ahead and maybe also inform other people. So it was more of a TOT aspect, a training for trainers, and it was a very successful program. We have also started other smaller programs within this bigger program. For example, we had a research training for the students, and this was just trying to also improve their capacity in doing research, either in health-related or in other aspects of antimicrobial resistance. And we are also going to launch a mentorship program. I think the information is out there, and we have a website, and you can find more information there. So in the mentorship program, we're just trying to link up the students with professionals who are aligned in their interest areas, so that we have that engagement where they're able to grow with support from mentors. So the other program that we have is called the AMR Writers and Content Creators Program. This is a collaborative program with Center for Infectious Diseases and Microbial Stewardship Project based at University of Minnesota. And this is an ongoing program at the moment. We had phase 1, which we completed. And this program was just trying to really improve the capacity of the students in terms of research, in terms of article writing, and other aspects of knowledge development. So it was a 6-month, phase 1 was a 6-month program, which we completed on August. And one of the products, or one of the resources that came out, as you can see, we had so many articles, and we had a team of peer reviewers or mentors who would, the students would undergo the training, then they would engage in experiential learning. where they'll go ahead and write articles, write papers, which will then be reviewed by these mentors and peer reviewers, and in a way also improve their skills. The evaluation of the first phase is ongoing, and we are also having plans on starting a phase 2. All this just improving the capacity for those students who are really affiliated or would want to pursue research in their future careers. Then we have an annual conference. It happens every year. We had the first one last year, and it's also a collaborative program with React. And what we do here is we try to trigger creativity and innovative interventions, where we just have a call. We tell students to, come up with ideas, or come to the conference and present what they have already done, or come up with ideas. So during the conference, they then come, they present their own ideas or present the work that they have done. It's usually competitive, where the best projects are usually awarded. So this year we'll be having it. Last year we had it in Kenya, the pilot, and this year we'll have the competition in Uganda. Yeah, so during these sessions, we have been able to realize that there's a lot of immense potential. There's a lot of creativity that is untapped among the young people. And we're trying to see how we can upskill this so that it's a regional conference, whereby we have a conference every year, maybe around West Africa, another one around South Africa, another one in the North and in East Africa. That at least we're able to give students a platform. Another improvement that we made this year, it's not just about the presenting the program, the project that you've come up with, that creativity. We are going an extra step and offering them mentorship, and also trying to link them up with organizations who can offer them support to refine their projects, and also start off in implementation in terms of maybe giving them some technical support or seed funding where necessary. So that's what we'll be doing. It will be around November this year, and we will host it in Uganda. So we also have another program, and this is the Drug Research and Discovery Program. So you realize that when we say about antimicrobial resistance, we mean that antibiotics, most of the antibiotics are no longer effective. And one of the key areas that we need to focus on is drug research and discovery, and not just of antibiotics, but also of other therapeutic alternatives that we can use in place of antibiotics. We need new interventions such as phage therapy, among others, and also improved research and development of bacterial vaccines that can then prevent people from, that raising a higher rate of infections. So one of the programs that we started was this drug research and discovery. This was a pilot program, and it was mainly aimed at just triggering the interest of these students to pursue further education and careers affiliated to drug research and discovery. And we came up with this because we realized that there's really less, research ongoing, and also drug research and development ongoing in the African continent. I think we can relate this with the COVID-19 pandemic, the issue of vaccines, So it's good that we also have young people who then are interested and they pursue these careers, and then they are able to, come back to the society and, improve that expertise within the African continent. And such people can then be able to push for policy so that at least the government also appreciates the need for such, such interventions within our African continent. So we completed the pilot phase. We also have an upcoming workshop still at the end of this month. And we have been working on a strategy so that we have a more extensive program that can incorporate more students, and we're able to work with them and empower them more. So another program that we'll be launching soon, this one is the MR Ambassadors program. So it's a new program, and it's trying to build up on some of the other programs. And the reason we started this program is because we realized that most of the people whom we've been engaging in antimicrobial resistance, the ones who are really attracted to the programs are just healthcare students, maybe healthcare students and veterinary students. But we appreciate the need for multidisciplinary involvement. So This program was really focusing on students outside the health sciences stream, trying to see how we can bring them on board and how they can also contribute to mitigation of AMR. And this really tries to look at it from one health aspect and also from a planetary health, because AMR is a cross-cutting issue and you need all players on board. So the program, we finished it's a FENS program, so people are applying for it. And we had a very remarkable number of applications of around 16 countries in Africa, close to 1,000 applications. So we are currently reviewing and we'll be launching the program soon. So the essence is to try and also help us generate evidence on how we can promote multidisciplinary engagement of the students, particularly at their grassroots intervention, that at least these students are well motivated. They can then go out there and replicate or come up with similar programs, either in their universities. So also July this year, we also launched a simple AMR game, and this game was targeting mainly secondary school students and also tertiary level students, those ones who haven't really heard about AMR. And the reason why we came up with this game is because we're trying to break the bubble. And here I mean that things like antimicrobial resistance and other technical concepts of health, you find that you normally engage the same people over and over again. When you maybe organize a session, it's the same people who come. If you have a workshop, maybe a physical workshop, the same people. And so you realize there's a lot of effort, but it's not really reaching out to more people. So the game is a creative intervention that we came up with, and it also incorporates the art of storytelling. It's in our website, so you can go and look it up. And we are trying to also develop a campaign strategy where we hope to distribute the game, because you realize that when you just have interventions but they are not cascaded down, it's very hard for you to have any impactful change. Thereafter, we hope to commence on a study in Uganda to evaluate the effectiveness of the game among the target population, and then refine its design further, and also seek for other stakeholders. You're also trying to engage with some groups in Nepal and see how we can replicate this game or also adjust it a bit so that it is also applicable to the secondary school students and also the tertiary level students there. So we also had released a documentary. It's available on YouTube. And this was a collaborative project with Planet Wizard Africa. It's a company that is headed by Hezron, our moderator today. And we were trying to, push that narrative of AMR out there and try to see whether it was also a pilot and try to see whether we can also use documentaries to build movements. A documentary is really a good tool for movement building, whereby you're able to, it's able to have that mass audience and able to, stimulate people to start thinking of these existing problems. So it was a good pilot, and soon we hope that we'll be able to, based from the lessons that we had, we'll be able to come up with more innovative ways and also engage further and see how we can come up with a better documentary that can really push that AMR to, try to have AMR really easily accessed and really people take up the information on AMR, especially those people who are not within the healthcare constant. And this will also help a lot in terms of movement building and making people become then conscious of the challenge that is existing. We also have some videos, and this was an educative video series. They know something about antimicrobial resistance, and we're just trying to share key concepts about AMR in simple and comprehensible ways, and targeting people, young people especially, who are not within the healthcare aspect, trying to use very simplified and language so that at least they're able to understand and appreciate. So we also engage in the communities quite often, And most of our work is focused on trying to educate them about antimicrobial resistance, what it is, and why should they be concerned, and also antimicrobial usage, trying to tell them you should finish your doses, you should not share drugs, all that. And a critical aspect too is the wash, trying to also educate them about hygiene, so that at least the disease burden also goes a bit low. And as we do so, we also try to identify some of these existing challenges, especially in urban informal settlements, and see how we can, come up with frameworks that promote sustainable change, especially in the urban informal settlements, and pull in key stakeholders who can then maybe develop these interventions, such as governments and maybe other organizations. Because, for example, in the urban informal settlement, it's very hard to educate them about, antimicrobial resistance or, antimicrobial usage, because we have these systemic challenges that first need to be addressed right from the core, so that at least some of these things can then become a reality. And we're also finalizing on a pilot program that will focus on rural areas of Kenya. It will be a pilot program where we are also trying to generate evidence and also do some research on how we can engage rural communities in AMR and antimicrobial usage. And this will give us resources that can help us scale up our work and also develop toolkits that can be used in other parts of the country and neighboring regions. So we engage also in WOW is World Antimicrobial Awareness Week. It happens yearly from 18th to 24th of November. We'll also have it this year. And I think the theme for this year is how we can all, engage against AMR together. So we try and also engage print media, especially the gazettes. This is one of the articles that we collaborated in. It is in a national newspaper in Kenya, and it was using very comprehensible and information that people could read about in the newspapers and get to learn more about, antimicrobial resistance, what are the drivers, and how they can maybe act. Then we also support the national government of Kenya. We, in the planning of the World Antimicrobial Awareness Week, that's one of our colleagues presenting during one of the conference days in the WOW Kenya. We also have some competitions that usually go on. This is one of the competitions that happened in 2020. And these competitions are aimed at increasing or catalyzing student engagement during the WOW week and trying to stimulate them also into coming up with ideas and solutions that can also be used to, address AMR, because young people are very creative and they have a lot that they can share. And this is also the use of art and also one of the walks in Nairobi. Yeah, so we have had some early successes. And one of the early successes that we've realized is that we have this emerging movement of empowered young leaders who are championing for AMR in their respective settings. And I'll just share a few examples. That's a group in Zambia, this during the Riyadh conference. They were the second runners-up in the food chain competition, and they really came up with a very innovative approach. And surprisingly, the surprising thing is that these students, there are two students, that's Chikwe and Ignatius, and those were some of the key coordinators for the competition. They are medical students, but I think they really came up with a very good model. And this is in the food aspect of it. And I think this was possible because at least they also appreciate the need for One Health approach. And it's a good indicator because it shows that, we have these upcoming healthcare professionals who appreciate the importance of planetary health and approaching things from a One Health approach. Then we have this from one of our students who we engaged with in 2020 in Tanzania, and they've been able to do a lot of work in Tanzania. and also use a lot of creativity where they've been able to use football matches in terms of, creating awareness on AMR among young people. Then we have one of our students who was featured in the university. They won a global competition, and they have also been able to catalyze a lot of work within the university. This is a podcast that was where we had, it is run by one of the students that we engaged with. She has now graduated. And the good thing is that in this podcast that focused on AMR, she was trying to also show how we can, some of the interventions that we can come up with, we as young people. And she's from Uganda, and she was engaging with a young lady to a veterinarian from Nigeria. And it's one of the outcomes that we realize for the AMR Leaders Program, where we are able to bring different, students and recent graduates together from different countries within Africa. And together we have seen that they've been able to really collaborate a lot. And the COVID-19 pandemic had some many challenges, as you've seen, but I think one of the things that we can appreciate is really improved communication, especially virtual communications, and people are able to interlink and share the best practices in their different countries and how we can build up on each other. Then these are some of our students, part of our team in Zimbabwe. They also managed to attend a conference that was ongoing, that is last week. And last week and sometime early this week. And it was focusing especially on sexually transmitted diseases. And it's because of the work that they've been able to do. It's good to see that, such students are also being sponsored to attend such conferences and, receiving a lot in terms of even the sponsorship, travel accommodation and all that, in getting a platform to showcase the work that they've been doing in Zimbabwe. And we have a team from Kenya who are very vocal and also very active in terms of coming up with short videos that they use to engage the community and spread awareness on antimicrobial resistance. So the expected outcome of all these and our key objective is to build that sustainable multidisciplinary movement of empowered young people in Africa who can then passionately advocate for the AMR agenda in their different capacities. And we are very keen on this. There are different capacities, niches, and interests, because we appreciate that people have different interests. But if we're able to focus on interest and also try to advocate for AMR within our different strength areas, then we'll be able to create that sustainable movement. And I believe that we'll be coming up with this a big generation, this young generation of very focused young people, and it will be easier to deal with things like AMR, because when people will be occupying the policy-making positions, people who will be the leaders of different stakeholder groups, they will be understanding this threat, and they'll appreciate the need for more action. So we have some resources which I've shared there, and I would like to end with a small story, and I'm sure some of us have heard this story, and it was shared by the late Nobel Peace Laureate. She's called Wangari Maathai. She was an environmentalist from Kenya, and I think she was giving a speech somewhere, I don't remember, and she said, there was once, this forest kingdom, and fire broke out in the forest. And so all the animals started running away from the forest, starting with the big animals, the elephants, the buffaloes, they're all running for safety. And they all went to the other side and watched as the forest burned, as their home burnt. But then among them was a hummingbird. I don't know whether we know the size of a hummingbird. It's quite a small bird. So the hummingbird thought to itself, I think it's not right. And I think I need to do something to really solve this issue, because our home is going to be destroyed. And I might not be able to really put out the fire in the forest, but I'll try and do the small that I can. And at the end of the day, I'll appreciate that I did the best that I could. So there was a nearby river. So the hummingbird went, just took small drops of water from the river back to the forest, small drops, just trying to quench the fire. The action, at first, the other animals laughed and they were like, okay, what are you trying to do? And you can't really put out this fire. But the hummingbird was very consistent and, just trying to, put out the fires slowly. But I think along the way, the big animals thought to themselves, okay, I'm just here standing, I'm doing nothing. And we have this small hummingbird, which is trying to, just do the best that it can to quench this fire. And I think, they felt challenged. And one by one, they started joining the hummingbird. And I don't know how the story ends, but I believe with, this concerted action, they were able to put out the fire. And this story teaches us, especially young people. I believe that each one of us, if you identify your interest area might not be in antimicrobial resistance, but we have other areas and we have many world challenges that we need to deal with, especially in the earlier sessions where we were talking about planetary health, things like climate change. And those of us who are, I would really love all of us to come and help us in terms of antimicrobial resistance. And there's power in starting small. And if you're consistent, I think that's how change comes. So with that, I would love to thank the coordinators for giving me this chance to just present about our work. And I would also love to thank my colleagues in absentia, because I don't do this work alone. We have a very dedicated team that we work collaboratively with. And we also have advisors who guide us along the way. So thank you so much and have a wonderful time. Thanks so much.
All right, thank you so much, Dan. I think this has been a really inspiring session. The fact that at first you were able to also show the interconnection between AMR and climate change, which has really brought the understanding on the impact on planetary health. Then it's also inspiring to see that you've done so many initiatives to empower the youth with knowledge on AMR. And aside from that, I think it was really creative for you to also come up with a game to be able to reach a wider audience on AMR understanding. So we're now going to move into the question and answer session. And we have a couple of questions that have been asked. So I'm going to start with Winnie. Winnie, are you there?
Yes, Hezron, I can get you.
See. All right, thank you. So the first question is from Angie, who says she's really inspired by your story. And she asks, what's your plan in expanding your organization to an international level?
Amazing. Thank you so much for that question. Our plan of expanding Little Win Foundation as a social enterprise, remember we started in 2019 as any other formal organization, but now we are looking forward to integrating it to being a social enterprise and incorporating in integrated health rights related to SRH and HIV. In a way of disseminating knowledge unto the young girls and boys. We, of course, as I said in one of my challenges is, yes, we need a lot of resources to be able to implement most of our projects, but then we are not sleeping as well. We are looking out for more partnerships and collaborations, especially to the different organizations that do the same work that we do, and maybe other partners that may need probably to support, maybe to engage in, maybe to guide, advise. one way we can as well put our organization to an international level. And then also another thing, we are creating a space on where we shall have more multipliers. Right now I'm in Uganda, but I'm able to connect you people in Zanzibar, in Kenya, and so many of those. So if we have maybe ambassadors of Little Win Foundation, it can as well put us to a level of international, because if we have people that can represent Little Win in all those different spaces, then it can be amazing, and our work can definitely go international and global. Then as well, we are looking forward to doing this is an initiative that we are going to start very soon, creating a network of people, and maybe creating podcasts with information related to our work, especially in SRH and HIV, so that the youth or people of different category and of different levels can be able to access our podcasts, consume our content, give feedback, and then we can grow together. One last thing we are trying to implement is putting strategies and plans that are going to help us reach out to, investors, reach out to people that can be able to support, and reach out to definitely the right people that may get interested to supporting our work as well. So those are the few ways on how we are working forward to making Little Win Foundation to be international.
All right, thank you so much for responding. This is going to be a question for both of you. So it also comes from Angie. She was asking, as you were sharing your experience, you talked about challenges you met. How did you overcome them? So maybe you could just mention one or two. Winnie, then we have Daniel.
Awesome. So as I shared, Little Win Foundation has always had a lot of projects that it wanted to implement. But sometimes you find, you may not have all the resources you need, all the equipment and every stuff that you need to be able to implement. But we are not seated. As I said, we are busy writing and calling upon people that may have a heart of support to community, because our work with is actually authentic and he's very genuine. We are doing something. So we are writing proposals, we are asking for grants, funding, and also partnerships. That is partly for the resources. I can talk about that for now.
All right, thank you so much. I think you've shed light on something over there. If someone is starting up something and they are trying to look for resources, they could probably do proposals to get grants. That's one way of overcoming resource challenges. So Daniel, maybe you could also share something on challenges you've experienced and how you were able to overcome them. Maybe you can give one or two.
Yeah, thank you, and thank you, Winnie, for the wonderful presentation. It was really inspiring. Yeah. So challenges, I think they're always there. Yeah. So I think we just need to, see how we can navigate these challenges, and I think just gradually. So I think one of our main challenges on our end is just, I think, the lack of trust, which we have had to earn for a very long period of time in terms of our capacity and in terms of our capability. I think that has been the main challenge on our side to deliver. But I think with time, people have appreciated our level of expertise in terms of delivering after seeing the outcomes. So I think this is one of the challenges that young people can mostly experience. And I think this then serves as a, then brings out many other challenges, such as maybe issues of funding and, other issues. But I think about funding, I think it's always good to search for funding. But I think it's also good to explore the aspect of partnerships and see how you can navigate when you don't have the funding. For example, partnering with organizations, or even having volunteers, or having people able to support you in the technical work. Yeah, and yeah, so I think they also focus on the funding. We can also focus on ways that we can navigate and have the activities done at the end of the day. Thank you.
Right, thank you so much, Dan. I think that's well said. I think another point we get there is let's try to work on partnerships. That will be able at least to share the resources with other people who already have the resources that are existing. And also the final thing there is working with volunteers. There are people who are passionate about different things, and in one way or another, they should be able to help you in whatever project you're doing. So the next question will be going to Daniel. And this comes from Adriana, who says that the initiatives on AMR are very interesting. So for the game, do you think it can also be used or adapted for elementary school students?
Thank you, Hez. So the game was a pilot, because most of our projects at the moment are pilot. We are just trying to, we are just engaging in implementation research, trying to put it out there, and it informs us of how we can then refine it or even transform it more. The current game is not really appropriate for the elementary school, I think because of the technicality maybe involved in terms of uptaking that information on AMR. But I think it's something that we're also looking at, especially in terms of the framework, because I think when we have the structures in place and we know is how we should maybe, because the main issue I think for us is about the distribution, getting that game right to those students in elementary schools. Because one of the challenges that I've realized, especially when people come up with toolkits and all these frameworks, is that most of them end up being housed in the websites. They don't really end up impacting or reaching out to the target audience as it was early intended. So it's something that we're looking at, but the current game is not really that appropriate because it's not really the technicalities involved or the level of language involved wouldn't really be appropriate for the elementary school uptake. But in terms of the structure and trying to trickle down, I think it's something that we hope to explore in the future when coming up with a simpler game that is appropriate to that target audience. Thank you.
All right, thank you so much. Another question for you is on what is unique about youth and how they engage with AMR, and what unique community impact have you seen the youth achieve? I believe some of these have been covered on your slides, but then you can maybe shed more light on what is unique about the youth and how they engage with MR.
Yeah, I think one thing we can start that the youth is the future, not now and the future. Let's start with now, because I believe the future is already here. Yeah, so there's the aspect of behavior change. I'll start with that. For people who have really been enshrined in systems, it's very hard to change their perceptions and change their behaviors. For a doctor who has been used to maybe prescribing drugs without maybe sensitivity test and all that, very hard maybe to transform them. But when you have these fresh graduates who maybe want medical students, it's very easy when you're able to catch them while young. And when they transition to professionals, I think in the back of their minds, they'll be remembering that maybe they engaged in a particular program and they learned about AMR. So even when they're making decisions, they'll be very sensitive and very careful. That's one aspect of it. And for us, we don't just focus, so we look at it from a whole entirety perspective in terms of transitioning from student to careers. This for the tertiary level students. How can they be impactful in their careers? If someone ends up maybe in policy, are they able to advocate for AMR at that particular setting? If they end up, in different organizations, are they able to show the interlinkages between maybe what they're involved in and AMR? That's one particular approach that we use. And so maybe to look at the awareness, I think one in Africa especially, because that's where most of our work are based. And I think even in other regions, the youth population is quite big. And if we're able to package this information in a way that it's receptive to the youth, it's very easy for them to then share this information maybe with their peers and also with their parents and even the older generations. And I think that's the beauty of it, because one, the number of the youth is quite big. The population is quite big, and also I think it's very easy to influence behavior change among young people compared to maybe other generations. Yeah, and so regarding the impact that we have seen, impact takes long. Our work hasn't, we haven't really been engaged for that long period to actually see the behavior change. But as shared in our early success, at least we are seeing a movement coming up, and we are seeing people really advocating for AMR. We are seeing passionate people about AMR. People call us and they're like, okay, this week I went to this particular school. I went maybe to this village, I organized this, just trying to raise about AMR. Maybe I'm trying to raise about AMR in maybe a marketplace within my area. How should I, just seeking counsel, how should I simplify the information? How should I, target it to their particular setting? All that. So we are seeing these upcoming, this movement. It's coming up gradually, and I believe will be somewhere. And young people are also very versatile and very creative, and they're able to come up with innovative ways and creative ways of doing things. Thank you. I hope I've addressed that.
All right. Yes. Thank you so much for that input. Seeing we are almost running out of time, so I'll just give the last one question to each one of you. And I'll start with Winnie. What is the advice you can give to young generation who have a cocktail of ideas on what to improve in community, but do not know where to start? So you can just make it short as possible so that you can also have a chance to give your closing remarks. That was a question from Angie. Thank you.
Thank you so much, Hezron, for that. Oh, awesome. What can you advise someone who is young that has a full of cocktail of ideas? I know for sure as young people, we are always crazy. Like you think you can do this, you can do the other, you can hit the other, but sometimes we end up actually doing nothing. But me, I believe one thing I would give someone that is out there that actually has a passion of impacting your community, it is always important to first get to know, who am I? Who is Viola really? What is her capabilities? What is she gifted in? What can she do? And above all, what can Viola offer to the world? Or maybe what can Viola be able to transform her skills to be able to teach the people around around where she is, probably in your community, maybe in your family, and so many of those things. So actually it comes from a level of having a laser focus on what you want to achieve. What is your goal of life? What are you purposed to? What do you want to do? What are your goals? And stick to them, commit to them, and get to success. Because for anything that we do, we have a story. For anything that we do, we are purposed to do it. We don't just do it for the sake of doing it. No. You are passionate about it, you are purposed to do it, and you do it anyway, because it gives you satisfaction, it gives you fulfillment, and it gives you a level of contentment. So I would tell a young girl, a young boy out there, or maybe a youth that is passionate about impacting their communities, to think about that as well. Back to you, Hezron.
All right, thank you so much for that. Final question to Dan, which comes from Juan, who says, one of the main concerns when it comes to AMR in Africa is the lack of rigid systems and control of antibiotic prescription and supply, where you find most antibiotics are treated like over-the-counter medication. How would you tackle this issue?
Thank you, Hes, for that. Maybe to address it very briefly, I think AMR is a very complex issue. And one is because it's something that is driven mostly by the health systems. As you've said, there's also the aspect of, poor health systems and the aspect of purchasing power, and where people maybe prefer to go to the antibiotic and not to the hospital because one, maybe they live on a daily income. So if they go and cure at the hospital, they won't maybe earn a meal for that day. So there's a lot involved there. But I think our main focus, as I've said, we are just trying to just empower these young people and not really construe them or train, tell people maybe this is the path that should follow. Just trying to empower people so that even as they go to the different careers, they are sensitive and they know really that AMR is a challenge. So, for example, if you have, and these are the people who will take up positions in the next years to come. These will be our next policymakers. So that if people have an understanding of an entirety of AMR, then they're able to address AMR from the core, because it will, for us to really curb AMR, I agree that we'll have to really work on our systems, especially in the African continent, and look at it from a broad lens on, because there are so many factors, economic, social, that really drive AMR, and see how we can come up with long-lasting interventions. Thank you.
All right, thank you so much, Daniel. We've come to the end of the session. Now I'd like to give 1 minute to each of you to give your closing remark before we move on to the next session. So kindly 1 minute. Let's start with Winnie. I think, okay, let's start with Daniel. I think probably Winnie has a problem with the connection. Daniel, could just give your closing remark, 1 minute,
yeah,
please.
Yeah. So, yeah, my closing remark, I think I'll just tell us, just be the hummingbird. I think for the story I've shared, in everything that you do, I think just need to be consistent and passionate about it. The rest just follows through. Yeah, so our story where we began as SCS, it's quite, yeah, so we began with, ideas and thoughts, and, at least we can see that we've made strides even with limited resources or even with limited capacity. But I think, and also appreciating the kind of growth that we have had over the years. But I believe it's because we have a dedicated team, people who are passionate and people who are willing to give all that it takes, just like the hummingbird, to ensure that we're able to address AMR and bring it to light. Yeah, so that's my parting shot. In everything that you do, be the hummingbird. You can just Google that story. It's a good one, and I think it drives us a lot as a team. Thank you.
All right, thank you so much, Daniel and Winnie. We've now come to the end of the session. I believe we've all been able to learn something out of it, and it's going to spark you to start a project or something that can positively impact your community and planetary health in your spaces. So we're now going to move on into the next session. I'd like to invite my colleague Shad. And thank you so much. I was your host. My name is Hezron Munyakin. Thank you so much.
Thank you, Hezron. Amazing session. Thank you so much for handing on the floor to me. I would like to give the audience like 2 to 3 minutes to like lubricate and maybe to refresh and go and drink something or have a snack. And we will get back to you in 2 minutes. Okay. I think now we have all our amazing panelists with us, and we can start. So I would like first to introduce myself. My name is Shahad Sharif. Welcome again, our dear attendees of the Youth Hub Virtual Conference. I am a medical doctor and a research fellow from Sudan, and I'm going to moderate this panel discussion on the future of planetary health education and research. This is a recorded session of the conference, and questions and answers on the Q&A will be answered at the end of the panel by our esteemed speakers. So don't hesitate to post your question and share your thoughts on the chat. I would like to start with a small introduction, saying incorporating planetary health education allows for the development of creative and responsible learners with an appreciation and understanding of climate change. It's important to encourage young people to view everyday decisions with planetary health in mind. This encourages them to develop an appreciation for cause and effect relationships and links associated with human behavior and planetary health. It's not an easy task to be educated about BH, as the concept is relatively new and research gaps need to be addressed. Planetary health research calls urgent attention to the human health cost of environmental degradation and invites deeper reflection on the relationship between human, environment, and animal health. So first, let me introduce our panel members. I would like to start by introducing Dr. Julian Fischer. He's an experienced policy advisor and researcher based in both Germany, Hanover, and Switzerland, Geneva. His work has a special focus on global health advocacy, health policy and system research, and health workforce education. He worked with various organizations, including those in international public health policy and advocacy, health management, and published many research papers in the field of health education. So welcome, Dr. Julian. It's a pleasure to have you with us. Next, we have Dr. Carlos A. Ferron-Dozman. He's an associate professor at the University of Maryland, Baltimore, and director del Centro Interamericano para la Salud Global in Costa Rica. I'm sorry if I'm butchering any pronunciation. He's associate director of the Planetary Health Alliance, Harvard University, adjunct faculty at Harvard University, Northwestern University, and visiting scholar at IS Global Barcelona. He is a doctor by profession and believes in development through community empowerment, social justice, education, and research. So welcome with us, Dr. Carlos. Thank you for joining us. And lastly, we have Dr. Don Eliseo Lucero Bresno de Cer. He's a medical doctor by profession too, and a global health scientist. He's currently a health financing expert of the Asian Development Bank. He's affiliated with the London School of Hygiene and Tropical Medicine and the University of the Philippines. He's the editor-in-chief of Public Health Challenges, Wiley, and is the deputy director, editor-in-chief, of Global Health Research and Policy, BMC. He's the founder of the Global Health Focus, GHF, a leading global health emerging leaders program. Welcome, Dr. Don. Thank you all for joining us, doctors, and let's start. I believe that we have you all on board. Okay, so my first question will go to Dr. Julian. Dr. Julian, just to ease us into this panel discussion on planetary health education and research, can you give us a rough definition of planetary health education? Is the concept in itself new, as most of us think, or is it only came to light more recently? You can answer.
Well, thank you very much. Thank you very much, and thank you very much for the invitation, and welcome everyone. I'd like to perhaps answer the second part of your question, because I think that's very important. Planetary health education has been around for thousands of years. Most cultures, most communities have had planetary health in their learning, both formal and informal, for centuries. So the idea of planetary health stretches back many thousands of years. And that's important because when we start talking about definitions, that's a written word and perhaps doesn't include other cultures that look at planetary health definitions in terms of theatre, in terms of the spoken word, in terms of song, in terms of other forms of communication. So I think that is very important when we're having the conversation today to really look, as the previous session was talking about antimicrobial resistance, about going into the community and understanding your community. And I suppose out of personal experience, I teach planetary health education in secondary schools as universities, and certain communities and in schools, the definition, if you like, of sustainable development or climate change or even planetary health can seem very abstract and a long way away from people's daily lives. So I think the idea of planetary health really, I suppose, connects people to their environments. And when you ask me about the definition of planetary health, I think it's very, very close to determinants. And if you look at the Lancet Commission, there is an acknowledgement that the definition of social determinants, the environments, the conditions that we live, we work in, we're born in, we grow in, and also all those political forces, I think, link in very well with the idea of planetary health. But I'm sure colleagues will come in and make comments on that. So thank you very much, and back to yourself.
Thank you, Dr. Julian, for this insight into the evolution of such maybe a big concept. My next question is to Dr. Carlos. One of the main focus areas, Dr. Carlos, of the Planetary Health Alliance organization you are affiliated with is the Planetary Health Education Framework as a tool to planetary health education. Can you tell us about this framework and its foundational domains? Why is it an important tool for planetary health education?
Thanks, Shad, for the invitation. And again, thanks for the question. I think Dr. Fisher was really spot on to say that this is not something that is new, that what we're trying to do is trying to gather very much all the knowledge and all the ways of knowing into kind of our modern challenges. And so I really appreciate that he started there. And I do want to say that the Planetary Health Education Framework that we published last year on behalf of the Planetary Health Alliance did include Indigenous scholars, and we did consult with people that hold and are part of these knowledge holders that contribute to our advancement of this emerging field. Obviously, as Dr. Julian was saying, with being informed by these old ways of knowing, or ancestral ways of knowing. So that is why actually at the center of the Planetary Health Education Framework, we placed the key domain that connects all other domains in planetary health education is the interconnection within nature. And by that we mean, and we want to challenge educators around the world and learners around the world to really look at their relationship with nature and see where they've become detached, see opportunities to reconnect with nature, and then from that reimagining of what a relationship with nature in harmony looks like, we build on the other domains. So the other domains focus on what classically has been understood as planetary health regarding how we understand how we're changing the environment and how that impacts health. That's the Anthropocene and health domain. Then we have the domain that relates to equity and social justice, which is a core component of what we do in planetary health and why we should learn about equity and social justice in framing it as planetary health. There is a component of the solutions that we want to seek and how we seek those solutions through movement buildings and system change. We are facing these grand challenges that require not just top-down solutions, but bottom-up solutions that require populations, societies to really transition into new forms of living, basically, and interacting with each other in nature. And then we have the component of what we call system thinking and complexity, which relates to how we analyze the challenges and how we think of through solutions in an interconnected way, using system thinking and complexity theory in order to thread all these elements together. We understand that a lot of what happens in education needs to be informed locally, right? And part of what is rarely paid attention to in the Planetary Health Education Framework is how there's two concentric circles in the outer part of the framework that really determine how we teach planetary health will be deeply informed by the local context. And I don't want people to forget that. As we're learning about planetary health, we need to contextualize it to our local environment. And that's kind of what those inner circles are pointing to. So I'll leave it at that for now, and then maybe we can speak a little bit more about what the framework or how we can use it and how it's being used.
Thank you so much for that. It was really insightful. My next question would be to Dr. Dawn. With such tools like the Planetary Health Framework, Planetary Health Education Framework, and others, what specific challenges do you think will face the developing education system in integrating planetary health education and research into their curriculums?
Thank you very much for that question. And of course, thank you very much for the invitation. I am speaking from Manila, Philippines. So I'm just around the Pacific Ocean, which is all the islands here, or all the countries around are affected by climate change. So it is something very important. Thus said, there is no question that it is important. The challenge is indeed, as your question stated, how to integrate it. It is not easy. I have been developing curricula for a number of countries, for Master of Public Health, for Global Health, and I've been teaching in many countries all over the world. And indeed, integrating the concept is challenging. You know why? From the practical perspective, because one, it competes with other priorities. For example, as you know, there has been trends that before we will include, for example, environmental concepts in the way we teach. And then we also introduced the concepts of gender. We have to introduce the concept of justice and equity. And these are all very important. So therefore, when we try to develop the curriculum so that it will be integrated into education, I'm not only talking about tertiary education, university level, even from an elementary to high school, it is very important that it has to be integrated. But the question is, how can it be? I mean, there are already models all over the world that it should be experiential model where the students would go to see the environment, for example, and all for the higher levels of education, it will be more research oriented. But the good news is it has started to be integrated in the curriculum, but it just needs to get to be fully accepted, especially in medical school, for example, especially in nursing school, because based on our experience, well, it's not a complaint, but it's where do we get the time to put that in? Should it just be a very small aspect of everything, or should it be something encompassing with many other aspects? Because as I said, it competes in terms of time within the curriculum. So it's more of a practical challenge. So there are many experts now working on that. But then again, luckily, based on research and based on the things that I see in the research scape of the world, it is now getting into the top. Thus, we probably have a better chances for it to be fully integrated within the curriculum of the educational system. Back to you.
Thank you so much. You give us a glimpse of hope that we are on the right way. Thank you. My next question is to Dr. Julian. Back to you, Doctor. What are the professional and personal benefits you think that the learners will get from receiving planetary health education?
Thank you again for the question. And Dolas made a very good point about systems thinking. And like my colleagues, I teach planetary health and social determinants in schools, also universities. So I do think that it's both professional and personal. And I think there are an enormous number of career opportunities in other sectors, taking what we know about planetary health and then going to work in transport or in education, so that you cross-pollinate. And it does open up an enormous number of career opportunities, because as Dr. Carlos was saying, as you start learning about planetary health, you inevitably look at multi-sectoral action. So you health in all policies, you look at the experiences, both in terms of your local community and how you're addressing social determinants of health issues in your community, which is absolutely fundamental. But then you can go into the policy arena and look at health in all policies, both in terms of taking health into other sectors and then bringing other work back into your own discussions in the health sector. And again, that really links to the social determinants of health. And as Dr. Don was saying, one of the big problems is that the curriculums are very crowded, but I do think because there's such a close tie-up between the social determinants and the professional, the planetary health, that is an entry point, and that if we can mainstream social determinants and planetary health in curriculum, I think it will enable lifelong learning pathways for health professionals, both on a personal point of view, that they can understand where their work fits into the bigger picture. And as I say, my experience and from people who've done the courses that I've delivered, they go on to work in other sectors. So it does broaden your professional perspective and has then the benefits that you're bringing health and planetary health issues that maybe other sectors like urban planning or education haven't thought about. So you get that cross-pollination of ideas and entry points of where different sectors can fit. So again, looking at policy coherence for sustainable development. So I'll hand back to you, my colleague.
Okay, thank you so much. That's a really interesting perspective and an approach to think about the benefits that we get from planetary health. My next question is back to Dr. Dawn. How do you think can early planetary health education and research evidence generated from this education and in the field of planetary health can reshape health systems that we know now and the health workforce in general?
It is very interesting. If planetary health is something new to someone, there are only a few things that will come into their mind. It's global warming. So when it's translated to research, so if you do a random, let's say, for example, you introduce the subject to a number of master or university students, the first thing that they will think of is there will be an increase in temperature. So therefore, the individuals will be affected when it comes to work, and then it will affect their mental health. It was like COVID. When I would ask all my research network, what would be something very interesting in your countries? The first thing that would come out, the agenda that would come out from them is always mental health. However, as you go deeper into the concept, into the theme, there are many nuances that it is very, very rich when it comes to learning. So for example, when it comes to, I always set up the research agenda of the journals that I manage. So I try to be more aggressive when I try to set the agenda, or else my problem as an editor-in-chief, I will be receiving the same papers and I will end up with very few papers because the way they will think is always a bit narrowed, simply because the understanding is a bit also narrow when it is not very deep. However, as a researcher, as an individual person gets deeper into the theme, there are many subjects which makes it very nuanced, that all of these will translate to health systems, which is really composed of so many different building blocks, and also which can be translated into the kind of thinking our workforce would have. For example, if we will translate it to workforce, we can dissect it into 3 levels, whether it's micro, meaning personal understanding of planetary health and the related concepts. Therefore, they will act upon themselves on what to do in the office, saving on the printer, for example, or on the electricity, or on printing things, and even greening the internet, for example, which websites, not putting on the browser because they will all be working and it will be bad for the environment. So that's at the personal level, in terms of as an individual person. Then anyway, at the meso level, you think of your city, of your community. So therefore, you know that there are microclimates in the city, so that you rearrange as part of your work how cities are arranged, for example, and also where would be the best to get the water. For example, there's one thing, I have to keep on reading many publications which are submitted to the journal. And you know that there's only 3% of the water on Earth which is drinkable. and that most of it is from glaciers. So now I'm trying to get all countries come up with publications that will talk about melting of the glaciers and how it affects the flooding and how it cascades to the different aspects of the individual person and the families living, for example, in Bangladesh or in the islands of the Pacific Ocean, and in the countries in the Pacific Ocean. So that's at the macro level. Then that's at the meso level. At the macro level, you look at policies. The government look at things from a bigger perspective. And that really translates now on how, for example, hospitals will be green. How do we do a greening of the internet, for example? These are the things that will not come up in the policies if people would not really have a good understanding of the concept. That's why it's imperative now that the concept should be integrated as early as possible. Even the concept of biodiversity should be now integrated into the curriculum of school children, because biodiversity is very, very important to the things happening within the world, and same as with the role of the indigenous peoples. And that will never come into our mind if the scientist or the researcher will not think very, very deep about it. And this will all translate to health systems, on how the health systems will address, especially if we add other factors such as aging. Because in many societies, the societies are now getting more elderly, and therefore they're the ones more affected by climate change. There was an increase, for example, in death when there is increase of temperatures in many countries. And so therefore the health system should adapt to such changes. And so the same with the workforce. That is why it is now important that we now introduce the concept of having introduce like doctors who are experts in planetary health. And I think it's being done here in the Philippines with some of the hospitals and universities. Back to you.
Thank you so much. That was really passionate. I like the passion behind what you were saying, and it's make us rethink the way that planetary health can change us as individual professionals and even systems and governments. So thank you so much. My next question is gonna go to Dr. Carlos. We came from most of the attendees and the members from the Youth Hub are coming from professional backgrounds. But do you think that planetary health concept is something to educate about only professionals and people from related fields, or it's something that should be even taught to children and the community members, and why is that?
Thanks for that question, and it has already been addressed by Dr. Julia and Dr. Don Eliseo about the importance of teaching planetary health throughout the different stages of life. If we want to really have a chance in changing how our societies are structured, how our economies are structured, how our relationship with nature is structured, we need to start earlier on. Of course, if we can only incorporate these concepts at the higher education, something is better than none. However, I would encourage, and there are networks right now within the Planetary Health Alliance that are looking at the questions of how do we incorporate planetary health education from earlier on. And as you know, as I think one of the colleagues here in the panel were saying, this is already being done in many parts of the world. I mean, I think of the importance of teaching children about kind of the importance of where our food comes from. That's very important. The children learn earlier on how we use our land, how we relate to the environment. Where does energy come from? Where does stuff comes from in general? What are the different components of our relationship with each other and with nature? I think teaching many of those things earlier on will help us then when these children grow up in the future, they'll be much more mindful about the reasons they do stuff, the reasons they eat certain foods, the reasons they behave in a certain way, the reason they consume in certain ways. People will have the critical ability to stop the status quo that has us in our current conundrums. So I would really like to see, and I'm going to an example of the government of Kyrgyzstan, of the Kyrgyz Republic in Central Asia, recently will be announcing an initiative at UNESCO at the World Health Assembly in September, later on this month, on incorporating planetary health as a core principle in the education system for all ages. So that is really exciting, and this is how things are moving forward. Of course, the Kyrgyz Republic, one might say, doesn't seem like the biggest actor in global diplomacy, but that is where kind of the collaborative component of planetary health needs to kick in, right? So I hope to see this formulation of this proposal from the Kyrgyz Republic move forward with strength at the United Nations level, and then we can trickle down to a global scale effort to teach global health, planetary health at all levels.
Thank you so much for sharing that, Dr. Carlos. I would just like to take a minute and to remind our attendees that you can post questions to our speakers on their answers that they have graciously provided us so far on the Q&A questions, and that they would allocate from their precious time to answer them at the end of the panel. So back to the panel. Dr. Julian, this is something maybe more personal toward me. While I was searching for preparation for this panel, I came across a concept called citizen science. I believe it's a new concept that involving community members in research. Do you think it can be a valuable tool for planetary health research?
Absolutely, and I think I congratulate you on putting that as a question, because I think it really links into both speakers, but particularly what Carlos was just saying. For instance, I work locally here, as I say, with primary and secondary schools, and through the UNESCO WHO health promoting schools, we've developed what we call Planetary Health Weather Station. So you've got the, if you like, the qualitative data in terms of the quantitative data in terms of the temperature, the water, so the children can measure, if you like, the weather, but then they can look at the gardens, the insect house, their environment, as Dr. Carlos was saying, and say, well, how does that mirror what I can see happening to my surroundings, happening to the planet? So again, looking at that idea of citizen science in schools, I think is absolutely critical. And one of the things that I can see that does is obviously the school is intimately connected with local communities, with parents, with businesses, and the schools are a fantastic hub, if you like, for planetary health transfer into the community. And the children are very good at actually, if you do it well, of taking what you've explained, and then they, in their own words, explaining to their parents, who are obviously part of the community, how we need to, what is planetary health, and how we need to understand it and work with it. So again, couldn't agree more with both speakers that the schools are critical, but also the schools and primary secondary education is also adult learning because of that connection between the schools and the community. So it's actually whole school, whole community learning for planetary health. And what I can see is the children are really well positioned and are fantastic drivers and catalyzers of change, because it's our future and we want the change. So again, I couldn't agree with both speakers more about this idea of using schools and the communities and basing that research and science in the communities and schools. And as that linkage between, if you like, data, what people can see is a very, very powerful narrative, because you relate the evidence to what people can see and feel and sense that's going on around them. So thank you very much for that question. So I think it's really critical in terms of what we're talking about today. Thank you.
Okay, thank you so much for this informative answer. My next question is going to go to Dr. Dawn. Let's shift a little bit from the education to the research in planetary health. Why do you think it's critical to start now researching planetary health? What gaps we will need to bridge?
Okay, that is a very good question. There is no question that it is very, very important, because one, we need the evidence so that they can be translated to policy and practice. Two, the concept is so nuanced that we still have to answer many questions. For example, hypothetical questions like what will happen to the islands if or the cities by the sea, near the sea, if the ice will melt, and will really they get drowned or something? Well, in fact, when the sea level goes higher, it actually affects the fresh water of the islands, because as the salty water goes into the land, it tries to mix with the fresh water, and it affects the drinking water of many islands and all the nearby all the land near the sea. So it is very important that we now have to ask all these questions. What will happen to the flooding, for example, if the ice if the old ice will start, if the glaciers will start melting, and it will just keep on rushing on to the different rivers of the lowlands of different countries. So these are happening now, and there are still many more questions that we really have to answer. That's why, as early as I like the concept on where do we get the food, because that is very important also, especially with the carbon footprint of food. Do we have to go back to having local food systems, for example? And just going back to the citizen science, I love the concept. Actually, it has been there for a very long time. I am a dive master. You know what we do? Whenever we dive, we just don't enjoy the sea underwater. We have a checklist of the different fishes that we see. And then we upload it on a database globally. And then you place it, you place the place where you went diving. And then data analytics would show the differences in the biodiversity of the fishes. And you know, some of the, not only fishes, but also the other organisms within the sea where you went diving. And then you can put it together with the data on changes in temperature of the different areas, and then you will see the correlations of the species changing. And also, when I go diving, we would see whether the corals are already gray, meaning there was warming in that water. And if you add all that up, the data, it is very powerful using citizen science. And that is only one of the many examples. So for example, you travel, you can contribute to the data that you keep on seeing. So there are still many things to answer. There are still many things to answer for the future. And the only way we can answer it is trying to do the different variables now, so that we can do modeling for the future, that we can prevent what's going to happen in the coming future. So no question, it is very important. We have to set the research agenda, and we have to have the right methods to be able to answer them. Back to you. And by the way, last thing, my journal, it is free for commentaries, especially for young people like you. So please submit your articles, and we will be happy to get them reviewed. My email is there on my name, and then I'll be very happy to collaborate with many of you from all over the world. We will publish at once your papers on Planetary Health. Thank you.
Thank you so much for offering an amazing opportunity like this. This is one of the reasons we have organized this conference in itself. It's to find opportunities for us as young people to engage with planetary health. So thank you so much, Dr. Don. My next question is to Dr. Julian. What structural and organizational adaptations, governments, education systems, health will need in order to introduce planetary health and maximize the benefits from its education?
Great, and thanks very much. I think many things have been said. I think Dr. Carlos, and I've just actually texted him, the political elements need to be there. So it's great that UNESCO, WHO are all starting to think about embedding planetary health in resolutions and strategies. So we need that sort of architecture. But also, I think it comes back to Dr. Don's note, saying that in actual fact, the education system, primary, secondary, tertiary education, are all looking at the same thing. They're all going to try and get planetary health into curriculum that are already, or curricula that are already very, very crowded. And I think there is a fantastic role, and such a crucial role for young health professionals to do that, to start pushing that out, not just in health workforce education, but in secondary and primary education, saying, you know what, as leaders of the new generation, we need to start looking at planetary health, as we've been saying, in a lifelong perspective, and we need to start early. So I think there's a role for young professionals to start helping teachers and schools and school children and Fridays for Future for actually pushing out the same thing that we're talking about in schools. And again, I think it comes back to Dr. Don's point. Do you try and have a single discipline for planetary health in schools and universities, or do you put planetary health across all the existing disciplines? And I suppose I take a fairly pragmatic approach, and also I think a conceptual approach, that it's better to have it embedded in everything rather than trying to push people apart and insert it. So I would say that the key is it lends itself to climate change, to flooding, to water, to physics, to chemistry, all the things that are, to mathematics, all the things that are there. And I think the push should be just to get it into everything rather than one particular subject, or make it one particular subject, which is what we're finding here politically in Germany. That's what the politicians, teachers, head teachers say, you know what, we can work with that because it's already there, and you're asking for a little ask in a number of different places rather than one huge ask that gives us a headache. So again, I would totally agree with Don that it's mainstreaming across everything rather than trying to sort of create one pillar. So again, very good question, and thank you very much.
Oh no, thank you so much for this. It's just promote us to rethink about planetary health as a culture, a way of living, rather than like a whole new thing that we'll talk about and forget. So it's nice to touch on that. Thank you so much. My next question is to Dr. Carlos. Let's give these people hope. Can you give us some example of successful planetary health education stories? What factors made this success, and how can we adapt such experiences into our local context?
Thanks for that question as well. So when I think of successful experiences, I think most of them are still on the making, and in the sense that a lot of these efforts need to be iterative, and we're learning along as we go, and that is something important, that we are able to recognize that we're learning and we're taking different pathways, and that change is coming in different means. So some change is coming through bottom-up approaches, which is very exciting. You have groups of students that are asking for change, that are creating the different analysis or the first kind of diagnostics of why in their university, in their college, in their higher education institution, where the gaps are and where the opportunities are. And I think of an effort called the Planetary Health Report Card, that if you just Google Planetary Health Report Card, this amazing group of students are going throughout the different universities that they're working on globally and trying to create basically a report card on why their university needs to be better in educating planetary health. And then they can use that tool to advocate for change. That is bottom-up change, which is very, very exciting. And that is happening in many universities across the world. And it's recently been translated to other languages as well. I think Japanese and German are the most recent languages where this tool has been modified. I also think of some of the efforts that are coming top-down, right, in which there is the leadership of an organization that is, let's say, certifies certain professional bodies, which means that that certification means what are the components that, let's say, a professional in medicine, a doctor in medicine has to have. They draw lists of competencies, right, of different things that the person when graduating needs to know, and that informs how all the universities in a given territory will teach planetary health, right? That's kind of the top-down approach where we're changing the structure of education. And that is happening in places like Germany, places like the Netherlands, places like Ireland are changing the structures of their curriculum by changing the structures of what it means to be a health professional of X, Y, Z profession, especially medicine, nursing are the ones that are taking the lead here. There are other exciting efforts that are coming along through. We have our partners in Brazil who are doing amazing efforts in taking groups of thousands of health professionals, primary healthcare workers and nurses, auxiliary nurses, family doctors through an organization called WONCA, and they are providing planetary health education for them in a massive online course format that is easy to access, and that the same massive online format is part of a collaboration between state institutions, private institutions, civil society institutions, and philanthropies and academia. So those are very exciting things that are happening that are reaching thousands of people as we speak. And I would say that the key to making these things successful, when I look back and I say, what is it that makes these things successful? I think one, the passion that the people that are leading it are bringing into it, but also their desire to collaborate. I think collaboration is completely fundamental if we want to enact change at the rate that we should be enacting change. We can't go at these battles alone. I think any youth member here listening, we need to think of these things about the strengths of networks, the strengths of multi-sectorial action, and bringing more people on this boat. So I'll stop there, and I really appreciate the question.
Thank you so much. It's inspiring to think about it like that, because the planetary health concept itself is interlinked and multi-sectorial. So we need to collaborate in order to reach its goals. So it makes sense. Thank you so much. My next question is to Dr. Dawn. Dr. Dawn, how does the future of planetary health education and research look in your opinion? Is there a global commitment toward it?
Okay. Just like what Dr. Carlos mentioned, it is quite positive because the awareness is very high globally. So wherever I go, whenever I do my Global Health Emerging Leaders program, whether in Africa or in Asia, everyone has already have a good grasp of planetary health, climate change, global warming. I think it's because of the information dissemination. That's a good indicator. Two, based on the readings that I do for the journal and also for my teaching and research, there are lots of production of publications, scientific papers, and of course the IPCC report. So they all contribute to the knowledge. And there is also a big clamor now because the concept is now embedded, especially among the young, that it will be mainstreamed in secondary education. So it will come. Probably research will be the fastest. The indicators are, there are now so many journals on planetary health and climate change and One Health. They're all interrelated. Just by that indicator, which means there's a very big market for the researches that are being produced by many different research institutions and scientists. So that's why, okay, let's call it a business. The journal is a business indeed. But that means that there is a big market for that because there's a high production. And so that will be translated to more agenda, more funding for research, because there are many big questions. You know, there's one simple question that we don't want to answer. Do we really have to control the population of the world to address climate change and planetary health? Before, we would keep on answering that. That was the main agenda and action of the world. But now no one is discussing that. So that is one thing that I really want to keep on pushing. There is one big challenge though, even if we will change the curriculum a bit slowly, even if we do a lot of research, it's the translation of global policies. Until now, the governments of the world are still struggling to come up with a major global decisions, who's going to pay and how much will be cut, and who's going to now introduce cutting of carbon fuels, so on and so forth. That is where the challenge is. But they are all interrelated. We keep on doing research. That's a good front for the fight. We keep on changing the curriculum. That will be an additional front, because at the end of the day, we have to keep on pushing global policy. And that is where the big dilemma is, because until now, our elders, the global leaders, I think they're the first ones who should be educated about planetary health and climate change. Back to you.
Thank you so much for these strong messages, Dr. Dawn. This will take me to my last question before the remarks and the question. To Dr. Carlos, what do you think is the role of young health workforce and activists in the field of climate change and health in promoting planetary health education and research?
That's a great question. I mean, one of the I think key benefits about the health workforce is that you can find it any part of the world. And I think as trusted messengers around the world, as trusted neighbors, as trusted professionals, as trusted community health workers, you name them, they have a special place in people's understanding of their environment, of people's understanding of their own health. And so I think if we manage to set up a way that these trusted professionals and networks of people are, so to speak, spreading the word of planetary health without wanting to sound too, let's say, hopeful or naive is a word I'm looking for. I think that there is that special role that we can tap into. I see that in my own country, in Costa Rica, where I'm calling in from right now, in which we have a strong base of, let's say, community health workers that when the need comes, they start educating the people, knocking on everyone's doors and becoming these trusted professionals in every community around Costa Rica. And they are part of the community, they're embedded in the community, they're trusted members of the community, which I think when you want to transmit a message, the best way, the best possible place it can come from is from a trusted member of your own community. And that is the importance of these networks of health workers around the world, the trust that they carry and their capacity to enact change. So I encourage everyone here listening right now live or later to really engage in the planetary health agenda and ask themselves, how can I make a difference in my own sphere of influence? And I think that's an important question we should all be answering.
Okay, thank you so much with this parting words. So thank you. This concludes my panel questions, but now we will take questions from the floor. I hope you're ready, guys. So this question is to Dr. Dawn. How can national governments view and prioritize health workforce concerns such as welfare, rights, human rights, equity, and development as urgent public health concerns? So yeah, and they say to you like good work or something, I'm not sure.
Sorry, I didn't get the first part of the question.
The first part of the question is, how can national governments through planetary health view and prioritize health workforce concerns such as welfare, rights, human rights, equity, development as urgent public health concerns?
Okay, so it says, how can national governments view and prioritize health workforce concerns such as welfare? That is a very good question because I actually teach at London School of Hygiene and Tropical Medicine migration of health workers for the Global Health Policy Masters. And it is a very big problem in many countries of the world. For one, let's just talk about what happened to COVID. There was what you call the great resignation. We have the number of health workers globally went down simply because they were not well respected. They were not provided all the needed welfare that they should be getting. So governments should keep on providing all the rights that they deserve. And that's already embedded in many ILO conventions, in many UN treaties, even in national, in constitutions of the different countries. That should be a priority all the time, because without a healthy population, there will be no good development within the country. So that is not negotiable. And even if it's already blatantly happening that we're losing many nurses, we're losing many doctors, they're not getting their best benefits. Still, many governments are not working on them. So therefore, you know, prices would go up, but because of health technology, you know, the best element that they will change, the easiest, I mean, is always the salaries. So salaries will go down because other expenses are going up. So I don't think that's the way we should look at health workers. They should be central in everything that the government is doing because they are needed by the people. Thank you.
Thank you so much for that. I really appreciate the answer. My next question is to Dr. Fisher from Catherine from Australia. Catherine's question is, just a minute, I'm sorry. So here's the question. Based on your remarks on connecting evidence with what people see, how do we go about disseminating these connections and highlight them to the public to mobilize action across communities?
I think it's a good question. And I think the key to me are using, as Dr. Carlos was saying, a health facility or a school as a place that you can work from. And I know sure as a health worker, have connection to both those very important hubs within communities. And so I think with the knowledge that you can bring, for instance, here in Germany, one of the things I'm doing is bringing the 17 Sustainable Development Goals into schools. The children then, if you like, deconstruct those and then reconstruct them in a way that make most sense to them. And I would agree with Dr. Don and Dr. Carlos, the children tend to then give you planetary health back again, because that's what they can see, that's what they live. And if you go back to the community with that and engage the community through the understanding of the children, the community actually also resonate with planetary health. So I think depending on your context, I think working either through a health center, so a pharmacy or a medical practice or a primary health center, or particularly a school, getting people to understand health, planetary health in their own context, and then, if you like, generating a project or generating an initiative, what you'll find is it's a very useful and easy way of then people, as we've just been saying, it's so connected to people's lives. And certainly the NGO that I run is actually connecting schools in different countries. So for instance, we've got schools in Bhutan, in Malawi, in Germany, in Brazil. And one of the things that we're doing is, yes, planetary health education, but it also lends itself to global citizenship education, which is again something that UNESCO has done a lot of work on. And it's getting that empathy, that understanding of planetary health in different communities. And we often talk about planetary health in a very sort of stable situation, but we've now got to look at planetary health in terms of Pakistan, huge amounts of flooding, humanitarian crisis, in conflict. What does that mean for planetary health? So I would again reinforce this, I think what Dr. Carlos was saying, health workforce, health workers, health professionals have got a real key role to do this, because you're going to be there regardless of whether it's a stable situation or whether it's an emergency or a rapidly emerging crisis. So I think there is an absolute critical role for education. I think these crises are going to come towards us far more quickly. And the more we can work with communities, the better connections and the better relationships we have to then, if you like, bring those solutions forward. Thank you.
Thank you so much. Thank you. Thank you so much for this more than satisfactory answer. My question from the floor, from Juan from Sudan to Dr. Carlos. The most common argument to planetary health initiative that may be obstacle or become a hinder to planetary health initiative, as they mean in the lower and middle income countries, is that we have more urgent public health issues. How would you argue this point with them?
I think the main point there is to emphasize how things are connected, right? We can't look at things in silos. Let's say malaria might be an urgent thing, in countries like Sudan. However, malaria is connected to our natural environment, the different changes in our natural environment. That is the amount of water, the amount of drought, the amount of humidity, the climate change, among many other landscape deforestation. All those things are closely connected to diseases like malaria. So it is true. I don't want to advocate for diminishing priorities in countries where certain preventable diseases are still very much burdening these nations. I do think we need to start asking questions around yes and not either or. And yes and implies connectivity. It implies understanding how different things can work simultaneously. And in climate action, let's say specifically in climate action, that is called the co-benefit approach, in which we look at action in let's say in the environmental realm, and then we see what other benefits it can have on as a knockoff, right? But a co-benefit framework can work for everything from biodiversity to deforestation to pollution to many other things. So as we are drawing these agendas politically and we're thinking of our most pressing health challenges, most people now, or the evidence is emerging on how these things are interconnected. So I would argue that politicians and decision makers need to understand this, and they also need to get away from the short-termism that is part of the kind of the poorly designed political systems that most of us live in which short-termism is favored versus long-term action. So that's not just only the fault of obviously lower middle-income countries. That is the fault of how, let's say, the development or the development, the global development architecture is set up in a way that short-term goals are favored. So we must also ask for change in global agencies or bilateral agencies like USAID, DFID, or GIZ, among many others. We must ask them to start thinking about how they restructure their funding opportunities in order to think more long-term. And when we think of the environment, we're not only thinking long-term, we're also thinking short-term, and it provides these co-benefits or other additional benefits to our current very burdensome health challenges. So I hope that is a gateway into some of the answers, but I really appreciate the question, and it is a challenge. It's not easy to deal with.
Okay, thank you all for the questions you shared, and sorry for the time wasn't enough to go through more. We may try to share further questions with our speakers through emails and get you some answers. I would have liked to give you my esteemed speakers maybe 1 or 2 minutes to give us like closing messages, but I'm closing on time, so I apologize. To summarize to the best of my ability, I believe that early education about planetary health can drive decisions and change behaviors to maximize efforts and actions against climate change. Although the world is increasingly recognizing planetary health, gaps are still here and need to be bridged by education and research. And yes, are both targets and actors in planetary health education and research. Thank you all for being with us today. We are grateful to the speakers who joined us today. Thank you, Dr. Julian, Dr. Carlos, and Dr. Dawn for the from my side and from the conference, OC, from the Youth Hub community, and also from the panel attendee. Goodbye, everyone, and have a great rest of the conference. We almost come to the end. Thank you.
Thank you very much.
Goodbye, everyone.
Hi, everyone. Thank you so much, Shad. That was a very interesting session that we had, and thank you for the speakers who were able to join us. So I'd like to welcome everyone now to the closing session, and we'll be having a speech from one of our heads at the Global Health Workforce Network, Youth Hub, and that is Kalin. Kalin, if you can hear me.
Yes, I can. Thank you.
All right. The floor is yours.
Hello. Thank you very much for giving me the floor and the closing session of this absolutely wonderful conference. I certainly wish I was able to to join you for more, but unfortunately, as I'm sure many of you understand, the clinical duties prevented and the time difference prevented me from doing that. My name is Khalil Matar, and I'm an infectious disease physician originally from Lebanon and currently working in the United States. For the last couple of years, I have chaired the steering committee of the GHWN Youth Hub, and it's been certainly a big pride for me to see the successes that the conference teams have put up through the last couple of years, but specifically this year with an absolutely wonderful agenda and a topic that's on everybody's mind, I think. So we all still are feeling in the health and care workforce the effects of the COVID pandemic on our daily lives, on our studies, on our work, on our families, and what more timely than thinking about planetary health, thinking with the inclusion of One Health, of course, and how really the health of humans is interconnected with everything around us. The speaker lineup was phenomenal. We've heard throughout the last 2 days from Dr. Tedros, from Dr. Maria Nera, from Dr. Abu Agla from the GHWN and the WHO Health Workforce Department, and many, many great speakers. And I certainly hope that all of you who were in attendance have come to appreciate the interconnectivity and how we as current and future leaders in the health profession and in the health and care sector have a duty to keep in mind that the health of the planet is absolutely essential to the health of our communities and the health of our patients. I hope that this conference was beneficial for everyone around. And I do want to put a few plugs for a few things that you heard about from the Youth Hub, but that are going to be happening and for you to look forward to. So the advocacy toolkit launch, which is going to happen, we don't have a date yet, over the next few months, we certainly hope. And that's a tool that's going to help you, we hope, advocate for better working conditions, better study conditions, and just a better future for you and for the people coming after you in the health workforce. That's going to help us think about how do we get more people interested in the health and care sector. How do we contribute to educating more health workers, and how do we get to retain health workers to be able to achieve the $3 billion goal that has been set up by WHO and by various global health actors. I don't want to keep you for too long. You've been probably in front of your computers for almost 2 days now, but I do want to remind you that we as current leaders in the health and care sector, we are absolutely essential to every discussion that occurs when it comes to public health, when it comes to global health, and when it comes to decision making, both at the local, national, and global level. And while we certainly do our best to bring people together through the GHWN Youth Hub, we certainly offer that platform. We hopefully can offer advice if you decide to get involved on the local and national level, but make sure that you have a place at the table to bring forward your own experiences and your own needs, because there is nobody else making up policies who understands better the realities that you face every single day. So that's just a call for all of you to engage in whatever platform you can to advocate for yourself, for other health and care workers, but for also for the health of people and our communities. And we do hopefully offer a few platforms to do that as a group through the GHWN Youth Hub. So definitely stay tuned to more events that are going to happen over the next year or so. I think I would like to stop here and just maybe briefly put in a plug for the Global Health Workforce Network that you're going to hear more about now. So you've been at the conference of the GHWN Youth Hub. I mean, I think you're probably very familiar with that, but you're going to hear about all the different other hubs that are doing as crucial work for the health workforce than we are, just in various different perspectives. So I will let you enjoy the video, and please stay engaged with us. And if you have any ideas about what you want to see brought up forward on the agenda, we are always here, and please feel free to share those ideas with us. Thank you, everyone.
All right, thank you so much, Colleen. We're just now going to have the different, we're going to have the video play that's going to be showing the different hubs that we have at the GHWN. Thank you.
Great. Hello, I'm Siobhan Fitzpatrick. I'm in the Health Workforce Department and I coordinate the GHWN Education Hub. So thank you very much for inviting us to provide you with updates on our work and how this intersects with the work that you are doing, and particularly the theme of planetary health. So I do have quite a fun update. We've published one of our key products in the last few months. So I've prepared a few slides, which I will use to share with you so that we can update you on the work that we've been doing in the Education Hub. So just a quick recap for those of you who are not familiar with the GHWN Education Hub. We have nearly 700 members from 90 countries. The map is a little bit faint in color, but I hope that helps show the distribution. So we do have a higher number of members from our English-speaking countries, but we do have representation from across all 6 WHO regions, and with different levels of engagement, but I think we have around 250 members who actively engage with us. So this is an online forum. It's a community of practice. So we very much value the group as an opportunity, a forum where we can consult and share ideas and test sort of the development of products, but also we encourage our members to interact with each other. This isn't just about the interaction with WHO, but also being able to share updates, events, ask questions. So it's a collaboration of networks of individuals with an interest in strengthening health worker education and training. And the link to join the site is at the bottom there. So one of the key products that we have been developing with the GHWN Education Hub is a global competency and outcomes framework for universal health coverage. So this is a technical product that WHO published in April of this year after 4 years. GHWN Education Hub has been instrumental in helping to inform and guide that work. So the framework is rooted in the principles of competency-based education, which, as many of you will know, this is a form of outcomes education, but not just specifying what is it that we need somebody to know, but actually why do we need them to know that? We start from what is it that somebody is going to do? What are the health needs? What are their health services? What are their scope of practice? Then you work backwards. So what is the role of that individual? What are their practice responsibilities? What are the competencies that they need to do that? So competencies are behavioral in relation to those tasks of health practice. And then we work back to, so what goes into the curriculum? What are the knowledge? What are the skills? So the framework really is guidance on 2 fronts. So the first, it sets out the competencies for all health workers, which I will talk to, and it also provides guidance on the process of strengthening educational design. So briefly touching on the theoretical side. So when we talk about competence, we are aiming for health workers who are ready for practice. So this is going to look different in different countries. So the framework does not state what the precise outcomes are, but rather here are the outcomes from which you can adapt and set a curriculum. So we talked about the competencies demonstrated through behaviors, and these enable the performance of practice activities. So the practice activities are things you would see in the job description. They might be what you are then certified as able to do, that if we think about it in terms of a task that you could delegate to someone else, a functional outcome of the program. But to be able to do that, you need to have the competencies, the decision making, the interpersonal skills. So these are what we think of as the behavioral competencies for all health workers. And you can see that holistic approach to competence, which is both of those. We need to know what it is that somebody is going to do, how it is that they're going to do it, before we can then work backwards to identify what are the knowledge they need, what are the skills, what are the attitudes. So the competencies for universal health coverage, we identified 24, which are key for all health workers towards the achievement of UHC. And within the framework, we then expand these into what are the behaviours that demonstrate those competencies? How do you know if somebody has them? But you will see that some of these competencies, although we do not mention the words planetary health, just like we don't mention the words specifically social accountability or human rights, but these are threads that run throughout the competencies. So things like collaboration. When we're thinking about planetary health, we need to collaborate with individuals, families, communities, but also intersectoral collaboration. When we're thinking about evidence-informed practice, effective communication, being able to sort of disseminate, share information around health promotion, placing people at the center of all actions. So these are the competencies towards the provision of health services, but through that, we are developing the competencies towards improving health services and interactions with planetary health. Decision-making, again, is key when we're thinking about the roles of individuals and the decisions they take, the impact on resources. So you can see that we have emphasized taking a systems approach to decision-making, taking into account the resource implications, the impact on finance, on the environment, on resource limitations, and so on. We think about those competencies as enabling all health practice. And you can see through this framework that we have emphasized not only the individual health services, but also those in population health. So again, when we're thinking about, we start from what are the health services? What are the population health needs? So with planetary health, we are seeing very much how those health services are changing, the presentation of disease impacted by climate change, impacted by the disasters and emergencies. So we can see the essential, the importance of preparedness and response and the mitigation measures, but you can also see advocacy, and we've intentionally included advocacy twice as practice activities. So advocacy for and with individuals, but also advocacy within population health. So these are very much, although we don't go into what are the things that an individual health worker should be advocating about, but we have said that advocacy is absolutely an area of practice that we would expect to see in the curriculum. We also talk about the management and organization responsibilities. So things like managing resources, documentation, as well as developing local policies. So the framework is very much sets out WHO's approach, recommended approach to competency-based education and training. And then to help utilize this framework, we as well as guidance around setting the curriculum. So just a few concluding thoughts. So we've published this framework on competency-based education, which is very much looking at the content of curricula. How those outcomes are set, however, is rooted in what are the population health needs, what are the health services. So very much thinking about how can planetary health be incorporated into the content of curricula. We need to think about, is it the impacts of climate change? Is it how those diseases and health needs are going to be changing and presenting differently? Or is it more about actually the decision making? We know that individuals have a huge impact cumulatively. So where, so for example, commissioning decisions quite often follow prescribing behavior. So if every individual health worker makes prescribing choices based on minimizing the impact on the environment, this then cumulatively has an impact on overall commissioning and then the development of different medications, for example. So we need to think about what are the areas within a curriculum where planetary health comes in, not as standard, but within the existing content. So really as a thread, as we have through the competencies, but as a thread throughout the curriculum. So the different areas that can influence that are obviously through the health services, through accreditation and licensing decisions, but also ensuring that we are incorporating those key competencies like collaboration, like systems thinking, decision making. We think about the continuum from learners to health workers, and this includes faculty, so all health workers, whether clinical or not. But individuals are absolutely powerful advocates. So when we think about the impact of decisions and sort of interventions for planetary health at the individual level, institutional and systems level, if individuals can advocate and ensure change at the institutional level and institutions at the systems level, there's this knock-on effect, the multiplier effect really of the impact of individuals. So we've talked about during the collaboration when we're thinking about antimicrobial resistance, for example. This cannot be achieved by the health sector alone, but we also want to think about the individual's rights. So where disasters and emergencies are occurring because of changes in the environment, we also need to ensure that those individuals, health workers, students, have the protection and the resources they need. And lastly, reflecting on the role of institutions. And of course, institutions, health facilities where students are training are users of resources, of water and sanitation, big suppliers of food and restaurants and so on. So what are the decisions at institutional level that can improve the relationship between the health facilities and the planet? So I will stop sharing my slides there. But thank you very much for allowing us to share the update, and I look forward to hearing what comes out of your meeting. Enjoy. Bye.
The Data and Evidence Hub aims at generating and sharing evidence and good practices in support of decision-making, advocacy, planning, and resource mobilization. It comprises over 150 experts organized around 6 technical working groups covering various areas such as education, equity, health information system, and labor market analysis. Work that we are doing is related to improving the classification of health and health-related occupations in alignment with the International Standard Classification of Occupation and in the context of the National Health Workforce Accounts, and also in the context of the One Health. That's looked at the human, the animal, and the planetary health. We all know that climate change is at stake. It's a reality that has to be taken into account in the work that we are doing. For instance, in delivering services, some communities are not really accessible. They are only accessible after days of work or in a seasonal way. Taking this into account, it will be important that in the training of health workers, and in particular those health workers that are currently being trained, the youth, it's important that these factors are taken into account in their training. The youth represent up to 50% of health occupations in some regions. They will be at a central position in addressing the challenges that we are facing with regard to the planetary health, but also with regard to the factors that are related to that planetary health that contribute to health inequality. We are working with the GHWN Youth Hub and the other hubs to generate evidence and support this kind of activities. We know that there won't be one hub that can cover all the topics. We know that one organization alone cannot do all the work. We call for collaboration between the different hubs. We call collaboration with other partners, because the climate change and the planetary health related factors will definitely impact the work that we'll be doing. It's a huge challenge ahead, and we are happy to play our share in our collaboration with everyone. Thank you.
Good morning and good afternoon to everyone. My name is Juana Paula Bustamante, and I lead the Health Labor Market Hub. Today, I'm going to briefly talk to you about the hub and the connection between the hub and climate change. So first, what is the hub on health labor market? The main objective of the hub is to advance knowledge in what? On the analysis on the health labor market, and facilitate the dissemination and implementation of approaches in a standardized way. What are we doing during 2022 and 2023? Well, we're planning the launch of the guidebook on health labor market analysis that has been already published at the end of last year. What is next? We want to advocate to ensure a harmonious approach for health labor market analysis. Do health labor market analysis training workshops in different regions around the world. Incentivize technical discussions, and to do this, we use the hub. So if you're going to be interested in this, just join the hub at the end of this presentation, and we're producing some complementary products to the health labor market analysis guidebook. So briefly, what is the relationship between the climate change and WHO health labor market framework? So the health labor market framework is this framework that you're seeing now in your screen. So we have the education sector of the labor force in the health sector, and we have the labor market dynamics. But on the top of it, you can see economics, population, and broader societal drivers. Here is where climate change enters. How does it enter? What can you think about it? So think about a situation, a recent situation. What's going on in the world? Floods, diseases, outbreaks related to climate change, something recent. Let's take Pakistan crisis. The Pakistan crisis is ongoing, and it's due to climate change, which is flooding and landslides. What are the consequences of these flooding and landslides? Damage on health infrastructure and shortages of health workers, and outbreaks of diseases. So how can we use and how can we analyze the health labor market and climate change? We have the supply and the demand of health workers. So in a climate change situation or crisis like the floodings right now in Pakistan, what can happen? Health workers are there's a specific supply of health workers, but not necessarily the ones that are needed in this crisis. So there has to be quick analysis to understand what are the competencies needed by health workers, which are the teams of occupational profiles that are needed. And on the demand side, what are the health needs? What is the impact? Is it seasonal or is it permanent? What are we seeing there, right? And the impact at the subnational level, because for instance, in Pakistan, 33% of the territory is damaged by floods and slides and other climate impact. But so we have to identify which are the subnational level. How do we connect this? How do we connect? So on the demand side, there's a spreading of disease, right? Which increases the demand for health services and therefore the demand for health workers. But we have said that this is depending on the occupational profiles, depending on the regions, depending on the outbreaks. There's an economic impact that will have an impact on the budget, and the budget will impact the available resources, and therefore, if there are available resources to hire or to redistribute health workers in the country. Health facilities have been damaged, right? So the health workers need the tools and need the infrastructure to work. Global warming, if we see not Pakistan, but we see in a broader sense, what's going to happen in the long term? So in the long term, some countries will have new health needs and that are emerging, new ones, and also new health needs because the climate change will bring some diseases that are in other countries with different weather. So also migration related with motivation. Health workers not necessarily will be motivated to go to certain areas where infrastructure is not useful. So all of these are the key questions that you can think about on health workers and climate change using the health labor market framework and the health labor market analysis. How can you get involved? Are you interested in these? Does these questions brings you some curiosity? Well, this is important. This is important because we need people trying to understand and analyze health workers and climate change, health workers and productivity, health workers in emergency situation, health workers bringing health services. And what can you do? You can think about understanding better, identifying channels through climate change impacting health workers, using which tools, the health labor market framework and the discussions in the hub. Why this is important? This is important because this brings evidence for policy making, for policy dialogue, but policy dialogue with whom? With different stakeholders. We have to always think that this information and these analyses have to get to different and a variety of stakeholders in different sectors that they need to integrate policy to HRH plans. And in this case, which are additional stakeholders that we should talk to in order to address these issues. If you're interested in the hub and on these discussions as a complementary issues that you work with, please do not hesitate on writing and joining the hub. You can just put your phone on that QR code and just join the hub. Thank you.
Good afternoon, everyone. My name is Catherine Keene. I'm a technical officer with the Health Workforce Department and co-chair of the Community Health Worker Hub. I understand that you are gathered to discuss planetary health. I think one of the fundamental elements that you'll want to consider is that those who are most affected by climate change are those who are furthest from the health system, the most vulnerable. When I think about the links that this has with the health worker occupational group with whom I work and with our hub's work, I know that there are two sides of this coin. One of them is the health workers themselves. And it is absolutely critical that we provide qualified employment opportunities for people from all areas and from all backgrounds and elements of diversity. CHWs definitively represent this. Further, as we're trying to extend health to those in greatest need, those most impacted by climate change, community health workers are among those elements of the health system that reach people who are most vulnerable, whether it's due to drought, which causes disease, malnutrition, etc., and the community health workers are bringing the services into communities, or whether it's the lack of proper water and sanitation. I can give one easy example. Malaria is one of the top killers of children under 5, particularly in sub-Saharan Africa. Through innovative integrated community case management, community health workers bring services for children with malaria, diarrhea, and pneumonia, as well as for malnutrition, and prevent child mortality due to preventable causes. What this means for the work that we do is that we want to ensure that community health workers are well connected to the health system and that they have all of the necessary training and are treated with respect and provided with support. So that goes through all of the elements of the 2018 Community Health Worker Guideline that was launched at the Primary Healthcare Conference in Astana. This includes pre-service education, certification, supportive supervision with appropriate supplies so that they're not at the very tail end of the supply chain, all the way through to salaries and decent work, as well as valuing their role as agents of the community who can both engage with the community to deliver health services and also build trust and deliver health messaging and understand the needs. Community health workers, when connected with other members of interdisciplinary health teams, are a very important health provider for those people who are most vulnerable and most impacted by climate change. What I would like to urge you to consider in this is thinking about what we've been doing from the GHW Hub, which extends from ensuring that community health workers are counted through data monitoring and accountability in government systems, that they are paid appropriately, that they're respected, they receive appropriate protective equipment, guidance, and training, and that they continue to be very well connected to the health system, even so that they can refer patients to that system. I want you to look at them as members of your team, and I'd like you to join us in advocating for the respect, the decent pay, the support, the supervision of community health workers. This is for our health, for the planet's health, and so that we continue to reach those who are most vulnerable. I thank you for your attention.
Sunny Bonani from Johannesburg, South Africa. I'm Shakira Shinara and based at the World Health Organization and supporting the Global Health Workforce Network, GWN Gender Equity Hub. The GWN Gender Equity Hub is hugely exciting. It brings together over 290 plus members from all across the world, comprised of organizations and individuals. And it's with great pleasure that I kick off our intervention today at this conference on behalf of the Hub, on behalf of colleagues. And really, you know, many of us are well aware, and the evidence shows that gender and age are highly intersectional issues. And it's on this note that we congratulate the Youth Hub for bringing us together under this important banner of youth, the climate crisis / planetary health, and sustainable collaboration for the future. The majority of the health and care workforce globally is comprised of women. That is, approximately 67% of the health and care workforce are female. We know that the healthcare system is thus really underpinned. It is upheld by women themselves, and importantly, they provide invaluable care and services. Yet, the female healthcare workforce continues to face various issues, including violence or high levels of violence and not being protected in several circumstances. This extends to the climate emergency or climate emergencies which are not gender neutral. Instead, climate emergencies are riddled with gender inequalities and they have severe gender implications. So, for example, what we see is during these sorts of emergencies, there are increased levels of violence, specifically gender-based violence. We see the damage to healthcare facilities, which affects the female healthcare workforce. We see the disruption of healthcare services, such as sexual and reproductive health services, which include family planning and contraception. This affects women's labor force participation / employment. What we also know is that during emergencies and climate emergencies, we're likely to see an increase in unpaid levels of care. Now, these are dire consequences, and I want us to really engage with these gender and age intersections throughout the conference. The health and care sector is growing and is the primary employer of women, and thus we cannot move forward without applying a gender lens to strategies, to policies, and to climate responses. These are all necessary components for us in order to weather the climate storms. And again, I leave you with the messages of increased levels of violence, damage to healthcare facilities, lack of sexual and reproductive healthcare services or disruptions, and increase in levels of unpaid care. On that note, it is with great pleasure to introduce the perspectives of various members of the Hub, including Maureen Ravenna, who's from Youth to Power at AMREF Health Africa in Kenya. We have Lena Sovland, who's also a member of the GHWN Gender Equity Hub, a clinical psychologist, may I say a very active member of our hub, a researcher and advisor, as well as to introduce and close out our intervention will be Dr. Michelle McIsaac, who's an economist at the World Health Organization. Peace out from me and keep on with the fight. We need all of you.
My name is Maureen Rovina. I work with Power to Youth under AMREF Health Africa in Kenya. I am also a GHWN Gender Equity Hub member. Kenya is feeling the impacts of climate change, and as it sows in, there's an increase in cases of child marriage due to loss of livestock and a source of livelihood. And as a result, the girls are sold off as a way to regain money back into the family. Climate change also drives conflicts among communities as they scramble for scarce resources. Therefore, women and girls face increased vulnerabilities of all forms of gender-based violence, including conflict-related sexual violence, human trafficking, and other forms of violence. Majority of these women are working in climate-sensitive sectors, such as agriculture, and with pre-existing inequalities, they have limited skill to shift to other productive sectors where climate catastrophes occur. Women have a responsibility of securing water for their family, and with climate change, they have to go very long distances to fetch water, which keeps them out of school and denies them an opportunity to engage in income-generating activities.
So my name is Lena Søvold. I'm a clinical psychologist and mental health advisor based in Norway. And I'm also a member of the Global Workforce Network. It's a Gender Equity Hub. And I'm currently co-chairing a working group on One Health, led by the One Sustainable Health Foundation. And this is closely related to planetary health. It is often a matter of what terminology you use, but the idea is that we have a multidimensional and integrative approach that addresses all dimensions of health, and also not only the health of humans, but also those of animals, environment, and planet, which is crucial in really transforming the health system and protecting the healthcare workforce, because they will be affected by lack of this integrative approach and understanding to health. And without this, it will be very hard to achieve the sustainable developmental goals. So we're looking forward to publish a review next year on the integration of health equity and how this area can inform the One Health approach and its outcome. And we will also make some recommendations in regards to how it relates to policy, to taking better care of the health and well-being of citizens, but also essentially the healthcare workforce. Thank you.
Hi, I'm Michelle McIsaac, an economist at WHO and the co-chair of the GHWN Gender Equity Hub. On behalf of the Hub, I thank you for this platform to share our perspectives on the important intersections between gender, age, the health workforce, and climate change. We at the Gender Equity Hub wish you a fruitful conference, and we're looking to you as the powerful leaders to drive the much-needed dialogue and advocacy on this issue.
All right, thank you so much, Catherine, for sharing that, and for all the speakers who took the time to share with us more information about the Hub. So next, we're going to just have a small activity where we'd like to get a few input from you guys. So if you just check on the chat, we have a link that we've shared that will lead you to Menti, and you'll be able to respond on the questions that you're seeing on the screen. So the first question that we have is, what are your key takeaways from this conference? So we already see the feedback coming in. The first one we have is intersectoral collaboration. That is great. Please share what you've taken away from this conference. Another one has just come in, partnership and importance of youth. That's right. So if you're having any challenges with sharing, you can just let us know. But then it's very direct. You just click on the link. If you have to use a code, you just use the code that we've shared with you. So I see the next one, youth should be at the forefront and unafraid to make a change. That is very correct. The next one we have is working collectively. I agree with you very much. And that's the main aim of One Health and Planetary Health. We all need to work collectively so that we can achieve better outcomes. I'm looking forward to more responses. If you're having any challenges, you can just let us know. Or maybe if you'd like us to share the link again, we can. So we have another comment here again from one of the attendees. I learned from Winnie to contribute to my society, especially the young ones. That is very correct. And I believe also someone else mentioned something on matters to do with the environment. It's good to teach young people starting from an early age so that they can grow with it consciously. Right, thank you so much for the responses. We can now move on to the next question, maybe, Shali. All right, we have another one, include youth in conversation. Another one is importance of animal health. Thank you so much. All right, because of time, we'll just move on to the next one. What action are you planning to take for improving planetary health? What action are you planning to take for improving planetary health? So just on the same link, you'll be able to see the next question. You could share your responses there. Nice. So I see someone says publish papers and advocate for better inclusion of planetary health in health systems. So also just remember that we also had one of the participants who shared his email, and he said that if you'd like, you can always just contact him and share any papers that you have in mind or articles for publishing. The next one is educate the young ones in my community. Yes, that's good. That's very important. And then we have write paper. Yes, that's really good. Then we also have advocate at my community. That's very good as well. Any other responses? We also have someone saying, I will intensify my action on educating the locals in my community on how man action like. I'm not sure if I got that correctly, but then how man action like bush burning can negatively impact our environment. Thank you for that. That's very correct. We also have someone who says, learn more on food system, important issues on planetary health, which I didn't know much about. Now, because of this conference, I've been able to know more. Someone else says, influence engineering, particularly renewable energy departments at the medical school, to advocate for more courses that teach more on planetary health, I think, or environment.
Hezron, I think you're freeze. Is it only me? Hezron, I think you're muted. Welcome back.
Sorry about that. I think I got disconnected for a moment. Sorry.
No
All right,
problem.
I see someone
Welcome.
else mentioned, be involved with communities such as the Global Health Workforce Network, Youth Hub. Yes, you're very much welcome. Shirley, I think maybe we could move on to the next question. Have I covered all the points? Yes, I think I have. All right, thank you. Then finally, what did you like the most during these 2 days? What did you like the most during these 2 days? So just on the same link, you could share what you really liked about the 2 days of the conference. Yes, I totally agree with you. The speakers, they were also good and very experienced. Again, speakers again, and the amount of knowledge that you're able to obtain, that's very good. Someone says, I enjoyed all the sessions and great job to the organizers. Thank you so much. For the focus on youth, that's very true. Thank you for the feedback. Okay, another person says information on how to get involved. Yes, I think this was particularly said also on the first day of the conference, and also some of the presenters today have also mentioned on how you can get involved in different things relating to planetary health. The networking session, yes, for those who were able to attend the networking session, it was really amazing, and we're able to share a lot of things. Then also someone says being able to meet so many people from around the world and feel a sense of hope and camaraderie. I'm not sure what that means. with so many that strive to contribute to planetary health. Thank you so much. Finally, we have the interactive sessions. Any more feedbacks? Thank you so much for participating in that short activity. So Shirley, I think maybe we could end because I think from the average responses, we've been able to get some feedback. Thank you so much for coordinating that. So we are now going to move into the closing remarks, which I'll be doing. So first of all, I'd like to thank you all for joining this conference. It has been a pleasure hosting you, and we'd like to also thank the speakers who were able to make time and join this conference. I believe they've been able to share valuable insights, and we've been able to learn. And for the participants, we really thank you so much for joining. We really hope that you've been able to get a lot of value from this conference. And then a big thank you to the team that organized this conference for the much dedication and enthusiasm that they put to make this event happen. So we also pleased to inform you that the conference was well attended with different stakeholders that we've invited, from government officials, policymakers to industry practitioners and experts. and also the rich panels that we had. I believe we also got insightful content. So also for the networking sessions, I believe we're able to interact and share ideas and probably look ahead on how we can work together. So this conference was recorded, and the whole full recording is going to be shared on our YouTube channel. So I'd like to encourage each one of you to share the link with your colleagues who are unable to attend. And also, if you need to also get back to listen to things that the speaker said, you're free to do so. So I'd like to ask my colleague, Shirley, to just share the link to the YouTube channel. Don't forget to subscribe, because that's the only way you'll get notifications and stay updated with everything that is happening at the Youth Hub. Then we also have different social media channels, and that is Facebook, Twitter, YouTube, Facebook, Twitter, and Instagram. I believe, I think Shirley has also shared that on the chat. So just remember to follow. For Instagram, we also have a page, and that is at GHWN Youth Hub. Please follow whichever channel that you're in. Please follow so as to get the updates. Then just a reminder that today is World Suicide Prevention Day. I don't know how many of you were aware, and the theme is creating hope through action. So wherever you are, let's create awareness, inspire confidence, and bring light in people around us as we also celebrate and create awareness on the day. So with this, allow me to close. Yesterday's sessions and today's session have been really enlightening and inspiring, and it's now up to us to take action. And remember that great things are done by a series of small things brought together. I believe one of our speakers also mentioned that it's about bringing the blocks together until you bring something, you create something big. So in whatever space we are in, let's participate in every small thing that can result to positive climate change. So with this, I'd like to bring the conference to a close. Thank you so much for attending. So I'd like us to just take a screenshot of a photo of each one of us. So if you're able, please just turn on your cameras. We just do a quick group photo.